Dr. Aaron, that part I will teach. Okay, don't worry. Okay, that part will come and I will teach that part. Okay, so we can continue now. All right, see the first chapter which I have taught you, from the general part of psychiatry, you can anticipate 1 or 2 questions for sure. Okay. Okay, chalo, now we are going to start the most important chapter. Okay, that is schizophrenia. You are able to see my screen? Am I audible and visible? Yes, all right, chalo, theek hai. Very good, very good. All right. Okay, see, this is now, now I think this is on YouTube also, no? This is live on YouTube also. All right. Okay, chalo, see here. See what kind of question. First of all, please understand that what kind of question they will be asking you from schizophrenia. First of all, okay, they will be asking you one-liner question, maybe one-liner question. But apart from that, like mostly I'm expecting that there will be, okay, there will be clinical question from schizophrenia only. Okay, fine. Sometimes they are asking that, okay, sometimes they are asking related to, related to scientists who did what. Yeah, always understand that first of all, okay, see, first of all, there was the first scientist who is known as the father of modern psychiatry. He is actually 𝗵𝗿cie𝗂𝗽. See, in the beginning, actually, there was no name like schizophrenia in the beginning. So, okay, there was psychotic symptom, there was depression, there was mania. So they classified all these symptoms into one, okay, dementia praecox and manic depressive illness. Okay, dementia praecox and manic depressive illness. What does it mean? Okay, dementia, okay, and the praecox. Okay, dementia was seen in the praecox, means actually young age. All right, and after that, along with mania and depression, so he classified all these symptoms into dementia praecox and manic depressive illness. But what is happening here? So basically, 𝗵𝗿cie𝗂𝗽 was saying that this is all about young age. But see, even after 45 years of age, also this is seen that some patients are having a schizophrenia, which is called as late onset schizophrenia, right? Late onset schizophrenia. Then when you see that after 45 years also, if there will be schizophrenia, then dementia praecox was not relevant to the symptoms. Fine. Okay, no? And after that, there was one more scientist. His name was Eugen Bleuler. He coined the term schizophrenia, which replaced dementia praecox in scientific literature. So please remember that repeatedly asked question: who gave the theory of schizophrenia for the first time as dementia praecox? Okay, like he was 𝗵𝗿cie𝗂𝗽. But if they are asking who coined the term schizophrenia, this is Eugen Bleuler. This was coined by Eugen Bleuler. Who coined the term psychiatry? See, it was coined by John Christian Ryle, right? Okay, fine. See, and after that, okay, Eugen Bleuler. So, like, first of all, he coined the term schizophrenia, and also he gave 4 A's symptoms of schizophrenia, which I will be explaining you soon. Okay, no? And next, okay, one more scientist was there. He classified all symptoms as first rank symptom. So how many first rank symptoms are there? First rank symptoms go. See, like examiner, okay, sometime examiner will be writing FRS. What does it mean? See, this means first rank symptoms. So how many first rank symptoms are there? Okay, number is 11. Yeah, but I will make it very easy for you so that you can recall it. All right. Okay, so who gave first rank symptoms? Repeatedly asked question. This is, okay, like it was given by Kurt Schneider. So this is also called as Schneiderian. Okay, Schneiderian first rank symptom. Okay, Schneiderian first rank symptoms. Right. And after that, see what is happening. Apart from psychotic symptoms, we can also see some physical symptoms, motor symptoms. Motor symptoms in schizophrenia is called a what? Catatonia. Catatonic symptoms we will be learning very soon. Catatonic symptoms. Who gave this one? Who coined the term? It was coined by Carl Okay, fine. Okay, now the next is overall. How much is the lifetime prevalence rate of schizophrenia in the general population? Okay, general population is only 1%. Only 1%. But if they are asking that, suppose, okay, like see, like is there any, like if there is any so predisposing factor like something like familial or what? Yes. Okay, this is highest prevalence rate is seen in monozygotic twins of a schizophrenic patient. Monozygotic twins में कितना होगा? Okay, monozygotic twins. Yeah, approximately 47%, right? 47%. Okay, remember this part that. Okay, remember this part that. Okay, so even so, highest prevalence rate is seen in monozygotic twins. Okay, sometimes they are asking related to genetic factor, that chromosome association. Which chromosomal association? Very good, Dr. Likhita, very good. Answer me, please. Yes. Chromosome number, like see if there will be mutation and deletion, okay, like if there will be some problem in which chromosome, okay, this is the chromosome number 22, okay, 22, okay, 22. So which is also associated with 𝗴𝗿𝗺𝗺 facial syndrome, which is also known as the 𝗙𝗵 syndrome, right? Which is also known as the 𝗙𝗵 syndrome, which is also known as 𝗴𝗿𝗺𝗺 facial syndrome. So they are asking that, is there any risk of development of schizophrenia, like in a patient who is suffering from 𝗙𝗵 syndrome? Yes, approximately 30%, right? All right. Okay, fine. Now please understand that. Okay, now please understand that what are the 4 A's of Bleuler? Repeatedly asked question. Whenever they will be asking you one-liner question, no, which of the following is not a schizophrenic symptom? Which of the following is not a Bleuler symptoms of schizophrenia? A stands for autism. Autism means, I hope you remember, autism means what? See, autistic behavior, lack of social smile, lack of, okay, there will be poor eye contact. There will be poor eye contact. There will be poor eye contact. Dr. Farooq, this is up to 30%, 30. Okay, no? Okay, there will be poor eye contact and a poor eye contact, lack of social smile, inability to make friends, See, when I was taking your class at that time, I have given you the example of, okay, that story I shared with you, right? A beautiful mind. Okay, Professor Nash, right? Professor Nash. So that is actually what? Autistic behavior. All right. Ambivalence. Ambivalence means what? Ambivalence means what? Suppose if a schizophrenic patient is standing on the road and he is not able to, okay, so he is standing here. He is not able to take a decision that he should go to right or left. He will be, okay, he will be standing there for half an hour. He will be thinking, okay, okay, whether I should go to right side or left side, right side or left side. Basically, a person is not able to take a decision and he will be wasting so much time. This is called what? Ambivalence. Affect disturbances. What is the meaning of affect? Affect means what? Mood means what? Emotion. There will be emotional disturbances for sure, right? No, like depression or euphoria, right? Hope there should not be ambivalence while writing the exam. Dr. Mandala is writing. Chalo, good one. Good one. Yes, there should not be ambivalence when you are solving the question. There should not be, right? A or B, nahin. 100%. There should be sure shot, right? Chalo, fine. Association disturbances. Association means what? Like loosening of association. Loosening of association is what? Formal thought disorders. Formal thought disorder, which I already have explained you, right? Affect means what? Affect means mood, means emotional disturbances, right? Emotional disturbances. So basically what I'm telling you that in a schizophrenia patient, as per Eugen Bleuler, yes, there will be a formal thought disorder, especially neologism and all I have taught you, right? And a formal thought disorders, okay? Affect disturbance, emotional disorders, ambivalence. Ambivalence means what? Indecisive, not able to take a decision. Autism. autistic behavior, lack of social smile. When that person will be talking to someone, he will be having poor eye contact. He is not able to make new friends. That is autistic behavior, right? So 4 A's means what? Autism, ambivalence, affect disturbances, and association disturbances. Sometimes they will asking you in this manner that which of the following is not a symptom of Bleuler symptom of schizophrenia. Option में क्या क्या रहेगा? Option में रहेगा autism, ambivalence, affect disturbances, and aggression. What is your answer? Aggression, simple, right? This is as easy to understand, right? Very good, very good. Okay, so in this way you have to remember 4 A's of Bleuler's repeatedly asked question in MCI. Next we are going to learn first rank symptoms. 11. See, like this looks very difficult and very big, but I will make it very easy for you people. And repeatedly asked question, they will be asking you which of the following is not a first rank symptom of a schizophrenia, right? A first rank symptom of a schizophrenia, right? देखो बहुत easy है याद करना, है ना? बहुत easy है. See, there will be 3 thought phenomena. I already have explained you, right? When I have taught you that whenever there will be thought insertion, patient is thinking that someone is inserting thought in his mind, right? Now, the thought withdrawal. Oh, someone can withdraw my thoughts. Oh my God, someone is going to broadcast my thought. So insertion, withdrawal, and broadcast. All right. Next, there will be 3 made phenomena. Made phenomena means what? Someone has made you to do something against your will. Against your will, right? Against your will means I made you to slap him. I made you to kick him out, right? Means I forced you to do like this against your will. If you are supposed to do something, this is what? Okay, now this means what? Okay, now so means I made you to do something like that, okay, or something else, right? Okay, fine. So what is happening here? देखो यहाँ पे. So when I say कि made volition means what? Against your will. Against your will. Easy to understand. The same example which I have given you. Suppose if a patient is admitted in your department, he is sitting on the bed, suddenly he is inserting his hand in the running fan, and after that, okay, no, after that, when nurse is asking, why did you do like that? Why did you do like that? Okay, no. That guy who is sitting over there, he can control my action. He can control my action. He made me to do like this. He made me to do like this. Okay, so now you can ask me then how to differentiate it from thought insertion and made volition. Please understand that this is only thought. Only thought. Action wo kare na kare, that is different thing. This is only thought, and this is action. This is action. I hope this is clear to you now, right? Now, all right. Fine. Made affect. Made affect. What does it mean? Made affect means what? Affect means what? Someone else is sitting there who can control my emotion. Who can control my emotion? Patient, suddenly she is laughing. Suddenly she is crying. Okay, when nurse is asking, why do you look, okay, why you are doing like this? No. She is having remote control of my emotion. Anytime she can make me cry, anytime she can make me laugh, she controls my emotion, right? Emotional labor, all right? Made impulse. Impulse, that kind of urge is there. Do it, do something like this, right? Made impulse. What is happening here? Okay, patient was having juice. Okay, I'm having Coca-Cola right now. Okay, no? So patient was having juice. And कुछ और ना समझ लेना इसको, हाँ? है ना? तो क्या हुआ यहाँ पे कि patient is having juice, and suddenly when sister is coming, when nurse is coming, and suddenly he's going to throw it. And suddenly he's going to throw over the nurse. Hey, why did you do that? No, I don't know what happened. I was having that kind of urge. Okay, someone else is doing like this. Okay, when it happened, I just thrown it. I'm really sorry. This is called a what? Made impulse. All right. Next is called a what? Sir, pura Coca-Cola. Yes, of course. I'm tea addict. Sometimes I take Coke. That's it. Okay. What about this one? There will be 3 auditory hallucination. What I have taught you so far, there will be 3 thought phenomena. There will be three made phenomena. There will be three auditory hallucination. One is called as what? Voices are going. Patient is sitting here. He can hear that, okay, there are three voices. One person is saying that he is so bad, he is so fat, he is so ugly. Okay, one person is saying he is so bad. But second person is saying he is so ugly. Third person is saying what? He is so fat, he's so ugly, he's so bad. So what patient is standing here, he is listening to everyone. Oh, voices are arguing about me. This is what? Voices arguing. So now we tell you what kind of question they're asking that. See, in this question, he is so ugly, he is so fat. Who is he here? Who is he? He is the patient. He, she, it, they. This will be first person, second person, or third person. See, first person, English literature, I, me. First person, you. Second person, he. Okay, there is a third person. As per English grammar, fine now. So voices are going. This is also called as the third person hallucination. Okay, now they are asking in third person hallucination, who is considered as third person? Patient. Okay, Dr. Anusha, you are asking, sir, please differentiate thought insertion and made impulse. Please understand that, okay, when I talk about only thought, either it is insertion or whatever it is just the thought. Whether he is performing or not, no problem. Just the thought. Someone is inserting thought. But if he is going to perform it, that will be made phenomena. That will be action phenomena. Right now? So action is made, only thought is the thought phenomena, right? I hope this is clear now, right? Okay, fine. So in voices are going is also called as third person hallucination, right? Third person hallucination. Third person, who is third person here? Patient. Now voices commenting on patient's action, What is happening is, suppose the patient is getting ready for the office. Now he's getting this kind of voices now. Okay, so he is listening. Oh, now he's wearing his shirt. Now he's wearing his tie. Now he's going to wear the perfume. Now he's wearing his glasses. Where his glasses? Now he's going to tie his shoes. Oh, now he's going to take his bag. After that, okay, now he's going out. All right. Okay, now he's moving towards lift. So whatever he is doing, he will be hearing the commentary for sure. This is called the commentary type of hallucination. Now he's going towards lift. Okay, now he is staying on 15th floor. 15th floor, right now, 15th floor. Okay, when he's going to press the ground floor, after that, since morning to night time, he is just hearing the commentary. After a certain time, he will start accepting it. After that, he will start obeying it. After that, that voice will say, hey, why you are going to ground floor? You should press, okay, the top floor. Okay, now he will follow it. 45th floor now, 45th floor. Now he's going the top. Okay, now see, okay, now you come out, he will go out. Now he is on the roof, 45th floor. See, you are going to ground floor. See the people over, these are small, they look like insect. You are not supposed to stay with these, okay, with these small people. Now, man, you are a Spider-Man. You are Superman. Jump. You should fly in the sky. And he will fly. He will jump. And then suicide. So commentary type of auditory hallucination is most dangerous type. Remember, this is your question. Okay, this is your question. All right. Yes. Okay. Now the last one is which one? Audible thoughts. Whatever he is thinking, he is hearing also. He is thinking that I should go out for the lunch. Oh, he's going out for lunch. I should go on date. Oh, he's going on date. So whatever he is thinking, he will hear it. This is called as audible thoughts. This is called as thought echo. Thought echo. See, all 9 symptoms completed or not, there will be 3 thought phenomena. There will be 3 made phenomena. There will be 3 auditory hallucination. Easy to understand? Fine. After that, somatic passivity. See, this is a kind of feeling, sensation. Okay, now patient can feel it. What is happening here? This is called as visceral hallucination. Visceral hallucination. Visceral hallucination. What does it mean? What is happening here? Patient is having a spasmodic contraction. Patient is having pain in his abdomen, and he is thinking that a person who is sitting in Washington, he is sending some rays from there. He is sending some radiations. He's sending some radiations, and because of that I'm having this abdominal pain. This is called as passivity, somatic passivity, visceral hallucination. Last is delusional perception. What does it mean? With a normal perception, patient is having one delusion. With a normal perception, one delusion is associated. Patient is saying that, okay, whenever I look at my phone, oh my God, I'm okay. Whenever he is looking at the phone, with the normal perception, one delusion is associated. Oh my God, I'm okay. Oh my God, I'm again. Easy to understand? Now, ek kaam karo. All of you, please write in the chat box all 11 symptoms. All 11 symptoms. If you are able to recall here in the classroom, you don't need to worry them. Okay, there will be 3. बिना देखे हुए, without seeing it, please write, or wherever you are, please एक बार recall करो, revise करो एक बार, अपने आप में बोलो. There will be 3 thought phenomena, है ना? There will be 3 thought phenomena like insertion, withdrawal, and broadcast. There will be 3 made phenomena, means your actions are being controlled, right? है ना? So made volition, made affect, made impulse. There will be 3 auditory hallucinations like audible thoughts, voices arguing, and commentary type of hallucination, right? And then somatic passivity, delusional perception. So now the question is, okay, what is the meaning of delusional perception? Is this a type of this is a type of secondary delusion or primary delusion? Secondary hai ya primary hai? This is the question. Secondary hai ya primary hai? Please understand that any delusion which is associated with or which is originating in schizophrenia, directly schizophrenia, that is called the primary delusion. Primary delusion. Very good, Dr. Likhita. Very good, Dr. Aniket. Very good. Okay, now what about secondary, related to some other psychiatric disorders? Like suppose if a person who is suffering from depression because of the severe depression, in moderate to severe depression, yes, there can be delusion, right? Now, so related to other disorders, if there will be any delusion, okay, because of depression, now delusion is developing, that will be secondary. Remember it, schizophrenia mein jab bhi delusion hoga, this will be primary. Okay, all right. Okay, now the question is that, see, overall in schizophrenia there will be 2 types of symptoms. One is called as the positive symptoms, second is called as negative symptoms. Repeatedly asked question. This is related to pathology of schizophrenia. Okay, this is related to pathology of schizophrenia. You are not going to do any mistake here. See what is happening here. What are the positive symptoms? If delusion and hallucinations are there in a schizophrenic patient, this is called as what? This is called the positive symptoms. Okay, positive symptoms means what? Delusion and hallucinations. Delusion and hallucination. Okay. So the question is that why it is called as positive? Why delusion and hallucination? You can ask me, sir, delusion and hallucination, these both are negative words. Why you are using it here? Please understand that. And what, okay, the example which I have given you about Professor Nash when I was taking your class, right now, see, like he responded well to medication. He had delusion and hallucinations, right now. Fine. So please understand that they respond well to medication. Good prognosis is there. Remember these 2 points. That's why delusion and hallucination, these are called as what? positive symptoms. Now the question is why? Okay, why there is development of the positive symptoms? Please understand that there are 4 dopaminergic pathways. Okay, there are 4 dopaminergic pathways in our brain. 4 नाम याद है सबको या भूल गए सब? बताओ एक बार. See, there are 4 dopaminergic pathways in our brain. Batao basic anatomy, neuroanatomy. Okay, one is called as, first is called as the mesolimbic tract. Mesolimbic tract. Second is called as what? Mesocortical tract. Third is called as nigrostriatal pathway. Nigrostriatal pathway. Fourth is called as what? Tuberoinfundibulum pathway. Okay, yes, these are very, very important points which we are going to learn now. See, always remember that whenever there will be, see, please understand that how many neurotransmitters are responsible for schizophrenia. Most important is dopamine and then serotonin. Dopamine and serotonin. So first of all, let's talk about dopamine. Increase of dopamine in mesolimbic tract will cause the positive symptoms. Increase of dopamine in mesolimbic tract will give rise to the positive symptoms. Decrease of dopamine in mesocortical tract will give rise to negative symptoms. Please remember these 2 points. Okay, no, please remember these 2 points. These 2 are extremely important. If I ask you one question, that there is a patient who is having psychotic symptoms along, okay, he is having psychotic symptoms, he is having avolition, he is having alogia, he is having anhedonia. Now you tell me, is there increase of dopamine or decrease of dopamine? Can you answer me this question? Yes, so, okay, see, very good, very good. Please understand that, okay, negative symptoms like avolition, alogia, asociality, affective flattening, right now? Okay, fine. Okay, now if I ask you, like, suppose if a schizophrenia patient is there, he is having delusion and hallucination. Now you tell me there is increase of dopamine or decrease of dopamine? Yes, increase of dopamine in which tract? In which tract? Increase of dopamine in mesolimbic tract. Because of that, patient is suffering from delusion and hallucination. Delusion and hallucination. Easy to understand. This much is clear to all of you? This much is clear or not? Okay, see, positive symptoms means what? Increase of dopamine in mesolimbic tract, positive symptoms. Decrease of dopamine in the mesocortical tract will give rise to negative symptoms. Easy to understand. I hope this is clear to all of you. So why these are called as the negative symptom? Because, okay, they respond poorly to medication, bad prognosis. Very good. Now we are going to learn about all motor symptoms. Okay, now see, there are approximately 15 motor symptoms. Okay, 15 motor symptoms in schizophrenia. 15. And sometimes they are asking that, okay, which type of motor symptom? Okay, which of the following is called as a catatonic symptom, which is seen in schizophrenia? Please remember that all these are called as what? Motor symptoms. Or if I have to write one word, that is called a catatonic, catatonia. All right, shall fine. So when I say stupor means what? Like patient is not moving at all. Right? Patient is not moving at all. Okay. Okay, so when I say stupor means what? Immobility. Patient is not moving at all. 𝗵𝗲 flexibility. 𝗵𝗲 flexibility means what? There will be flexibility like wax. If patient is sitting here and if you are asking him, okay, put down your hand, he is not keeping it down. So when you are going to push it like this, okay, so he will be doing like this. Okay, no? Or if he is standing, then he will be doing like this. Like a wax, like the wax. 𝗵𝗲 flexibility, right? Okay. 𝗙𝗵𝗄𝗃. See, this is the neurological symptom. This is the neurological symptom. Okay, this is the neurological inhibition of movement. What is happening here? You are taking, okay, you are taking medical examination. You ask the patient, okay, now abduct your shoulder. After that, he will be like this only. So there will be neurological symptom, okay, during the examination, and after that, he will be like this only for half an hour. Okay, this is called the 𝗙𝗵𝗄𝗃, maintaining a posture for the longer time. And this is not exactly the posture. Posturing can be any different type of posture. See, whenever there will be neurological blockage like this, okay, no, fine. So now I want to emphasize one more important word here, that is called as cataplexy. How to differentiate catalepsy and cataplexy? Dr. Anusha, very good. Dr. Chantu, very good. Very good. Very good. All of you are doing great. Yes. See, please do not get confused in these two words, because examiner will play with your knowledge. Catalepsy, which is a motor symptom in schizophrenia. Cataplexy, what about P word here? Plexy, sudden loss of muscle tone. Where do you see? In narcolepsy. Narcolepsy, sleeping disorder. Patient was standing, he was talking to you. Suddenly there is loss of muscle tone of leg and he fell down. Fine. Sudden loss of muscle tone, that is called as cataplexy. Cataplexy, which is seen in narcolepsy. This is not catalepsy. Remember it. You are not going to confuse it. Okay. Fine. उसके बाद से क्या होता है कि नेक्स्ट वर्ड है पोस्चरिंग. यू आर मेंटेनिंग अ पोस्चर फॉर द लॉन्गर टाइम. रैगिंग करते थे ना, जब भागड़ बिल्ला जैसा बन जा, दीवार से चिपक जा, राइट? ओके, गो एंड स्टैंड अगेंस्ट द वॉल लाइक अ भागड़ बिल्ला. भागड़ बिल्ला इज एन एनिमल, राइट? एंड यू आर मेंटेनिंग अ पोस्चर लाइक दिस. ओके, नो? So maintaining a posture, that is called the posturing. How to differentiate it for the catalepsy? That is the neurological block, है ना? Like you ask the patient to do like this, after that he is like this only. Okay, so that is called the catalepsy. Okay. Hyperactivity or excitement. Yes. Okay, schizophrenic patient can be very much hyperactive. Automatic obedience. Suddenly, okay, last night he was very much aggressive, but suddenly after getting up in the morning, what happened to him? Okay, something magical. Whatever you are asking, he's accepting everything. He's very much obedient, right? Like Shravan Kumar, right? Now, automatic obedience. Negativism, yes. Okay, mimicking examiner's speech. Okay, Dr. David Jones, all right. Hana? Okay, mimicking examiner's speech, mimicking examiner's action. Echolalia, echoppraxia, echolalia, echopraxia. You are talking to your patient, what is your name? And he is also repeating your word. Okay, what is your name? Hey, I am asking. Hey, I am asking you. Hey, I am doctor. Hey, you should answer me. Hey, you should answer me. Whatever you are speaking, patient is also repeating. That is called what? Echolalia. However, you are moving your hands, the patient is also mimicking your action. Echopraxia, praxia, making odd facial expression. Patient is sitting in front of you, is making odd facial expression. That is called as, that is known as a grimacing. Grimacing, right? That is not a grimacing. Grimacing. Very good, very good. Okay. So far, everything. See, all these. See, why I'm explaining you all these, because these are repeatedly asked questions. Okay, what about stereotypy and mannerism? Stereotypy and mannerism. See, these two words are there which we have to differentiate. Yes, these are the motor symptoms of schizophrenia, Dr. Chantu, right? These are the motor symptoms, and motor symptoms, physical symptoms, not psychotics and motor symptoms, right? Okay, fine. Okay, see what is happening here. Whenever there will be a spontaneous repetition of odd and the purposeless movements, odd hai, purposeless movement, that is called a stereotypy. Odd but purposeful movement. It is called as a manner, good manner. What is happening? Suppose every time I'm doing like this. So this is what? A stereotypy or a mannerism? But what is this? This is stereotypy or mannerism. See, this is odd for sure. So like, is there any purpose of this? This is the purposeless movement, stereotypy. But every time I'm doing, Okay, like every time I'm saluting the passerby, every time I'm saluting, see, this is odd every time, but this is actually a purposeful movement. No? I know. So remember one word here. If there will be purposeless movement, stereotyping. Purposeful mannerism. Easy to understand? Fine. All right. Ambitendency. Ambitendency means what? Patient will be having what? Okay, like patient will not be able to take the decision what to do, what not to do, right? Okay, fine. Next is called the 𝗲𝗃𝗃. Okay, 𝗲𝗃𝗃. What does it mean? Resistance to passive movement. Patient is sitting like this. You are asking me to put your hands down. Okay, like is not keeping it down. When you are going to force it, he will also resist it. He will also resist it. This is called as what? 𝗲𝗃𝗃. 𝗲𝗃𝗃. Okay, last is the perseveration. Perseveration. See here, we have learned in chapter number 1, right? In general psychiatry. Perseveration means what? Unnecessary repetition of anything, answering and all. Here I'm talking about movement, right now. Okay, so once you shown your tongue, okay, show me your, okay, you are asking your patient, show me your tongue. Okay, fine. After that, whatever you ask him, where do you live? What you had in morning? So who is your friend? Tongue in and out. Unnecessary repetition of movement is called the perseveration. Now, ek kaam karo, write in chat box all 15 symptoms. How much you are able to recall? Stupor. Okay, very good. 𝗬𝗏𝗃𝗃 flexibility. Very good. See, like even if you are not writing in chat, you please revise it by yourself. Okay, mannerism, stereotypy. Very good. Okay. Perseveration, all right. Negativism, yes. 𝗲𝗃𝗃𝗃, 𝗵𝗵𝗃𝗃, 𝗵𝗿𝗄𝗃𝗃, catalepsy, right? Posturing, and ambitendency. Very good, very good. Okay, making odd facial expression is called as what? Making odd facial expression is called as what? Okay, that is called a grimacing. Grimacing, very good. Okay, odd and purposeless movement is called as what? Stereotyping. Odd and purposeful movement is called as what? Mannerism. Mannerism, right? Easy to understand? Okay, what is the meaning of the cataplexy? We see here or not? Yes. Okay, cataplexy is seen in narcolepsy. Narcolepsy, right now? Fine, very good, very good. Here we see what? Here we see the catalepsy. Catalepsy, very good, very good. Okay, fine. Now, okay, dekho. Okay, now you tell me, suppose if a person, okay, now you tell me if there will be increase of dopamine in mesolimbic tract, there will be positive symptoms or negative symptoms? Very good, there will be positive symptoms. If there will be decrease of dopamine in mesocortical tract, it will be what? There will be negative symptoms for sure, right? Chalo, negative symptoms is having bad prognosis or good prognosis? Bad prognosis. Very good, very good, very good. Okay, chalo, aa jao diagnosis pe. How to diagnose the case? Okay, one more important point I want to tell you here that, see here, so far we have been following ICD-10. Okay, no, ICD-10. So sometimes see like ICD-11 actually, no? ICD-11 is the new classification now, okay, but it will be implemented by 1st January 2022. Please understand that there is some update related to catatonics, related to catatonia. Earlier, only like catatonia was only these symptoms. Earlier, catatonia was considered only as a symptom, but now catatonia is a different entity. This is a diagnosis now. This is a separate diagnosis now. Catatonia. This is no more only symptom. This is a different diagnosis. This is a new entity. Okay, so there can be the catatonia because of some drugs, or there can be catatonia because of some diseases like schizophrenia. Okay, chalo, fine. Ambitendency means same thing. He is not able to take a decision of what to do, right? Okay, 𝗲𝗃𝗃 means actually passive resistance. The passive resistance. Okay, passive movement pe resist karega. See, if we are going to force him, okay, do like this, but he will be resisting like this. Okay, no? Resistance to passive movement is called as Geigenharten. Okay, chalo fine. How to diagnose the case? Okay, please understand that. See, out of these 5, equal to or more than 2 symptoms should be there. And at least for 1 month, one of them should be either delusion, hallucination, or formal thought disorders. Okay, but these 5 symptoms, okay, these 5 symptoms, okay, so the question what they're asking that, okay, see, how much is the minimum duration to diagnose a case of schizophrenia? Minimum duration is 6 months. 6 months. 6 months is the duration to diagnose schizophrenia. Okay, fine. So what are the types of schizophrenia? Okay, please remember this part. Here you will be having confusion, but I will make it clear. Okay, fine. See, different types of schizophrenia, repeatedly asked question. They are asking that, okay, which is having good prognosis, which is having best prognosis, which is having worst prognosis, right? Okay, in which type of schizophrenia personality will be preserved? This kind of question they are asking. So first of all, we are going to understand the paranoid personality. After that, catatonic, and then 𝗵𝗵ℭ. Okay. So what is the meaning of the paranoid personality? See, this is not personality. See, what is the meaning of the paranoid schizophrenia? This is a type of schizophrenia. Overall, this is most common type of schizophrenia. See, this is having late onset. Onset is late, but this is having late onset and a good prognosis. Overall personality is preserved, and there will be delusion and hallucination. So now you tell me, when I say that if a person is having a schizophrenia who is having delusion and hallucination, this will, okay, he is having good prognosis or bad prognosis? Good prognosis only. So please understand that. Okay, so the paranoid schizophrenia is having good late onset but good prognosis. Fine. But if in a type of schizophrenia, if there will be motor symptoms, okay, no, motor symptom, this is having best prognosis. So in schizophrenia, which type of schizophrenia is having the best prognosis? Best prognosis is seen in the catatonic schizophrenia. Okay, fine. Now next is 𝗵𝗵ℭ type of schizophrenia. Disorganized. What is happening here? See, this is actually so dominated by negative symptoms, disorganization symptom. This is having early onset and bad prognosis. See, mind my word here. I'm not saying this is having worst prognosis. No. In some books, they have written that 𝗵𝗵ℭ schizophrenia is having the worst prognosis. No, that is wrong. Please understand that 𝗵𝗵ℭ schizophrenia is having early onset and bad prognosis. Early onset and bad prognosis. But if they are asking that worst type of personality, a severe deterioration of personality is seen in which type? Okay, this will be in 𝗵𝗵ℭ. So fine, related to personality, when I say that in which type of schizophrenia personality is preserved? Personality is preserved in the paranoid schizophrenia. Personality is preserved in the paranoid, yaad rakhna hai isko, theek hai na? And severe deterioration, personality pura ka pura barbad ho jayega kisme? 𝗵𝗵ℭ. You might have seen a naked person on the road who did not take bath for last 1 month, who is smelling bad, right? Who is having long hairs, right? He is abusing, he is playing with the stools and all. So basically he is suffering from 𝗵𝗵�h schizophrenia, which is having early onset and bad prognosis. All right. Next is called as undifferentiated. See what is happening here. See, any schizophrenia which does not come to a single type, okay, which I have explained you, paranoid, catatonic, 𝗵𝗵�h, okay, that is considered as undifferentiated. Residual schizophrenia means what? Residual schizophrenia means what? Please understand that. Suppose if a person who has started having delusion and hallucination, who started having delusion and hallucination. But after that, delusion and hallucinations are gone. Now only negative symptoms left. Residues are there. Residual schizophrenia. There is a type of schizophrenia where there will be only negative symptoms, no history of positive symptoms. Only negative symptoms, which is called as simple schizophrenia. Please don't understand that word looks simple, so why you are calling it worst prognosis. Please understand that simply it is schizophrenia. That's why it is called as simple schizophrenia. Means only negative symptoms, no history of positive symptoms. So it is having what? Worst prognosis. Okay, so can you answer me some question? Which is having late onset and good prognosis? Which type of schizophrenia? Very good. Paranoid schizophrenia, right? Paranoid schizophrenia. Okay, which one is having the best prognosis? Okay, catatonic schizophrenia. What is the treatment of choice? Okay, treatment of choice for the catatonic schizophrenia is, okay, say ECT and your first line treatment, ECT and the IV lorazepam. Okay, fine. Okay, see, in which type of schizophrenia there will be severe deterioration of personality? 𝗵𝗵𝗵𝗵, right? Or disorganized type. Okay, now tell me which one is having early onset and bad prognosis? 𝗵𝗵. Which one is having worst prognosis? Simple schizophrenia. Remember this one. Okay, fine. See, there are some other types of schizophrenia, some special type. Please remember this one. See what is happening here. Mostly in schizophrenia patient, no, IQ will be normal. See the example which I have given you about Professor Nash, Nobel Prize winner, IQ was completely normal. But in some patients of schizophrenia, okay, some patient of schizophrenia who is having mental retardation. So schizophrenia along with mental retardation, it is called the schizophrenia. Okay, schizophrenic patient who is having self-mutilation activities, हाथ अपने आप को काटना, अपने आप को नुकसान पहुंचाना, self-mutilation, that is called as Van Gogh syndrome. Easy to understand? Van Gogh syndrome. Sometimes they can give you image-based question that one psychotic patient is there who is, okay, like they can give you a slashing of wrist, there a picture mein, right? After that, they will asking you in which type of psychotic, okay, in which type of psychotic patient this kind of picture can be seen, right? So Van Gogh syndrome, right? Van Gogh syndrome is schizophrenia. Mostly there will not be disorientation to time, place, and person. Mostly in schizophrenia, there will not be the clouding of consciousness. But yes, there is a type of schizophrenia where patient will be having dream-like state. Oniroid means dream. Oniroid schizophrenia. Please remember that one is the prof, second is Van Gogh, third is oniroid. Old question. How to treat the schizophrenia case? Chalo, theek hai. Very important points here. See, please understand that I will be teaching you how to manage the case of schizophrenia. Theek hai? Chalo, fine. First of all, let's have a small revision. See, there is, okay, mesolimbic tract. First of all, there is mesolimbic tract. Okay. Yes, self-mutilation is also seen in which metabolic disorder? Can you answer? Self-mutilation किसमें दिखता है और? बताओ self-mutilation कौन सा metabolic इसमें? I hope you have learned in your biochemistry. Very good. 𝗏𝗏 syndrome, right? 𝗏𝗏 syndrome. Very good. And GPRT, 𝗏𝗏 syndrome. Okay, fine. Let's understand the management protocol of schizophrenia. Repeatedly asked question, very important. I would suggest you that from your pharmacology, you should revise all antipsychotic drugs, all antidepressant drugs, because one question from pharma drugs, for sure it will be there from either antipsychotic or antidepressants. Okay? Okay, fine. Chalo, okay. First of all, mesolimbic tract, mesocortical tract, nigrostriatal pathway. Last is which one? Tiburoinfundibulum pathway. Okay. Very good. Okay. See, there is a table. This table you are not going to forget. Okay. See, like in a normal person, if a normal person is there, a normal person here, it will be normal. So basically, I'm talking about what? Dopamine. See, in the beginning, scientists were thinking that, okay, only because of dopamine, psychotic symptoms are there. Okay, they were not thinking about serotonin, that there can be some fluctuation of serotonin in a case of schizophrenia or not. Fine, no? Okay, fine. So like in the beginning, they thought that, okay, dopamine से related है सब कुछ, okay? Dr. David OCD के लिए वो आता है SSRI is the drug of choice. Okay, SSRI. So like in the normal people, like here it will be normal. Okay. But if there will be schizophrenic patient, and if there will be schizophrenic patient, see schizophrenic patient, here it will be increased, here it will be decreased. Here there is normal, here there is normal. ये तो सबको समझ में आ रहा है, right now? Okay, like everyone can understand this part. Okay, fine. So in the beginning, scientists made first line drug, है ना? First line drug. He made first line drug. So that was called. So that was 100% blocking dopamine. 100% blocking dopamine. So typically it was blocking dopamine. So that's why it is called the typical antipsychotic. Okay, no? It was called the typical antipsychotic. It was called the typical antipsychotic, or you can say first generation drug. Since it was blocking only dopamine. Chalo bhai, to kya hoga? Here, like in mesolimbic tract. Okay, this will be decreased in mesolimbic tract. Just hold on for a minute. So now you tell me what is happening here. See, when I'm giving only dopamine blocker, and when I'm giving only dopamine blocker, so positive symptoms will improve or negative symptoms will also improve. Yes, when I'm giving a first generation drug which is blocking only dopamine antagonist है, तो यहाँ पे ये तो decrease कर गया भाई, चलो समझ में आ गया बात. But because of this, dopamine in all tracts will be decreased, no? Easy to understand. Now you tell me, when I have given first line drug, first generation drug like haloperidol, so can you answer me? What will be situation here? Situation will be, okay, now tell me, what about the positive symptom? Positive symptoms will improve or not? Yes, this will improve. Positive symptoms will improve for sure. ठीक है भाई. But what about negative symptoms? Negative symptoms का क्या? Negative symptoms will become worse. Hannah, there will be more and more negative symptoms. No, there will be more and more negative symptoms, right? There will be more and more negative symptoms. What about nigrostriatal pathway, which is responsible for your movements? Motor symptoms. Decrease of dopamine in nigrostriatal pathway will create some problem in your movements. Extrapyramidal symptoms. Extrapyramidal symptoms like acute akathisia, acute dystonia, and the tardive dyskinesia, right? Tardive dyskinesia, torticollis and all, which you have learned, right? Hannah? Or dystonia, right? Okay, laryngeal spasm and all. So these are what? Hannah? These are what? These are the side effects. So these are extrapyramidal symptoms. So whenever there will be extrapyramidal symptoms, what will be the drug of choice? You are going to give the promethazine, right? Promethazine, anticholinergic dena padega, right? Okay, fine. What about this tract? What about the tiburoinfundibulum pathway, which apart from dopamine, what you are going to have here? You are having one more hormone, that is called the prolactin. Please understand that dopamine and prolactin, these are antagonists of each other. If dopamine will decrease, there will be increased level of prolactin. So female can have what? Even unmarried female can have what? Galactorrhea. Patient can have what? Lack of libido. Sexual problems, right? Gynecomastia, right? All right. So if I ask you that if a person who is having hyperprolactinemia, you will give him dopamine agonist or antagonist? Agonist you will give, Dr. Blessina. You will give dopamine agonist. You want to increase the dopamine, no? So like if dopamine will increase, okay, then only prolactin will decrease, no? Right? All right, fine. So first generation ka, okay, see, after giving first generation drug, after giving haloperidol, we were having so many side effects, so many symptoms. So like instead of helping the patient, I'm making him to face more troubles, right? More trouble, right? Fine, no? Easy to understand. So like there was a patient of LSD abuse. He was also having all the symptoms of schizophrenia. And when scientists did the urine examination, they found so much extra metabolite of serotonin. There they found that, oh, it means in psychosis, serotonin, in schizophrenia like symptoms, serotonin is also so much. So now they made one more drug which was blocking dopamine as well as serotonin. Now it is called as what? Atypical antipsychotic drug or second generation antipsychotic drug like clozapine, olanzapine, aripiprazole and all, right? Aripiprazole and all, right? Very good, very good. So what was the best part about this one? What was the best part? That, okay, this was the blocker, this was antagonist of dopamine, but this was also the partial agonist at D2. Also partial agonist at D2. So now what is happening? And now it is going to, okay, now it is going to help the patient more. Now when I'm giving my patient, aripiprazole or clozapine, second generation drug, Now in mesolimbic tract also, like this is decreasing or this is becoming normal. In mesocortical, because of serotonin and because of the, okay, say partial agonist of dopamine, here also it is becoming normal, somewhat increasing, no effect. Now I'm helping my patient a lot. Now what kind of question they are asking? If you give haloperidol to a schizophrenic patient, only positive symptoms will improve or both symptoms will improve, positive or negative, both? Only positive symptoms will improve, right? If you give clozapine, if you give second generation drugs, okay, to a schizophrenia patient, only positive will improve or both will improve? Both will improve. Easy to understand. So this is the treatment protocol. ठीक है ना? Always remember that whenever you are using, okay, first generation drug, there is always high risk of side effects, extrapyramidal symptoms and all. So you have to be careful that, okay, see, like at the same time you have to give what? Okay, like at the same time you have to give what? Anticholinergic drug. All right. Okay, fine. After that, how to start the treatment to a schizophrenic patient? Always understand that for the first time, if a patient is there for the first time, okay, no, first of all, you start with atypical antipsychotic drug. After that, atypical except olanzapine and clozapine. After that, you call your patient to come after 6 weeks. But what if he's not responding? Then again you change some other atypical antipsychotic drug. Hold on. Yeah. Again, you change atypical antipsychotic drug. Okay. See, and after that, see, whenever you are going to use atypical antipsychotic drug, at that time, again, except olanzapine and clozapine, okay. Again, you call your patient to come after 6 weeks, Again, if he is not responding, now you shift him to typical antipsychotic drug. typical antipsychotic drug. Again, you call him after 6 weeks. Again, if he is not responding, then he will be called as a case of resistant schizophrenia. Very good, Dr. Shri Ramya Reddy. Very good. Dr. Blessina, very good. Resistant schizophrenia. Resistant schizophrenia. So now they can ask you one question that, see, like a person will be considered as a case of resistant schizophrenia when he is not responding to medicine for how many weeks? 18 weeks, right? Dr. Anusha, very good. 18 weeks, right? Okay, fine. Now, what is the drug of choice for resistant schizophrenia? Clozapine. Clozapine. Repeatedly asked question. Clozapine is the drug of choice for resistant schizophrenia. Clozapine. Okay, now clozapine is a drug which is having anti-suicidal effect, right? Anti-suicidal. So what is the side effect of, see, what is the lethal side effect of clozapine? Or granulocytosis, right? Myocarditis and seizure. All right. Okay. After that, so when you have started your patient on clozapine, then again you call him after 6 weeks. Again, if he's not responding, then ECT. ECT means what? Electroconvulsive therapy. Electroconvulsive therapy. Now, if I ask you one question that, okay, what is the anesthesia of choice for ECT? Anesthesia of choice for ECT? Very good. Methotrexate, right? Methotrexate, है ना? Methotrexate, right? Methotrexate. So why it is considered as the anesthesia of choice? Because side effect is convulsion. Excitatory side effects are there. Okay, no? Okay, that is what we need. We have to produce convulsion right now. All right. So I hope this is clear to all of you. है ना? चलो फाइन, आगे बढ़ते हैं. See here, हमेशा याद रखने के first of all you start with atypical antipsychotic. You start with atypical antipsychotic except olanzapine and clozapine. Okay, why except? Because you have to save it. You call after 6 weeks. Not responding, then atypical again. Again 6 weeks. If not responding, then typical antipsychotic. If he is not responding, then he will be considered as what? He will be considered as a case of resistant schizophrenia. Okay, then again after 6 weeks not responding, then ECT. This is the protocol which you are going to remember. Okay, some unspecific type of schizophrenia here. Okay, some unspecific type here. Okay, see here, see this kind of, okay, this kind of misidentification is seen in. This type of misidentification is seen in. See, you are asking why no olanzapine and clozapine? Because see, देखो होता है जो सबसे अच्छा हथियार होता है उसको बचा करके रखते हो, right? में लास्ट में यूज करने के लिए. See like whenever you are going to get a case of, है ना, whenever you are going to get of, okay, whenever you will be getting a case of the paranoia, you are not starting a linezolid antibiotic, right? है ना? Always you are starting with the basic antibiotic, no, only amoxicillin and then amoxiclav, easy to understand, staph aureus का जो होता है, I know. And if there will be MRSA case, methicillin resistant staph aureus, then you are going for the vancomycin. Okay, if there will be vancomycin VRSA, then only you are going for linezolid and all, right now. Okay, so directly you are not starting linezolid, so you are saving it right now. So that's why olanzamycin, that's why olanzapine and clozapine we are saving. Fine. Okay, yes, olanzapine or clozapine we can use, but the drug of choice for the resistant schizophrenia is which one? Clozapine. Okay, some misidentification type we are going to understand here. Okay, misidentification type. One is called the 𝗵𝗃 syndrome. Another is called a 𝗵𝗃 syndrome. What does it mean? See what is happening. Please remember this one. 𝗵𝗃 and 𝗵𝗃, very, very important. Very, very important. See, if a patient believes that a familiar person is replaced by an imposter, it is called as 𝗵𝗃 syndrome. Suppose a patient is claiming that my wife is A. Okay, if patient is having this kind of belief that A is replaced by B, okay, my wife is replaced by some other woman. Okay, some other woman. She looks exactly similar to my wife, but she is not my wife. A is replaced by B. This is called as 𝗵𝗃 syndrome. See, I have given you the example that in a football ground, right? Original grass is replaced by artificial grass, which is known as 𝗵𝗃. I hope this should be clear to all of you now. Okay, na? One is replaced by another. That is called as 𝗵𝗃 syndrome. 𝗵𝗃 syndrome, right? Okay, fine. This is also called the delusion of double. Delusion of double. Okay, do not get confused it with the delusion of subjective double. Delusion of subjective double. Delusion of subjective double. What does it mean? Subjective double means what? Subjective double means, okay, suppose if I am having this kind of problem, then I'm thinking that yes, there is one Dr. Nadeem is in India, one is in America, one is in China, one is in Russia. Okay, no, means so many double roles are there. Everyone is living their own life. That is called a subjective double. But here, delusion of double. Oh my God, he looks like exact. Okay, he looks similar to me. Okay, similar to me. This is what? Delusion of double. 𝗵𝗃 syndrome. 𝗵𝗃 syndrome. What about 𝗵𝗃 syndrome? Here, patient is having this kind of belief that a familiar person can change his appearances. Multiple appearances he can make, and he can disguise as a stranger. Patient can say that my own brother, he can wear different masks, he can change his appearances, and he disguises me as a stranger. He claims like that. Fine. So this is called a what? 𝗵𝗃 syndrome. 𝗵𝗃 syndrome. ये picture देखो, है ना? जब भी mask का आए ना, याद रखना 𝗵𝗃 syndrome. 𝗵𝗃 syndrome. चलो ठीक है. I'm making. See देखो, एक है A is replaced by B. Okay, now you tell me. Okay, one number. Okay, one number is this is 𝗵𝗃 or 𝗵𝗃? One is 𝗵𝗃. And what about this one? What about two? 𝗵𝗃. Easy to understand? ये क्वेश्चन सॉल्व कर दो तो बस सबको समझ में आ गया. तुम्हें क्वेश्चन बताओ. ये क्वेश्चन एम्स में आया था. एम्स में था क्वेश्चन. A patient with schizophrenia was admitted in psychiatry ward. When the nurse entered the room, he started beating the nurse and accused that actually this nurse is his real wife and accuses her of giving him wrong medication. What is the likely diagnosis? If you are able to solve this question, I am happy. 70% of you are correct. Answer is, ये बताओ क्या है यहाँ पे? See what patient is claiming. He is claiming that one is replaced by another, or the same person is disguising as a nurse. Same person is behaving like a nurse. Same person. He is thinking that his wife, वो nurse नहीं है, उसकी wife ही है, जो कि अलग-अलग शक्ल बना करके आ रही है वो. Right? Wife, she is the same in the face of nurse. Answer is 𝗵𝗃 syndrome. 𝗵𝗃 syndrome. Yes, 𝗵𝗃 only. 𝗵𝗃 syndrome. If you can solve this question, 100% you can solve question in MCI. Okay? ये बता दो तो सब समझ में आ गया. ये सभी क्वेश्चन पूछा मैंने पहले शायद. देखो एक बार. A 23-year university student had a fight with a neighboring boy. On the next day, while out, he started feeling that two men in police uniform were observing his movements. When he reached home in the evening, he was frightened and told his family members that police was after him and would arrest him. Despite reassurances by family members, he remained afraid. Someone wants to harm me. Delusion of persecution. Delusion. See, if you can solve this, please understand that even if they are asking only 5 questions, see, minimum question I am anticipating 6 or 7. Okay, fine. So 5 question में Hardly one question will be one liner. 4 questions will be like this only, clinical, big question. ये वाला क्वेश्चन में ये बताओ. Okay, first question, ये बताओ, is there any confusion here? बताओ, what kind of question? See, what I am telling you that, suppose if the patient would have claimed that, no, my wife is replaced by nurse. Nurse looks like my wife, but she is not my wife. Okay, then answer would have been, okay, 𝗵𝗃𝗃 syndrome, right now. Otherwise here, but in this case, he is saying that his wife, okay, the nurse is not nurse, she is his real wife, but she is taking the appearances of nurse and she wants to kill him. She is giving a wrong medication, right now. So this same person, easy to understand. So answer will be 𝗵𝗃𝗃 syndrome. 𝗵𝗃𝗃 syndrome. Okay, fine. So what are these substances which can cause symptoms like, Hannah? Which can cause symptoms like schizophrenia? Please understand, these are the poisoning. Okay, like bhang, ganja, hashish, amphetamines, cocaine, alcohol, phencyclidine, and hallucinogens. ये बताओ question क्या है? Yeah, this is also 𝗵𝗃𝗃, right? 𝗵𝗃𝗃 only, right? 𝗵𝗃𝗃. Okay, fine. Schizophrenia is over. Next chapter is eating disorder. Eating disorder. Okay, next chapter is eating disorder. Okay, see, there are 4 types of eating disorder which we are going to learn now. Most important is anorexia nervosa, then bulimia nervosa. See, both are what? See, like in both these, there will be what? Image consciousness. Okay, both are what? Image conscious, right? Image conscious, Hannah? Okay, anorexia nervosa means what? Image conscious. Okay, image conscious means I can become fat. I can become fat. So see, eating disorder will be more common among females or males. Females, obviously in females, right? Because everyone wants to, okay, everyone wants to become like Angelina Jolie or 𝗵𝗃𝗃𝗃 Padukone, right now? Hannah, slim, trim, right? Males too, kuch log hote hain. Yes, Hannah, female, right? Fine. So what is happening here in anorexia nervosa and bulimia nervosa? Both, see, in both conditions, like they will be scared, okay, scared of being fat, of getting fat, right now? Okay, fine. But how to differentiate these two? Please understand that. Please understand that anorexia means what? Lack of appetite. This is a misnomer. There is no lack of appetite. Appetite will be normal. What is happening here? No, patient will restrict herself to eat anything new, to eat anything. Okay, no, patient will hide. There will be peculiar food handling behavior. If mom is coming, she will hide behind the fridge. Even if mom is asking, why you are not eating? No, I'm having. After mom, okay, when mom will left, she will do what? She will throw in garbage, okay, no? Fine. Or she will hide the food. If any guest will be coming, she will be preparing many dishes. She will offer everyone, but she will not eat. Peculiar food handling behavior. So for a week, she will not be eating anything. But maybe if there is any party, even if she eats anything, after a friend is insisting, then she is going to induce vomiting, purging episode. She will insert her finger into the mouth, and she will induce vomiting, right? So yes, so what is happening here? Here she is not eating food. She is not eating the food at all. She is restricting herself. Situation will be like starvation, lack of nutrition. So there will be weight loss or not? There will be weight loss or not? Yes, there will be weight loss. There will be weight loss, very, very important, because lack of nutrition is there, no? And after that, there will be physiological changes. There will be poor sexual development, low interest in sexual activities. There will be menstrual problem also. Yes, amenorrhea will be there. Okay, no? Fine. Okay, so dental caries will be there because she is inserting her finger inside. Yes, it will be there. So there can be salivary gland inflammation. Yes. Okay, there can be signs over knuckles. क्या कहते हैं इसको बताओ, साइन को क्या कहते हैं? What is the name of okay, see, okay, whenever she is going to insert a finger into the mouth, there will be erosion over knuckles. That is called as Russell signs. Okay, fine. But what is happening here in bulimia nervosa? What is happening here in bulimia nervosa? See, every day she is eating good. Every day she is eating good, but after 2-3 hours, she is realizing, oh my God, I have eaten a lot. And after that, she will be having regret. Oh my God, I have eaten a lot. After that, she will be having purging episode. She will induce the vomiting. She is inserting her finger again and again inside her mouth. So Russell signs will be more prominent here, right? Okay, dental caries will be more, inflammation will be more. Okay, now fine. See, Russell sign will be seen in both, more prominent in bulimia nervosa, but in anorexia nervosa, she is inserting her finger, no, right now. So, and Russell sign is seen in both. Please understand that, seen in both, not only in bulimia, in both, but more prominent in bulimia nervosa, right? She is having food. After 2 hours, she is getting this kind of thing that, oh my God, I have eaten a lot. I should not have eaten this much. Now tell me, nutrition is, okay, nutrition has reached to her small intestine or not? Digestion has started or not? Everything has started. Nutrition is normal. So weight kya hoga? Weight loss hoga ya normal hoga uska? Weight will be normal. What about sexual development? Normal. Interest in sexual activities, libido, normal. Amenorrhea, normal. Dental caries, yes. Okay, fine. So please understand that here, most important factor to differentiate anorexia nervosa and bulimia nervosa is BMI, weight loss. If it is less than 18.5 or 17, hai na? Some books are also writing 17.5, theek hai na? Okay, fine. So what is happening here? तो अगर weight loss है तो anorexia nervosa है. देखो, fear of weight gain, inappropriate ways of preventing weight gain, it is seen in both. It is seen in both. Okay, so weight loss and amenorrhea. Weight loss and amenorrhea. Weight loss and amenorrhea. These are two most important distinguishing feature. Okay, the distinguishing feature which are going to differentiate anorexia nervosa and bulimia nervosa. Even if you have to choose one, most important is as per ICD-11 update. Even amenorrhea is not there. Weight loss is there. You should understand that she is suffering from anorexia nervosa. Anorexia nervosa. Okay, fine. Okay, चलो मैं क्वेश्चन दे रहा हूं, उसके बाद सॉल्व करके बता दो तो एवरीथिंग इज फाइन. A 17-year-old female presented to your clinic with her mother. Mom is saying that she is doing rigorous exercises. She is not eating properly. She looks very thin actually right now. Okay, fine. So and after that, when you do physical examination, okay, Russell signs, yes, it is there. Okay, fear of weight gain, yes, it is there. Okay, fine. Okay, okay, dental caries, yes, it is there. BMI less than 18. What is your diagnosis? She's suffering from anorexia nervosa or bulimia nervosa. हो गया, काफी है. Anorexia nervosa. Anorexia होगा ना बेटा. See, this is anorexia nervosa. Weight loss. देखो, these Russell signs, fear of weight gain, dental caries will be seen in both. BMI less than 18 point. देखो, 18.5 से more than 18.5 is okay normal, right? 18.5 to 24.9, right? BMI, है ना? Less than 18.5 means weight loss. Okay, weight loss. All right. So that is anorexia nervosa. There is one questionnaire system from where I'm anticipating one question that is called as what? SCOFF questionnaire. SCOFF. Suppose if a female patient who looks very, very thin, weight is only 34 kilograms. She is 24, although she is 23, 24, but weight is only 34 kilograms. Okay, no, she will not accept that she is dieting or what. Fine. So now you are going to ask her some questions. Okay, no? So this is a screening test for eating disorder. Do you feel sick that you have eaten a lot? Okay. Do you think that you have lost control over amount of food you eat? Okay. See, 1 stone means क्या होता है? जैसे वो weight के लिए weight है ना stone. Have you lost more than 6 kg in last 4 to 6 months? Do you believe that you are fat when others are saying actually you are thin? Do you think food dominates your life? Scoff questionnaire. More than 2 yes means she is suffering from eating disorder. This is called a what? Scoff questionnaire. Scoff questionnaire. Okay. Overall, most common disorder is this one, binge eating disorder. Foodie people, food lover. तो यहाँ पे image से लगता है इसको ये कोई लगता है इसको कुछ लगता है image से कोई लेना देना होगा इसको नहीं. Means there will be multiple episodes of binge eating है ना. Foodie people, no image consciousness. They will be obese. What about avoidant restrictive food intake disorder? This is new diagnosis in ICD-11. I anticipate this question. Why? Because this is the new diagnosis. See what is happening here. Here patient does not eat. When patient does not eat, what is happening here? She is having lack of nutrition. Because of that, she is having weight loss. She is having poor growth, poor secondary sexual growth. See, symptoms are similar to anorexia nervosa restricting type, right? But this is called as what? Avoidant restrictive food intake disorder. Why? Because how to differentiate it? Weight loss is there for sure, but no disturbance of body image. She is not image conscious. She does not eat because she does not like the food. She does not like the smell of food. Easy to understand? Avoidant restrictive food intake disorder. Yeah, which of the following is a wrong statement related to bulimia nervosa? Bulimia. Easy to understand, right? Right? Okay, so eating disorder over. Next chapter is the personality disorders. Personality disorder, very, very important. Personality disorders, right? Okay. So there is something called the big 5 personality traits. Big 5. There is something called as big 5. These are called as what? Personality traits, right? Okay. See here. One question you can expect from personality disorder. One question you can expect from personality disorders. Okay, na? Okay, see, openness to experience. If a person who is high in openness to experience, he will be what? Means like suppose what is happening here, high means like he would love to do adventurous works. Sir, how to differentiate between bulimia and scoff? अरे नहीं, स्कॉफ तो क्वेश्चनर सिस्टम है ना, वो तो बुलिमिया एनोरेक्सिया सबके लिए है. See, scoff is not a disease. Scoff is a questionnaire system which is used for a screening test, right? Dr. Sheikh Nagur, right? I hope this is clear to you now. Okay. Okay, scoff questionnaire, that is just a screening test. Okay, like suppose if you would have asked me, and if you would have asked me bulimia nervosa and anorexia nervosa, yeah, that was the differences. There we have learned, okay, differences, right? Hana? Chalo, fine. Okay, now we are going to learn about personality disorder. So if a person who loves to do adventurous activities, he is high in openness to experience. Hana? Adventurous activities, matlab kya hoga ki sensation seeking, okay, desire to have new experiences, high. Low, no adventurous activities. Conscientiousness, dutiful, disciplined, well organized. High in conscientiousness, very disciplined, very dutiful. Low, no discipline at all. Extraversion, either there can be extrovert or introvert. Speaking a lot, social activities, speaking a lot, right? Now extrovert, not speaking at all, speaking very less, and prefer solitary lifestyle. So when I say about Shah Rukh Khan, extrovert, Mr. A.R. Rahman, introvert. So see, being extrovert, being introvert, 100% normal. Okay, it doesn't mean anyone is suffering from any disease. No. Agreeableness, high in agreeableness, very helping nature. Low, not helping at all. समझ में आ गई बात? Neuroticism, what does it mean? Neuroticism. Neuroticism means what? See, this defines the emotional instability. High in neuroticism, emotional fragile. If you criticize him, he will not be able to tolerate it. Means emotionally unstable people are high in neuroticism. Low in neuroticism, emotionally stable. Chalo, ye to normal tha. Now we are going to learn about personality disorders. Any personality, any of your behavior which is against the social culture, okay, where other people are not comfortable with your behavior, that is called a what? Personality disorders. Okay, no? Yeah, this will be ego symptomic. So we have divided into cluster A, cluster B, and cluster C. First of all, cluster A. Cluster A का मतलब क्या होता है? देखो, हमेशा याद रखना, cluster A, cluster B, and cluster C. Okay, people who look odd and eccentric. Cluster A. One is the paranoid, second is schizoid, third is schizotypal. See here, since this is the last moment of your class, so you have to remember only one word which you are going to keep in your mind during the exam. So if I am asking you one word which you are going to remember related to paranoid, excessive suspicious of other people. Always suspicious of other people. वो किसी पे भरोसा नहीं करते हैं. Mistrust on other people. Easy to understand? They are always suspicious of other people. Paranoid. Fine now? Okay, they believe in a षड्यंत्र theory. षड्यंत्र theory means what? They believe in the conspiracy theory. All right. See, if I ask you what about schizoid personality, emotionally cold. Okay, remember only one word, emotionally cold. You appreciate him or criticize him, he will be indifferent, emotionally cold, socially detached, solitary life. है ना? तो एक word याद रखना, emotionally cold. That's it. Schizotypal, odd beliefs and magical thinking. Odd behavior, inappropriate behavior. Because of that, but that person is not able to maintain any relationship. Schizotypal is more like, okay, more than normal person, less than schizophrenia. So like, okay, what is happening here? Odd and eccentric, they are at the borderline. Means, okay, that is called a word, schizophrenia continuum. Means symptoms are similar to schizophrenia. Almost means, okay, better. Okay, see, like symptoms will be more than normal people, less than schizophrenia. So at the borderline of entering into the, okay, like zone of schizophrenia. So they are asking, which type of personality disorder is considered to be at the schizophrenia continuum? Okay, cluster A, specifically schizotypal. एक बार फोटो देखो समझ में आ जाएगा. Paranoid, very much suspicious of other. Schizoid, solitary life, emotionally cold, less interest in sexual act. Schizotypal, odd belief, magical thinking, eccentric behavior. Schizotypal. What about cluster B? Very, very important. Full of drama. Remember one word related to cluster B. Full of drama. Now you tell me how many personality disorders we have completed in cluster A? 3. Name, please, name. Paranoid, schizoid, schizotypal. Very good. Okay. What about histrionic personality? Histrionic personality means what? Full of drama, exaggeration of emotion, okay, attention seeking attitude, full of, okay, no? So sometimes, okay, see, they are what? Attention seeking. Okay, they care a lot about their, like attitude, and they want to become very beautiful, right? Now, so they focus on attire to get attention of other people. Fine. Sometimes they will be having suicidal gesture. So because of full of itne sare drama honge to sare honge trauma. So they are also having what? Unstable relationship. They are not able to maintain the relationship. Full of tantrum, full of drama. Okay, no? Extrovert type, histrionic personality, histrionic. Okay, narcissistic, self-love. This is all about me. I'm the best. Okay, no, I'm the most handsome in my college. I know all girls are behind me. Narcissistic. Oh, वो movie देखा था 𝗏3G. And you don't have any right to look so beautiful. Poo. The Kareena Kapoor in that movie, right? Kareena Kapoor, है ना? And तुम्हें कोई हक नहीं बनता कि तुम इतनी खूबसूरत दिखो. Poo. Right? Narcissistic. Right now, narcissistic. Narcissistic. Please understand that they are having fragile esteem, fragile self-esteem. Right? है ना? Fragile self-esteem. What does it mean? And fragile self-esteem means what? And see what is happening if a person who is claiming that yes, I'm the best, I'm the most handsome. Like suppose if I am having this one, suppose if I'm suffering from narcissistic personality disorder, self-obsessed. What is happening is, see, like during college, during school time, I had every time I used to look in the mirror, Maya, you look so good. You look so good. Okay, fine. So up to a certain part is fine. Okay, but annoying behavior, every time you want admiration, every time you are asking everyone, no, I'm the most handsome, you appreciate me, ma'am. Yes, I'm the most handsome. Okay, so when I'm claiming that I'm the most handsome, suddenly some person is coming here, you are losing your hair. Okay, so you are losing your hair. How can you claim that you are the most handsome? No, I'm really handsome. No. How can you say that? How? I will not be able to tolerate any kind of criticism. I can easily go into depression. So if a narcissistic personality disorder is there, you have to treat depression also. Emotionally fragile people, emotionally unstable people. Okay, no? Finally, they will not be able to handle any type of criticism. Antisocial to samajh mein aa raha, right? No? Unlawful behavior, illegal behavior. Okay, no? Like the chori chamari karna, right? Chori chamari dakati vakati, right? This was the question last time. I think last time this was the question in MCI, that one man has shown a knife to a lady, and after that he snatches her purse, right? Which type of personality disorder? Antisocial, illegal active, right? No, antisocial. This was the question, I think so, right? No. Okay, Dr. Pradhaman Gupta is asking, sir, how to differentiate conduct disorder and antisocial disorder? Very good question. Okay, देखो, antisocial is personality disorder which will be seen in elders. बड़ों में दिखेगा, but there will be history of conduct disorder. Conduct disorder is that is the problem of a child. When a person was child, yes, Dr. Sethi, yes, Hana. So okay, see, like any person who is suffering from antisocial disorder, okay, they must be having, okay, like mostly they will be having history of conduct disorder when he was a child. When he was a child, he was very aggressive. He was fighting with everyone. Every time he used to, okay, like every time he used to harm plants and animals, right? He was not having any regards for elders, right? No, so the conduct disorder belongs to a child category, antisocial, adult. I hope this is clear to you, Dr. Pradhaman, right? समझ में आ गया? Okay, fine. Now next is the borderline. Okay, BPD, borderline personality disorder. Please understand that borderline personality disorder का मतलब क्या होता है? See, very serious, emotionally unstable, frequent mood swings, always in the state of crisis. What is happening? A 17-year-old female who is having mood swings. Okay, Dr. Mandala is asking, sir, what is how to differentiate narcissistic and the grandiosity? See, the grandiosity, that is actually a delusion problem. Okay, now there he will be behaving. Suppose if he is having this kind of thinking that he's the richest person, he will feel like that. What is happening here? Yeah, narcissistic is only self-love. Okay, that is self-love. I'm the best. That's it. Means मतलब मुझे अच्छा है. See, like he will be having, okay, they will be having this kind of thing now, कि I'm having extra talent. I'm a special person. I'm a special person. Fine. So delusion of grandiosity, he does not understand anything. See, that is a type of the delusion disorder. So narcissistic just self-love. I love myself a lot. ठीक है ना? वो है. Histrionic and borderline. Borderline and histrionic बहुत ही different. जो एक मैं बताऊंगा पहले. So what is happening? Borderline is much more serious than borderline personality is much more serious than histrionic personality disorder. Please understand that borderline में क्या है? कि borderline personality disorder, no, person will be having, okay, like frequent mood swings, always in the state of crisis, and they will also be having self-destructive acts, means slashing of wrist, overdoses of medicine, every time fighting with everyone here, fighting going on. Because of that, stormy relationship, very, very impulsive. So here suicidal behavior is there, borderline. Histrionic में suicidal gesture is there. Girlfriend will say, if you are not taking me for shopping, I'm going to commit suicide. I'm going to jump from the ground floor. जेस्चर है, नहीं करोगे तो हाथ काट लूंगी. काटेगी कुछ नहीं, बॉर्डर लाइन में सच में काटेगी वो. समझ में ही बात? आई होप दिस इज क्लियर टू ऑल ऑफ यू, राइट? है ना? हिस्ट्रॉनिक फुल ऑफ ड्रामा, दैट्स इट, है ना? दैट्स इट, राइट? Okay, so this is called about borderline personality disorder. Borderline personality disorder. So like there is a behavior therapy that is called as a DBT. This is not CBT, this is DBT. Dialectical behavior therapy. Dialectical behavior therapy. What does it mean? So please understand that CBT is the cognitive behavior therapy. Okay, so means, okay, simple behavior therapy means CBT का मतलब क्या होता है बताओ? CBT is cognitive behavior therapy, means behavior therapy which is going to improve the cognition. Cognition means some action, some memories. Okay, no? Suppose if a person of schizophrenia who forgot how to comb his hair, how to wear his shirt, how to wear perfume, how to tie the tie, right? No, so now you are teaching them, right? Okay, fine. But DBT, and a DBT, which is called as dialectical behavior therapy, this is somewhat aggressive. Any person who is having suicidal tendency, who is harming himself, you need to give him dialectical behavior therapy. This is also behavior therapy, but here you are going to say what? Here you are going to say what? Say your life is very, very special. You are not going to harm yourself. So many people are dependent on you. You cannot harm yourself. So like behavior therapy where you want to tell your patient, you are not going to harm yourself. You are not going to harm yourself. That is called as what? Dialectical behavior therapy. Yes, motivation में थोड़ा सा aggressive motivation. ठीक है? देखो cluster B photo देखो. Histrionic, full of drama, exaggeration, हंगामा, narcissistic. है ना? तुझसे बड़ा handsome कोई है नहीं भाई. Right? Narcissistic, self-love, antisocial, you can understand, right? Borderline without any, see this bechara, right? Hannah? Fine, easy to understand. Borderline, I hope this is clear to all of you. Okay, now cluster C. Cluster C, anxious and fearful. See, avoidant personality disorder, what does it mean? If a man who was rejected from 17 interviews, if a boy who is refused by 17 girls, who proposed 17 girls, all of them refused her, right? Refused him. Okay, no? A child who is not, okay, who is not allowed by other children to play with them. So they will develop what? Fear of rejection, right? Now, fear of rejection for sure. Fear of rejection. Fear of rejection. Okay, they will be socially withdrawn. Inferiority complex. Okay, now this is what? Avoidant personality disorder. They will avoid social gathering because they have fear of rejection. Next is called a dependent, especially sisters. Sisters. Okay, dependent on elder sister or dependent on your friend or someone. But what is happening? Even for this simple decision, even for this simple task, you are asking your elder sister. Right now, excessive amount of advices you are seeking. You feel You feel helpless when you are alone. Dependent personality disorder. For each and everything of the normal life, you are dependent on someone else. OCD personality, obsessive and compulsive personality disorder. Please understand that they show perfectionism. Preoccupied with the rules and regulation. Inflexible, very workaholic. Because of this, what is happening here? Because of the perfectionism, every time they will be late in delivering the result. You ask Mr. A.R. Rahman to compose a music in 1 week, he will deliver you in 1 month. And you will be thinking what? You will be thinking, oh, ek mahina laga de. But that 1 month, that music will give you what? That will get you what? Oscar. Right now? OCD personality. Okay, Raman, yeah, okay. What is the treatment for this avoidant and dependent? See, like most of the personality disorder, please understand how to treat most of the personality disorder. Please understand that first of all, a person who is suffering from personality disorder, he will never accept that he is suffering from any disease. Okay, no? He will never accept it. So first of all, mostly in most of the cases, yes, only psychotherapy. Most of the cases, only psychotherapy. Okay, cluster A, psychotherapy. Okay. Okay, but what about cluster A? Cluster A में कौन-कौन सा जरा एक बार लिखो chat box. Please write in chat box how many diseases we have learned in cluster A. Okay, paranoid, schizoid, and schizotypal. So there, okay, what I have taught you, some symptoms like schizophrenia, sometimes short-term psychotic symptoms will also be there. So psychotic symptoms agar hai, so then you have to add antipsychotic drug also, antipsychotics too. Okay, no? Narcissistic personality. First of all, psychotherapy. Along with that, kaun sa doge narcissistic mein? Antidepressant, right? Okay. Antisocial people are very, very aggressive. They will fight with everyone. You have to give him beta blocker to calm him down, beta blocker, right? So as per the situation, you have to treat. But for most of the people, for most of personality disorder, psychotherapy is mandatory, right? Okay, cluster B में कौन-कौन सा पढ़ा था बताना जरा. Cluster B में name of personality disorders in cluster B. Please write in chat box or wherever you are. Please revise it yourself. Histrionic personality. और क्या था? Narcissistic, borderline, and antisocial. Right? Okay, fine. Cluster C में क्या था? Avoidant, dependent, and OCD, obsessive. Okay, very good. चलो next ये बताओ, question बताओ. Is it a BPD, right? Okay, next chapter, sleep disorder. Chalo, next chapter we are going to start sleep disorder. Okay, fine. Sleep disorder. See, like there will be two types of disorder. One is called what? Insomnia. Another is what? Hypersomnia. So they are asking that what is the drug of choice? See, if you ask me, मैं जल्दी भगा के पूरा खत्म कर दूंगा within half an hour. But if you want to revise with me, मतलब आराम से कर लो, ठीक है? One more hour I will take and I will finish entire psychiatry, ठीक है? ये छोटा-छोटा chapter है, जल्दी मैं कर दूंगा, ठीक है? जल्दी. Okay, wait. See, at 5 o'clock I will give you a small break, okay, ना? At 5, okay? चलो आ जाओ वापस. Okay, see what is happening is sleep disorder में whenever there will be insomnia, lack of sleep. Okay, so benzodiazepine and Z compounds, ठीक है ना? See, which is the best benzodiazepine for insomnia? Okay, this is triazolam. What? But okay, no. So this is benzodiazepine is having what? Addiction. So that's why we are giving what? Z compound. Z compounds is devoid of addiction. So zaleplon, shortest acting, and that's why this is the drug of choice for sleep induction. Okay. Intermediate acting is zolpidem. Zolpidem का market में कौन सा नाम है? Zolfresh का नाम सुना होगा ना? 5 milligram. Minimum is 5 milligram. ठीक है? Isopiclone, longest acting. That's why to maintain, okay, to maintain the sleep in insomnia. Fine. Okay, fine. So what are the disorders associated with insomnia? One is called a periodic limb movement disorder. 𝗵𝗏𝗋 syndrome. 𝗵𝗏𝗋 syndrome. बस ये सब याद रख लो, काफी है. Okay ना? 𝗵𝗏𝗋 syndrome. 𝗵𝗏𝗋 syndrome is what? Restless leg syndrome. 𝗵𝗏𝗋 syndrome patient will be having this kind of feeling that some insects are walking over his leg, over his shin. So he will be getting up frequently in night. 𝗵𝗏𝗋 syndrome. Okay, periodic limb movement disorder when patient is sleeping. When patient is sleeping, then okay, he will be having sudden contraction of muscle, okay, leg muscle, right? No, leg muscle there. Okay, because of that, he will be having what? He will be having bad sleep pattern. He will not be able to sleep. That is called a periodic limb movement disorder. Okay, we are going to learn about the narcolepsy related to hypersomnia. Hypersomnia. See, please understand that narcolepsy means what? Excessive sleepiness in daytime. What is happening here? Patient is not able to maintain the sleep. Right now? Fine. So what is happening here? In night time, a person who is having night duties, who is having disturbed sleeping pattern, so anytime he can sleep. What is happening here? So what are the symptoms we see in narcolepsy? There will be cataplexy, sudden loss of muscle tone. Patient can even fall. Okay, sleep attacks. Patient will be talking to you, suddenly he can sleep. Anytime he can sleep. Anytime he can sleep. All right. Okay, fine. Fine. Now, hypnagogic hallucination and hypnopompic hallucination, which I already have explained. Sleep paralysis. In the morning time, patient is not able to move his legs. Okay, legs and hands. This is called a sleep paralysis. Sleep paralysis. Please understand that when a person is sleeping for 8 hours, okay, no, there will be REM sleep and there will be NREM sleep. Okay, non-rapid eye movement sleep. REM sleep का मतलब क्या होता है? Rapid eye movement. So what is happening is during a rapid eye movement, there will be high metabolic rate, there will be high heart rate, there will be respiratory rate will be high. Okay, penile erection will be there, right? Okay. So what is happening is the dreams which you watch during REM sleep, you will be able to remember. You will be able to recall. The dreams which you watch during NREM, you will not be able to recall. Okay, fine. When a person is sleeping for 8 hours in night time, 8 hours in night time, he will be sleeping 1.5 hour for, like he will be having 1.5 hour in REM and 6.5 hour in non-rapid eye movement. Very sound sleep you are going to get where? Non-rapid eye movement. So non-rapid eye movement, deep sleep. At that time, whatever the dreams he is watching, he is not able to recall, right? I know. So what is happening here? आएगा Dr. Pradyuman भी आएगा, don't worry, ठीक है ना? So what is happening here? Please understand that. See, like there will be some disorders during non-rapid eye movement. Some disorders there will be, which will be in the REM. Okay. See what is happening here? After every 90 minutes, after every 90 to 100 minutes of NREM, there will be repetition of REM sleep. So in one night, there will be 4 to 6 cycle of REM. What is happening here? When latency of REM sleep is decreased, that is the reason for narcolepsy. Less than 60 minutes it will become. Fine. So what is the treatment of choice? Okay, the narcolepsy ka kaun sa drug of choice kya? Modafinil. Okay, no? And forced naps at regular time. So what are the dysfunctional events in sleep disorder? What are the parasomnias during non-rapid eye movement? One is called the 𝗵𝗿 nocturnus. One is called the 𝗵𝗿 nocturnus. 𝗵𝗿 nocturnus means what? Night terror. Okay, night terror. Means a person who was sleeping, suddenly he's getting up and after that he's having so much sweating, so much tachycardia and all, and after that he's not able to recall, and this is so much horrible dream he had. That is called a 𝗵𝗿 nocturnus. Sleepwalking is called as somnambulism. Sleep-related enuresis, sleep-related susu, right? Sleep-related enuresis. During sleep, if a person or if a young boy or girl is going to void and empty the bladder, that is called as sleep-related enuresis. What is the drug of choice? Drug of choice क्या था इसका? Bedwetting का क्या था? Desmopressin, right? Desmopressin and imipramine, right? No, imipramine and desmopressin. But overall, they will be asking what is the management of choice overall. What is the TOC? TOC अगर को पूछेगा तो क्या है? TOC. Yes, this will be bed alarm. Bed alarm is the treatment of choice. This is your question. What is the meaning of bruxism? Bruxism means what? Teeth grinding, bruxism. Somniloquy, sleep talking. All these you are going to remember. Okay, now you tell me, okay, like somnambulism. During somnambulism, if a person is going to commit any crime, will it be punishable or not? Not punishable. Why? Okay, this is not punishable. Why? Because he is completely unconscious. He does not remember anything. Okay, no? Very good. Okay, so during REM sleep, there will be nightmare. Nightmare will be there. Nightmare. Remember it one. Nightmare during REM, night terror during NREM. Okay, chalo fine. The next chapter which we are going to learn, that is called as mood disorder. Drink and drive, that part will come in support. Just me substance बताऊंगा, okay? No, if you are drunk and if you are driving, that is illegal only, right? And that is illegal. Okay, fine. देखो, mood disorder में से we are going to understand only the most important topics from where they are asking the question. Okay, no? Fine. Please understand that there are 5 topics. Basically, we are talking about what? Basically, we are talking about depression and bipolar disorder. Okay, fine. So basically, see what is happening: major depressive disorder, major depression, and bipolar disorder. Okay. See what is happening is, suppose if there will be depression, only depression, it is called as unipolar. If there will be depression as well as mania, this is called as bipolar. If I say that if a person who is suffering from mania, it is called as unipolar or bipolar. Yes, this is also called as bipolar because mania never occurs alone. Mania never occurs alone. Okay, no, mania never occurs alone. Okay. Very good. Okay, mania never occurs alone. Okay, fine. Hypomania means what? Hypomania means what? Okay, short form of the mania. Okay, fine. What is the meaning of cyclothymia? Please remember these words are repeatedly asked question. Cyclothymia, less severe form of bipolar disorder. याद रखना है ऐसे करके BC. Dysthymia, less severe form of major depression. इसको याद रखना D4D. है ना, ये BC याद रखो, BCMC करते हो, राइट? तो BC याद रखो, less severe form of bipolar disorder is called as cyclothymia. Less severe form of depression, major depression, is called as dysthymia. Okay, but duration for both of these should be more than 2 years. 2 years. Okay, chalo fine. See, please understand that depression is maximum. Okay, this is responsible for maximum daily. This is responsible for maximum disability adjusted life year, right? Okay. Overall lifetime prevalence is approximately 12%, 5 to 17%. All right. Chalo, theek hai. Sometimes they can ask you one question related to physical science. See, this is like omega sign. Huh? This is like omega just above the root of nose. Omega sign. What about, like, suppose if there will be a fold here, this is called a triangular fold in the nasal corner of upper eyelid. This is called a what? 𝗿𝗏𝗃 fold. 𝗿𝗏𝗃 fold. Remember, there are 2 physical signs which we see in case of depression. One is called as omega sign. Another is called a what? 𝗿𝗏𝗃 fold. 𝗿𝗏𝗃 fold. Okay, very good. Remember these 2 points. Okay, see what is happening. There is one more important point. There is called, okay, given by Aaron Beck. He said that if a person who is having feeling of hopelessness, helplessness, and worthlessness, right now. So this is called as what? This is called as cognitive period of depression. Hopelessness, helplessness, worthlessness means 100% he is suffering from depression. depression. Okay, देखो how to differentiate typical depression and atypical depression. एक चीज याद रखना हमेशा, स्वैग अगर किसी को है ना, स्वैग मतलब suicidal thoughts, weight loss, anhedonia and feeling of guilt, 100% he is suffering from depression. Okay, स्वैग याद रखना. Please understand that ये बताओ typical depression में क्या होगा? There will be lack of appetite, there will be lack of sleep, there will be lack of mood, lack of sleep, lack of mood, lack of appetite. Lack of appetite is there, so there will be weight loss for sure. Lack of sleep है तो there will be insomnia for sure, है ना? Lack of और क्या क्या है वहां पे? Lack of mood, so there will be sadness for sure. So that's why we are giving what SSRI, है ना? Selective serotonin reuptake inhibitor, because serotonin is a hormone for what? Good food, good mood, and good sleep, है ना? So that's why depression के लिए drug of choice क्या है? SSRI these days, right? Okay, fine. So basically in the typical depression there will be weight loss, there will be insomnia, there will be sadness, there will be what, है ना? Low energy. Okay, no? Fine. But what about atypical? Atypical depression means what? Reverse biological symptoms. Reverse biological symptoms. Opposite: eating a lot, sleeping a lot, eating a lot, sleeping a lot. So what is happening here? There will be hypersomnia, overeating. So there will be what? Weight gain. Opposite, that is called as atypical depression. Students will do mistake here only. Please understand that whenever they are asking you how to differentiate typical and atypical depression, be careful. Okay, now, okay, so apart from these symptoms, there will be weight gain, hypersomnia, hyperphagia, interpersonal sensitivity. Okay, patient will be having this kind of what? This kind of feeling of rejection, or someone is not giving him importance. Okay, now interpersonal sensitivity. Or what is happening here? Sometimes if there will be good positive things, no, in between, he will feel normal. Laden paralysis. He will feel that I'm not able to lift my hand, very heavy hand, laden paralysis. Okay, what about the melancholic depression? Okay, melancholic means what? Alone, solitary. Okay, no? Alone, solitary. Please remember that. Remember only one word. Mostly it is seen in old ages, because of what? Loneliness, severe anhedonia, severe feeling of guilt, early morning awakening. Patient will say, sir, earlier I used to get up by 7, but now I'm getting up every day by 5 a.m. Okay, no? Fine. Suicidal tendency is very high. So overall drug of choice is SSRI. Apart from that, you can start with TCA and all. TCA. ठीक है ना? Okay, fine. TCA. ये क्या है? ये बताओ, what is the full form of the TCA? TCA क्या है? TCA means what? 𝗏𝗏 effect, Dr. David, that will come in substance abuse, no? Like here, how you are asking 𝗏𝗏 effect. Okay, that will be in alcoholism. Alcoholism, I will teach you 𝗏𝗏 effect. Okay, chalo, fine. Okay, so TCA means what? Okay, this is the tricyclic antidepressant. Earlier, this was the drug of choice. But there were so many side effects because, okay, no, apart from blocking dopamine, apart from blocking norepinephrine and serotonin, this was also blocking alpha receptor, muscarinic receptor, histaminic receptor, sodium channel, okay, sodium channel of heart. So because of that, there were so many side effects of TCA. So kabhi bhi, so please understand that, okay, you will get this kind of question, that a patient who is on antidepressant suddenly presented to emergency department with, okay, now with so many like so many symptoms will be there, like, okay, there will be hypotension, there was allergic part, sedation, okay, loss of consciousness, right? No, fine, no? And when you do, okay, so when you do ECG, there will be a dry mouth, right? There will be a dry mouth and all, right? So many symptoms will be there, blurred vision, okay, urine retention will be there, right? So many side effects will be there because of the blockade of muscarinic receptor, histaminic receptor, sodium channel receptor and all. So there will be what? So there will be heart problem also, right now. And patient will be having what? Metabolic acidosis. Metabolic acidosis. So what is the first investigation to be done here? ECG is mandatory. ECG. Whenever you are going to do ECG, you know, there will be what? Okay, there will be prolonged QT, NRT, है ना? ये सब जितने भी पूरे सारे prolonged होंगे. There will be, okay, right axis deviation, right now? There will be right axis deviation, right? Okay, QT prolongation, PR prolongation and all. I know. So what is happening is, since patient is going into metabolic acidosis, what is the first line of management of TCA toxicity? First line, you have to do what? You have to do serum alkalinization, right? Sodium bicarbonate IV injection you have to give. This is frequently asked question. TCA toxicity case कैसे manage करोगे? पहले patient को बचाना है, right? ना sodium bicarbonate you are going to give, right? ना sodium bicarbonate. Okay, fine. I hope this is clear to all of you. Okay, now most important topic which I'm going to teach you in depression, that is the postpartum blues and postpartum depression. Here you are not going to confuse, please. Okay, this is repeatedly asked question. Please understand that. See, in Obs-Gynae, you are learning about postpartum, and you are learning about postpartum blues, right? So most of the time you are thinking that, okay, chalo kuch bhi ho jaye, postpartum blues hi hoga. Psychiatry bhul jate ho, Obs-Gynae yaad rahega, right? Please understand that postpartum blues is very much common. In approximately 30 to 75%, okay, mother you will get postpartum depression only in 10 to 15%. See, just after they birth, because of hormone fluctuation, what is happening here? Okay, that kind of, you know, like sadness is very much common among the new mother. Sadness, sadness. So there will be, she might be having tearfulness. Yes. Okay, no? Fine. But like, is there any thought of harming the baby? No. Suicidal thoughts? No. History of mood disorder? No. Family history of mood disorder? No. Feeling of guilt? No. But what about depression? Depression is very, very serious. What is happening here? Within 3 to 5 days, there will be postpartum blues. But within 3 months, there will be postpartum depression. Here, there will be anhedonia? Yes. Patient will be sad? Yes. Sleep disturbance? Yes. Thought of harming the baby? Yes. Suicidal thoughts? Yes. History of mood disorder? Yes. Family disorder? Yes. Fine. If there will be hallucination and delusion in between, you can say postpartum psychosis. So how to differentiate it? See, symptoms are very easy to understand. Please remember the duration. Remember the duration. Only 3 days. And remember this BPD. Bipolar disorder yaad rakho. Only 3 days. Matlab 3 to 5 day postpartum blues. Only 3 weeks. Postpartum psychosis. Psychosis. Only 3 months. Means within 3 months, I'm saying within 3 months. Postpartum depression. ये duration याद रहेगा तो कभी confuse नहीं करोगे life में. ठीक है ना? 3 हफ्ता, 3 महीना, 3 साल. This is more than enough to understand. So in postpartum blues, how you are going to treat? Only support, psychological support. Postpartum depression, psychotherapy plus pharmacotherapy. Okay, bipolar disorder का बस एक चीज याद रखो, bipolar disorder का how to treat bipolar disorder. Please understand that. See, I will not teach you in detail because I already have taught you. Bipolar disorder का you have to remember just one point from where they are going to ask the question. Please understand that. See, like in depression. See, like in depression. See, in depression. See, please understand, for depression, most important neurotransmitters which are responsible, that is norepinephrine and serotonin. After that, dopamine. After that, dopamine. Okay, na? See, like in postpartum psychosis, also there will be thought of harming the baby and suicidal tendency will be there. Okay, na? Okay, it will be there. Yes, yes, yes. Okay. Doctor need to know that is psychological problem here, no? Psychological thing. Okay, fine. So see, the most important neurotransmitters which are playing the role in depression, that is norepinephrine and serotonin. After that, dopamine. After that, but most important, only 2, norepinephrine and serotonin. Okay. But what about bipolar, where you are going to have mania, and depression both, So mostly, mostly bipolar is actually what? So mania. So there will be increased level of dopamine, Okay, so please understand that. See, suppose if I have to diagnose the case of depression and if I have to diagnose the case of the bipolar disorder, how many days are required to diagnose the case of depression? 14 days. 14 days. How many days are required to diagnose the case of bipolar disorder? Only 7 days. Only 7 days. Easy to understand? Fine, no? Fine. Please remember this part. Okay, no. So what is happening? Suppose if a person who is having sadness only for 4 to 5 days, are you going to start him on antidepressant? No. Hannah, say signs and symptoms will be there and duration should be more than 14 days. Take 14 days, then it is actually depression. Bipolar disorder only 7. So bipolar mein especially I'm talking about what? Mania. Mania mein kya hoga? Over talkativeness, elevated mood, hyperactive person, flight of ideas, no need of so much sleep. Only 3 to 4 hours he will be 100% normal. Excessive goal directed activities, hypersexuality, hyper shopping, everything is hyper. That is what? Mania. Now the question is how to treat a case of mania. This is your question. Okay, so they're asking that if you are getting one acute mania case, what is the first line of treatment? Are you going to see basically mania? Agar kisi ko hai mania, so you will be giving him what? Mood stabilizer like lithium you will give, right? Lithium or valproate, right? No, easy to understand. Mood stabilizer. But acute mania case hai. If there is acute mania, always start with atypical antipsychotic like aripiprazole, like aripiprazole. Along with that, you have to start lithium. Why lithium should not be started? Okay, why lithium is not going to help here in the beginning? Because lithium takes approximately 5 days to attain the plasma concentration. So if I ask you in lithium, if you start a patient on lithium, after how many days you are going to start TDM? TDM means what? Okay, you have to do the therapeutic drug monitoring after 5 days only. Lithium is a toxic drug, right? Okay, what is the half-life of lithium? 1 day, or you can say like up to 24 hours. Fine. So what is happening here? If you start only lithium in acute mania, it will work after 5 days. Fine. No? So like this will not be supportive. So you have to start aripiprazole along with the lithium plus minus benzodiazepine. Okay, no? Fine. So ye jo hai composition you can start for, you can keep for 2 to 4 months. After that you will start antipsychotic drug. You will continue only lithium. Okay, no? So lithium may you have to do, see, every time you have to keep on doing the therapeutic drug monitoring. Okay, no? Fine. Now they are asking that, okay, they are asking one question, that which mood stabilizer is there which is having anti-suicidal property? Answer is lithium. Which antipsychotic drug is there which is having anti-suicidal property? Then it is 𝗏𝗧𝗃, right? Chalo, fine. Okay, now how to start the treatment? Suppose if a person who is having depression, as well as mania, then you will give a mood stabilizer plus antidepressant, right? No, plus antidepressant. If a patient who is having what? Okay, like, okay, manic episodes, only manic episodes plus psychotic episodes, right? No, then you can add what? Antipsychotics also. Antipsychotics, right? No? So as per signs and symptoms, you have to start the treatment. This chapter is over. See, in depression, what is the most important topic? Postpartum blues and postpartum depression. Okay, last topic here. Okay, fine. Now the next chapter is, you want to take a break now? Okay, okay, now it's 5 o'clock. Okay, you can take a small break. Okay, you can take a small break. See, I will take more 45 minutes to complete psychiatry pura. Okay, na? Forensic bhi karaunga. Don't dekho. See, like when you are sitting with me, like I'm doing a full-on revision. Okay, this is good for you only. Okay. Chalo, okay, you take a small break now. Okay, you will take a small break. Okay, you take a small break for only for 10 minutes. You come back soon. Okay, okay, you come back soon. देखो खुद से पढ़ोगे. See, if you do self study, you will take more time, and if I am helping you in revision, you will take less time, but you will be having 100% revision. Okay, चलो ठीक है. I will teach you people, don't worry, I will teach you. If you are comfortable, I will teach you indeed, don't worry. ठीक है ना, पूरा याद करा दूंगा. Okay, okay, then you take like only 10 minutes break, you come back soon. Okay, तो देखो ये बता, मूड डिसऑर्डर में मोस्ट इंपॉर्टेंट टॉपिक क्या, फ्रॉम वेयर यू आर गोइंग टू गेट द क्वेश्चन, postpartum blues and postpartum depression, postpartum psychosis. Please understand that harming the baby thought है ना, thought of harming the baby and suicidal tendency will be in both postpartum psychosis also, postpartum depression also, but on the basis of duration you are going to solve it, right? Fine. So remember BPD, okay, 3 days, only 3 weeks and 3 months, right? So most important topic is postpartum depression there. After that, hopelessness, helplessness, right? And yes, one more important point I missed. Okay, wait. देखो ये मत भूलना कभी भी. See, please understand that ये word मत, मतलब कि never forget this word, cyclothymia. Please remember these two words again, okay? Cyclothymia means what? Less severe form of bipolar disorder. Dysthymia means what? Less severe form of major depression. Okay, but duration should be more than 2 years. Duration should be more than 2 years. Suppose if you are getting this kind of case that one engineer, new engineer, he's coming to, he's asking, sir, you know, during my school, during my university days, when I was in my 3rd year of college, no, from that time only I'm feeling sad. Means I'm not enjoying my life. I'm just living my life. That's it. I don't know what is happening to me. So this is the case of major depression, or this is a case of dysthymia. बताओ क्या है ये? This is a case of dysthymia, right? This is a case of dysthymia. More than 2 years हो गया ना, जॉब पे आ गया वो. Dysthymia. Major depression का मतलब क्या होगा? So many negative thoughts, suicidal tendency, anhedonia, weight loss, insomnia, depression, major depression. Okay, fine. चलो यहाँ पे एक और word I want to explain you here. Suppose if a person who was already suffering from dysthymia, and suddenly he got attacked by superimposition of major depression. This is called as sandwich of depression. This is called a what? Double depression. This is called as what? Double depression. Remember this word. Okay, see, like okay, like in 2018 or 19 they have added this question. Double depression means what? Dysthymia plus major depression is called as what? Double depression. One more important point, that is called a what? Rapid cycling. ये rapid cycling वाला question ना last time आया था MCI में. Rapid cycling. What is the meaning of rapid cycling? Okay, see, a person of bipolar disorder who is having equal to or more than 4 episodes of either hypomania or depression or mania, more than 4 episodes, it is called a what? Rapid cycling. More than 4 episodes in 1 year. ठीक है? So cyclothymia, dysthymia, double depression, rapid cycling, you are not going to forget. आज physical science क्या था? Omega sign here, right? Here 𝗬𝗏𝗺. You are not going to forget. See you after 10 minutes. Okay? Okay, fine. We can continue. Okay, now let's talk about sexual disorder. Because see, like there are 4 types of sexual disorder which we are going to learn. Okay, now sexual disorder. See, you can anticipate only one question from sexual disorder, and that will be related to the paraphilia. Okay. Okay, and the second important question, okay, like we have to differentiate here. Please understand that one is called the gender identity disorder. Second is called as transsexualism, and third is called as dual role transvestism. Okay, fine. Okay, so how to differentiate these 3? How to differentiate? Please understand that suppose if a person who was born with male genital organ, suppose if a person who was born with penis and a scrotum, right now, like he will be male for sure, right now. Okay, like he should be okay with that, fine. But okay, suppose if a person who is born with vagina, Hannah, she is having vagina, so she is considered as a female right now, and she should be happy with that. But what is happening is, suppose if a boy is there who is born with male genital organ, he is not happy with his penis and scrotum. He's saying that, oh my god, I don't want this kind of hanging garden. No, I want surgery to be done. No, I don't want this. So what is happening here? He is not happy with his genital organ. So this means what? Gender identity disorder. So especially if this will be in young age, in childhood age, this is called as what? Gender identity disorder of the childhood. So what is happening here? A boy would like to play with dolls. He would like to wear frocks and all. Fine. So he will be having the preoccupation with the activities of opposite sex. Up to childhood, this is fine. This is called what? Gender identity disorder of childhood. But if it persists in adulthood, if an adult person is there, if he is not happy with his genital organ, he is insisting for surgery. Now this is serious. This is called as transsexualism. What is happening here? Most of the time he will be using a phrase like, I'm a man wrapped in body of a woman. He will be insisting for surgery. This is serious. Okay, now this is serious, right? Okay, fine. So even homosexuality is frequently seen here. But next is called as what? Dual role transvestism. What is happening here? Only for the time being, a person will wear, a man or a woman, only for the time being, he will wear the dress of opposite sex, only for the time being. Okay, no, only for the time being, just to have the temporary feeling of opposite sex. That is called as dual role transvestism. How to differentiate it from here? See, please understand that there is no desire of permanent sex change here. No surgery, and they will not be demanding for surgery, first of all. And how to differentiate this from a fetishistic disorder, what we have learned in forensic medicine, fetishism, where a person after wearing the dress of opposite sex will be having sexual gratification. In dual role transvestism, no sexual gratification, no demand of surgery. Easy to understand. So gender identity disorder of the childhood is clear to all of you. Serious, if it is going to persist in adulthood, this is called as what? Transsexualism, where patient will insist for surgery. Dual role transvestism, only wearing the dress of opposite sex for time being. Okay, now, easy to understand. See, sexual disorder, one question you can anticipate. Okay, chala, fine. Next we are going to learn here. Okay, fine. So now we are going to learn about, see here. From here, you can anticipate one question, what I'm teaching you. Okay, see what I'm going to teach you. See, phases of sexual cycle. Okay, ये बताओ, when a man and a woman, है ना, when a male and a female, whenever they want to have sex, है ना, when they want to have sex, first of all, there should be desire for sure, है ना, there should be desire, right? Okay, whenever there will be desire, they come close. Okay, they come close. Thank you so much. Okay, now they come close for sure. Okay, fine. So after that, there will be what? Excitement, right? There will be excitement. All right. So how we are going to understand that a person is excited, man or woman is excited? How we are going to understand? Male will be having erection. Male will be having what? Erection. Female will be having what? ये बताओ female को क्या होगा बताओ? Female में क्या होगा? Female will be having vaginal lubrication. Female will be having vaginal lubrication. Easy to understand, no? Fine. So during excitement, male will be having erection, female will be having what? Vaginal lubrication. So when I say that male erectile dysfunction, this is the disorder of which phase of sexual cycle? Excitement phase. Erectile dysfunction. Erectile dysfunction. Erectile dysfunction. Easy to understand, right? So what is happening here? After excitement, there will be what? Orgasm. First of all, desire, then excitement, where there will be penile erection. After that, orgasm. Orgasm is what? Peak of sexual pleasure. There will be, how you are going to understand that page? Okay, that people are having, okay, man or woman, they are having orgasm. Okay, there will be ejaculation of semen in men. There will be what? Ejaculation. Ejaculation, right? Ejaculation. Female mein kya hoga? How you are going to understand that female is having orgasm? There will be what? Involuntary contraction of. There will be contraction of lower 1/3 of vagina. Lower 1/3 part of vagina. Easy to understand. So if I say, so what I'm saying that ejaculation of semen is called as orgasm. If there will be premature ejaculation, then what? This is the disorder of desire phase, excitement phase, or orgasm phase. Premature ejaculation is a disorder of orgasm phase. Orgasm phase. Orgasm phase. Easy to understand? Fine. Last, after orgasm, there will be resolution of body. Resolution of body means what? Body goes to the resting stage. That's it. Fine. So what kind of question they are asking? Please understand. First of all, there are 4 cycles. One is called the desire, then excitement, then orgasm, and then resolution. Okay, fine. So they are asking that male erectile dysfunction. Male erectile dysfunction is a disorder of which phase of sexual cycle? Okay, this is the excitement phase. Excitement phase. And please understand one more point is there. Okay, just before the orgasm, highest level of the tension in body. Okay, no? Okay, no? So this is called the plateau phase. So now the question is that if there will be erectile dysfunction, how you are going to treat? You are going to give which medicine? Phosphodiesterase 5 inhibitor. Phosphodiesterase 5 inhibitor like sildenafil, tadalafil, and vardenafil, right? Okay, so how they are going to help? They facilitate the blood flow into penis and enhance erection. You can also give oral phentolamine, which will decrease sympathetic tone, right? Okay, what is the injectable drug which we are using for erectile dysfunction? 𝗵𝗄𝗎. 𝗵𝗄𝗎. Where do we inject? Where do we inject? Okay, we are going to inject into corpora cavernosa. Corpora cavernosa or intraurethral. Okay, fine. How to improve? Okay, what about the premature ejaculation? What about the premature ejaculation? This is the disorder of which phase of sexual cycle? This is the disorder of orgasm phase. Orgasm phase. So there are 2 techniques which we are using for premature ejaculation. One is squeeze technique. Squeeze technique. Squeeze. Okay, no. Next is called a stop start, which is also called a Siemens technique. Siemens technique is old question, repeatedly asked question. Okay, please understand that there is one drug that is called a flibanserin. ये drug का नाम याद है? I have taught you, right? Flibanserin is a drug. Flibanserin. Flibanserin drug. See, this is the drug which is recently approved by FDA. Flibanserin, okay, no? Flibanserin. See, this is the drug which is given only for hypoactive sexual desire. Flibanserin, flibanserin. Hypoactive sexual desire in female. It should not be taken with alcohol. It should not be taken with alcohol. Why? There is high risk of hypotension. Only one drug is approved for the hyposexual desire, and that is only for female. Name of the drug is flibanserin. Okay, chalo, fine. Okay, see, what do you call as, like, whenever there will be excessive sexual desire in female and male, excessive sexual desire in female is called as nymphomania. Excessive sexual desire in male is called a what? 𝗬𝗃𝗃𝗃𝗃𝗃𝗃𝗃. Okay, this is more than enough to understand. Okay, now we are going to start. Okay, next chapter. Very good. But nymphomania, Dr. Rajkumar, hypotension, risk of low BP. Okay, no? Fine. Okay, now we are going to learn about the neurotic, stress-related, and somatoform disorder. Very important, where we are going to learn about anxiety, phobia, panic attack, and PTSD, and OCD, and hypochondriasis. Very important topic. First of all, anxiety disorders. Anxiety disorder means what? Without any known cause. If a person is having restlessness, if a person is having breathlessness, anxiety means what? Okay, means like when a person is not able to maintain his, maintain his normal movement, he's walking here and there, he's having breathlessness, he's having, frequent urination, he can have diarrhea also, so breathlessness and all. So these are the symptoms of anxiety, basically nervousness, breathlessness, restlessness, anxiety symptoms without any known cause. Okay, so what is happening here? Okay, very, very important, which you are going to differentiate. How to differentiate panic disorder, how to understand it. Okay, see what is happening here. Panic disorder, this is called a panic attack, or you can say anxiety attack. Okay, suppose if a person, what is happening here, suddenly, suppose if a person who took $5 million from the bank loan, $5 million, he established a factory, and suddenly he's getting a phone call that, oh my God, there is a bomb blast, like in your factory is no more. Only ashes are there, that's it. After that, what will be his situation? Okay, there will be sudden pain in chest, breathlessness, tachycardia, all symptoms like heart attack. Breathlessness, sudden, similar to angina attack, myocardial infarction attack. Okay, no, so differential diagnosis will be what? Like pulmonary embolism, hyperparathyroidism, pheochromocytoma, right now? Okay, now what is happening here? Okay, angina attack, heart attack. Okay, no, so similar symptoms. So what is happening here? Patient is having symptoms like what? Okay, heart attack. So, okay, see, at the same time, he will be shifted to emergency department for sure. Okay, whenever. So after that, for sure, after maintaining ABC, airway, breathing, and circulation, of course, you are going to do what? ECG and X-ray you will do. ECG is normal, X-ray is normal. All investigations are normal. So what is the diagnosis? Diagnosis is panic attack, anxiety attack. Only SSRI will be given. Okay, chalo, fine. Okay, fine. Next is called about agoraphobia. Agoraphobia is a general term. What is happening here in agoraphobia? Fear of places from where escaping is difficult. Maybe like fear of being in enclosed space or in open space or going somewhere alone. Okay, so this is what? Agoraphobia. When I saw that fear of closed space, closed and dark, then it is called as claustrophobia. Fear of closed and open places from where escaping is difficult. Okay, maybe even in the elevators or in a place where so many people are there, or in open space now where, okay, to going somewhere alone. Agoraphobia. Next is called the generalized anxiety disorder. Without any reason, see, like there is unnecessary chains of thoughts, series of thoughts. So it is series of thoughts. This is also called what? Free floating anxiety, restlessness, motor symptoms. Okay, how to understand this GAD? Suppose if a person who missed a phone call of his boss last night he slept early. Okay, no, he missed a phone call of his boss. Next day morning when he's getting, oh my God, I missed the phone call of my boss. Oh my God, he's going to remove me from the job. Or maybe even if he will keep me, he will not give me overtime. He will not love me. He will not give me importance. Or maybe he's going to fire me from the company. Oh my God, after that, I will not get the job. After that, okay, when I will not be having the job, no one is going to love me. No one is going to respect me. Even my mother will be, okay, like she will not be bothering about it. My wife will leave me. Oh my God, after that, I will not get the job. After that, okay, my life will be hell. After that, when he's reaching there, his boss is asking what? Hey, I wanted to organize birthday party. Okay, so I just wanted to discuss with you. See here, free floating anxiety, unnecessary series of thoughts, restless motor symptoms. This is called what? Generalized anxiety disorder. Generalized anxiety disorders. Specific phobia, like if a person who is having phobia to dogs, cynophobia. Height का तो फिर acrophobia, okay, hydrophobia, fear of water, and social anxiety disorder. Okay, please understand that. Okay, phobias are very important topic. देखो, generalized anxiety disorder, Dr. David. Generalized anxiety disorder, just unnecessary thoughts are coming again and again. But the panic attack, heart attack symptoms, severe pain in chest, breathlessness, so many symptoms will be there, right? Okay, that is the panic attack. Okay, see, specific phobias are very important. Okay, so just we are going to have fast revision this one. Okay. Okay. Arachno means spider. Arachnophobia, fear of spiders. Ophidio means what? Snakes. Ophidio. Aeroplane, aerophobia. Glosso, bole to tongue. Glossa means tongue. Fear of public speaking. Ornithology, study of birds. Ornitho, birds, fear of birds. Trypano, needles. Hemoglobin, right? Hemophobia. Vehicle. 𝗵𝗿phobia, fear of driving. Iatrogenic injury means what? Any injury due to doctor. Iotrophobia, fear of doctors. Nosocomial infection means what? Hospital acquired infection. Nosocomophobia, fear of hospital. Phasma or spectrum. Phasma, ghost. Okay. Astra bole to thunders, lightning. Astrophobia, also known as brontophobia or nitrophobia. Cyno, dogs. Claustro, dark space, closed space. Xenophobia, xeno means what? Strangers, other species. Xenografting, right? Xenografting means what? Okay, grafting from other species, right? So xenophobia, fear of strangers. Zoophobia, animals. Okay, what about the thanatology, study of death? Okay, thanatopraxia, artificial preservation of dead body. So ideally, what is the meaning of thanato? There will be Thanos, right? There will be Thanos. Okay, so thanatophobia, fear of death. Acrobics, fear of height, acrophobia. Alluro means cat. Alluro, fear of cats. Hydro, water, fear of water. Meso means germs, fear of dirts and germs. The pyrophobia, fear of fire. Okay, so I hope this is clear to all of you. See, phobia is very important. Please understand that. Hannah, phobia is very important. Okay. See, now what are the treatment of phobias? Please understand that what kind of question they are asking that. See, overall, the most important management for phobia is what? Okay, behavior therapy. Suppose if they are asking that either it is behavior therapy or pharmacotherapy. Answer is, see, do you think that if you give SSRI, patient will not be scared of dogs? No. Only for time being there will be improvement in symptoms. That's it. So overall for phobia, exposure and prevention. Face the fear. Mountain Dew, right? है ना? शक्तिमान कहता था क्या? शक्तिमान was saying no, है ना? कि मेरे बाबूजी कहते थे कि जब भी अगर कुत्ते से डर लगे तो क्या? कुत्ते को देखो घूर करके, right? Face the fear. Face the fear. This is the treatment of fear. That's it. Exposure. Lost connection in classroom. Dr. Sheikh is writing it. Okay, fine. Like this will be improved. Okay, this will be improved. Okay, don't worry, don't worry. Okay, okay. So what is this? So overall behavior therapy. So overall exposure and prevention. Exposure and prevention behavior therapy. This is the treatment of choice along with pharmacotherapy. Yes. Okay, no? Fine. So benzodiazepine you can give, beta blocker you can give. So there are four methods of, right now? The phobia management. One is called as what? Systemic desensitization. See what is happening here. Whenever you are going to expose your patient to anxiety-provoking stimuli, along with that, you are also giving him a muscle relaxant. You are also giving him some tablets. Fine. So you are applying relaxation technique. What is happening here? Suppose if a person who is having fear of dog, so every day you are exposing him to dogs, and slowly he will adapt. Slowly, okay, now slowly he will be he will get rid of the phobia. Systematically, you are desensitizing him. Anxiety-provoking stimuli se desensitize kar rahe ho. So that is called as what? Systematically desensitization, exposure followed by relaxation technique. Next is called the therapeutic graded exposure. You are just exposing your patient to anxiety-provoking stimuli, and you are making him to be habituated of that, okay, that phobia, okay, habituated of that anxiety-provoking stimuli. Means every day I'm just exposing my patient to dog again and again. I'm not giving any medicine. This is called the therapeutic graded exposure. Okay, flooding. Exposure to most severe form of anxiety stimuli, which I already have explained you during the class, right? I've given you long examples there. Okay, modeling. See what is happening here. When I'm showing my patient how to hold a dog, when I am also participating in the treatment, when I am demonstrating the treatment to the patient, this is called a what? Modeling. And doctors are model here, right? And so this is called a what? This is called a participant modeling. Dr. 𝗬𝗏𝗺, very soon it will be, this is not being streamed in class. Okay, fine. Within a few minutes. Okay, within a few minutes it will be improved. Dr. Muhammad Samir is asking, sir, why GERD patient is referred to psychiatrist? Okay, that part I will teach you when I will be teaching you somatoform disorder, hypochondriasis and all. Okay. Systemic desensitization, therapeutic graded exposure, flooding and modeling. These are the methods of, okay, these are the methods for the management of phobia. Okay, fine. We can wait for 2 minutes because some classes are already going on here. So like in that class, okay, live stream. Okay, live stream is there. So wahan pe kuch problem, we can wait for 2 minutes. Like meanwhile, we can have some other revision. Okay. Yeah, phobia is clear to all of you. Phobia is clear to all of you. See, if I ask you one question that, see, fear of doctors is called a fear of doctors. Fear of doctors, can you write in chat box? Iatrophobia. Fear of hospital? Nosocomial, nosocomophobia, right? Nosocomia. So fear of thunders? Astrophobia. Fear of fire? Pyrophobia. Fear of heights? Fear of closed space? See, when I say fear of only dark and closed space, no, then answer is claustrophobia. When I say that, fear of closed place or open place or a crowded place or going somewhere alone, okay, then it will be what? Then it will be agoraphobia, right? And then it will be agoraphobia, right? Okay, fine. Agoraphobia. Okay. Okay, fine. Now, please understand that OCD and OCD related disorder. OCD means what? OCD, see like here also there is problem of serotonin. So for OCD also a drug of choice is what? SSRI. For here also, okay, na? Okay, please understand that what is happening here. See, minimum symptoms to diagnose a case of OCD is 2 weeks. If I ask you how many months are required to diagnose schizophrenia? 6 months. Okay, depression? 14 days. What about bipolar disorder? 7 days. Okay, what about OCD? OCD is also 14 days, right? 2 weeks, 2 weeks. Please understand that what is happening here. OCD means what? Obsessive and compulsive disorder. No? OCD means obsessive and compulsive disorder, right? Just excuse me. Okay. Hannah, see what is the meaning of OCD here? Obsessive and compulsive disorder. Obsessive and compulsive disorder. So there can be OCD of Hannah, OCD of the contamination. There can be OCD of pathological doubt. A person who is staying on 15th floor. Okay, once he locked his room. After that, again he came back to. Again he went. Again he's going to check whether he locked or not. So next time he went there. Again, he opened and then closed. Again and again, rechecking. Fine, that is pathological doubt. So what is happening here? Okay, see, now there can be what? Intrusive thoughts. Means, suppose if a person is having this kind of thought that, oh my God, I'm having sex with God. Oh, after that, he will be very, very much uncomfortable, right now. Oh, so how can you think like this? Because so simply to reduce the anxiety, he will start doing the chanting. Okay, no, like he will start reciting the holy verses of his holy book, right? Symmetry, right? No, so patient always feel the need of symmetry. Suppose if a female who is having OCD of symmetry, okay, like whatever vegetable she is cutting, okay, she will be cutting in a same equal line and length. All potatoes 0.5 centimeters, 0.5 centimeters, 0.5 centimeter. All right. So please understand that OCD is actually neurosis. Here, patient understand that she or he is wasting so much time while repeating the same thing again and again. Okay, no? So because of that, she can easily go into depression. And this is your question. This is your question that what is the most common comorbidity associated with OCD? Answer is depression. Most common comorbidity associated with narcissistic personality, depression. So whenever you are going to treat a case of OCD, you also have to treat depression also. है ना? OCD का भी लगता है 14 days to diagnose. Depression also 14 days to diagnose. That's it. How to treat? Overall, please understand that best method to treat OCD is what? Exposure and prevention. Apart from that, along with that you can give what? SSRI and all. Okay, fine. See here, one is called as hoarding disorder, some new OCD related disorder, and olfactory reference syndrome. Hoarding का मतलब क्या होता है? Hoarding disorder, a person who is going to hoard something. What is happening here? Means, see, a person who keeps on accumulating his old stuffs for last 15 years. Yeah, fluoxetine, Dr. David, like fluoxetine, okay? Chalo, fine. So what is happening if a person who keeps on accumulating some stuff for last 15 to 20 years. So what is happening here? Old banyan chaddi vaddi sab, old clothes, 15-20 years. He is accumulating old stuff because he is having this kind of, okay, like he is obsessed with those. So he's thinking that if he is going to discard it, he might lose some important stuff. This is called as hoarding disorder. So you know one thing. So like, see, if he's accumulating useless item for last many years, right now? Okay, for last many years, right? For last many years, right? Now, for last many years, fine. So that is actually what, like after that room will become so unhygienic that he will not be able to stay. A person will not stay here. Dr. Belesina is asking, sir, how to differentiate aniomania and hoarding disorder. Hoarding disorder means you are accumulating old stuffs. You don't want to lose anything. Aniomania means what? You are doing shopping again and again. New shopping you are doing, right? New shopping. Dr. Durai Raj is asking how to differentiate from kleptomania. Kleptomania means what? Kleptomania means what? A person is having irresistible urge to steal something. ये तो यहाँ पे तो you are going to है ना? You are going to steal something. ये तो चोरी हो गया ना? Fine. So this is 100% different, right? Okay, fine. Next is called as olfactory reference syndrome. Okay, this is new diagnosis. You should anticipate. You should anticipate this one, that this may come in your exam. This may come. Olfactory reference syndrome. Why I am marking here? Here, patient is having this kind of belief that he is emitting foul smell, although he's not emitting anything. Fine now. So what is happening? Because of that, he is getting conscious. Okay, whenever he is meeting anyone, he is closing his mouth and mouth and nose. So every time he's getting conscious. This is what? Olfactory reference syndrome. Body dysmorphic disorder. ये समझ लो कि every time, even if a female is very much slim trim, but whenever she looks herself in the mirror, she feels that, oh my God, I'm fat. I'm getting some fat. Okay, body dysmorphic. Leave it. Okay. This is not so much important. Okay, see, just one point. Okay, a few points I want to tell you related to dissociative disorders. Okay, the dissociative disorder, which is also called as, okay, the conversion disorder. This part I have explained you in detail when I was teaching you. Okay, when I have taken your class, I have explained you in detail. Fine. So the old name is called a what? Hysteria. Please understand that. See what is happening here. Involuntary escape from reality. Okay, after that, there will be disconnection between the thoughts, identity, memory, and the consciousness. So what I have taught you about dissociative disorder, that I have taught you that a rickshaw puller, or if a person who was working, suddenly he lost his job. And after that, he's not getting his job. For last 6 months, he is jobless. Everyone is, okay, everyone is speaking against him. Everyone is talking about him. Okay, no, so like everyone is blaming him. Like everyone is blaming him. Hey, you do not have job. You are not doing this. You are not doing that and all. Fine. So what is this? So now he's getting frustrated, but he's not able to answer anyone. Fine. Everyone is accusing him. Everyone is speaking against him. Suddenly what happened? His unconscious mind, suddenly next day, early morning when he's getting up, he is fully paralyzed. Unconsciously, unconscious mind will create these kind of physical symptoms so that he can get rid of all these things. Fine. No? After that, what is a CT scan, MRI, everything is normal. But what is the benefit now? Now he is also comfortable. No one is anticipating that I should work, and I'm okay. Fine. After that, he is also getting some gain that. Fine. Other people are also supporting him, like they're giving him some extra money. They're giving him some extra money. Array, he's paralyzed, no, he cannot work. Fine. So what is happening? And this is called a what? Dissociative disorder. Dissociative disorder. Just one point you have to remember here, that there is something called as labella indifference. There is something called as labella indifference. What does it mean? See, this is the question which I'm anticipating in exam. Please understand that. What is the meaning of labella indifference? What is happening here? Suppose if I'm losing sight in one eye. Suppose if I'm losing a sight in one eye, I will be worrying about my eyesight, and I will be worrying about my eyesight, and I will be going to see an ophthalmologist. Okay. Fine, but what is happening here? A patient of dissociative disorder, if he lost one eyesight, he will be saying, no problem, I'm having one more sight. Means unconcerned about the result. Indifferent to the result is called as labillar indifference. Indifference. Okay, fine. And the people who are, for the people who are in jail, who were in jail, especially the prisoners, prisoners, after 15 years, if a prisoner is getting back to normal place, he's not speaking a lot. He's not speaking a lot. Okay, no? He's giving you approximate answer, which is called a 𝗲𝗏𝗏. This is also a type of dissociative disorder, which is called a Ganser syndrome, frequently seen in people, frequently seen in the prisoners. Okay. Okay, remember this part, somatoform related disorder, very, very important point here, very, very important. We are going to understand one by one. Please understand that. देखो जैसे ना somatoform disorder क्या होता है ना कि unexplained disorder. Somatoform disorder means what? Unexplained disorders. Means what is happening here? Suppose if a person who is having suppose if a patient is coming to a doctor again and again, she's saying that, doctor, I'm having abdominal pain, I'm having nausea and vomiting, I'm having nausea and vomiting, I'm having this, I'm having that. But in spite of all negative investigations, in spite of reassurances by the doctor, patient is coming again and again to the doctor. That is called a what? Somatoform disorder, right now? Okay, fine. So suppose, okay, so suppose if patient is having, pain at four sites. Suppose if patient is having pain at four sites. Pain at abdomen, shoulder, or anywhere else. Apart from the pain, patient is also having GIT symptoms like nausea and vomiting and diarrhea. Patient is also having CNS problem like mental confusion or a sexual problem also. Okay. And one patient is there, she's complaining again and again that, doctor, I'm having abdominal pain, only pain, only pain, only pain. Okay. See here, see, there will be more than one symptoms. This is called as somatization disorder. This is called as somatization disorder. Somatization disorder, which is also called as Briquet syndrome. If only pain is there, no, this is called as somatoform pain disorder. Somatoform pain disorder. Please remember these 2 points. One is called a what? Somatization disorder, which is also called as the Briquet syndrome. Briquet syndrome. And only pain, somatoform pain disorder. One more patient is there. She is coming to you. She is saying, doctor, I am thinking that I am having some problem in my body. Please check, please check. She doesn't know what it is. She is saying only disease, only disease, only disease. She does not have any symptoms, no symptoms, no symptoms, only ideas of having some disease. In spite of reassurances and negative investigation, she is visiting so many doctors again and again, but she is emphasizing only on diagnosis. That is called a what? Hypochondriasis. If there will be symptoms, more than one symptom, somatization disorder. Only pain, somatoform. No symptoms, only emphasizing on diagnosis. I think I'm having this disease, preoccupation. Okay, the ideas or having fear that she is having one or more diseases, right? So physical symptoms are not there. This is called as what? Hypochondriasis. Hypochondriasis is repeatedly asked question. Okay, no, repeatedly asked question. Dr. John है ना, वो आएगा उसमें. Don't worry, अभी आएगा वो. That part will come. Okay, no? Fine. Okay, there is one more disorder that is called the factitious disorder. See what is happening here. Factitious disorder means what? If a patient is faking symptoms simply to get hospital attention, simply to get hospital addiction. Okay, simply to, okay, means they are hospital addicted people. Okay, so what is happening here? Patient will fake symptoms. Patient will say, okay, doctor, I think I'm having abdominal pain. okay, like at right lower quadrant, sometimes I feel like nausea. Please admit me, do some investigation. I think I'm having appendicitis. So mostly if he is able to speak like this, no, so mostly they will be having medical background. Okay, medical background, right? A medical background, right? This is called as what? Okay, faking symptoms to get admission in hospital. This is called as factitious disorder. Munchausen syndrome, Munchausen syndrome, Munchausen syndrome. Okay, no? Fine. But if doctor is faking symptoms so that he can admit the patient for more time, that is called as Munchausen syndrome by the proxy. Munchausen syndrome by proxy. Very important. Somatization, more than one symptom. Somatoform, only pain. Hypochondriasis, no symptoms, only fear of having disease. Factitious disorder, Munchausen syndrome, faking symptoms to get admission in hospital. If doctor is faking symptoms so that patient can be admitted, then it is Munchausen syndrome by proxy. Okay, now we are going to learn, okay, different chapter, psychoanalysis. Who is he? He is Sigmund Freud, father of psychoanalysis. Okay, fine. See here, a very, very important thing, like he gave, like he was the main person, like who was managing the case of hysteria. New name is dissociative disorder, and that is also called as what? The conversion disorder. He gave the technique of free association and slip of patient, a slip of tongue, right? Yes, Dr. Raman, it will be there, yes. Okay, fine. So please understand that he gave psychosexual stages of development, structural theory of mind, everything he gave. Fine. Okay. Okay, see, like there was also a concept that sometimes, okay, patient is going to develop some feelings for the doctor. Okay, you have seen that movie Dear Zindagi, Shah Rukh Khan and Alia Bhatt. Okay, there after a certain time, Alia Bhatt, okay, she developed some feelings for Shah Rukh Khan. Okay, na? Like in that movie, Shah Rukh Khan was a psychiatrist, right? No? Okay, so feeling that the patient develops for the doctor, it is called as what? Transference. And sometimes if there will be a beautiful patient, if feeling, okay, like suppose if the doctor is going to develop the feeling for the patient, it is called as what? Counter. Okay, easy to understand? Fine. So please understand that how to differentiate this from factitious disorder. Factitious disorder से कैसे इसको differentiate करेंगे? देखो, factitious disorder में क्या था? Faking symptoms, wrong symptoms, they are lying. But here, real development of emotion, real development of emotion. If patient is developing feeling for the doctor, it is called as what? Transference. If doctor is developing feeling for the patient, it is called as this is known as the counter transference, right? Okay, fine. He gave a structural theory of mind. He divided into id, ego, and superego. Id means what? Like one FMGE student, no? One FMGE student or anyone. It means after 15 days you have exam, and one part of mind is saying, no, I have to enjoy, I have to enjoy, I have to enjoy, I have to enjoy. Okay, no, I have to enjoy. Right? No? Fine. No? Okay, so that part of mind is called a what? Id. But one part of mind is saying, no, you cannot enjoy, you cannot watch movies, you have to study. Superego. But in between, okay, one part of mind is coming, that is called as ego. Okay, and ego is, okay, ego comes there to balance. What is happening here? If id and superego, if they keep on, if they keep on fighting, there will be conflict, and because of that, there will be development of anxiety. There will be development of anxiety, right? No, anxiety. And to reduce that anxiety, ego plays a vital role. Ego will come in between. Ego will say, okay, no problem. You can study for 4 hours. After that, you can watch movie for 1 hour. Okay, no? So id works on pleasurable principle. Superego works on moral principle. Ego works on reality principle. And this is the question. So ego helps in defense mechanism. Ego helps in defense mechanism. Okay, no? Defense mechanism. Ego helps in defense mechanism, right? Chalo, theek hai. Okay. See, like there are some defense mechanisms. See, like there are different defense mechanisms. See, like sometimes they are asking the question, but mostly they are not asking the question. Okay, so this is also a big topic. So I will be explaining only a few points here from where you can get the question. See, like suppose if a mother, okay, from where you will get the question, that part only I will explain. Okay, the point where I'm expecting. Okay, see what is happening is, suppose if the mother who lost her child, she is not accepting that truth. Okay, every day she is waiting for her son, because if she is going to accept it, okay, she's a single mother, she can have heart attack that, oh my God, I've lost my husband, I've lost my son also. So what is happening? Refusal to acknowledge the reality, that is called as denial. Okay, see here, yeah, next is called the passive aggressive behavior. Okay, passive aggressive behavior, indirectly expression of your anger. A father who slapped his son, okay, son is 7-year-old, he also wants to take revenge, but he cannot slap his father back. So his father asked him, go and get a glass of water. He went there, and just what happened? Okay, while bringing the water, suddenly in front of father, he will leave the glass. Passively, he is showing aggression. This is called as passive aggressive behavior. Okay, fine. Now I'm working in a hospital, okay, full of pressure. For last 1 month, I'm on work. Fine. So what I'm doing, that I'm going back to the earlier phase of my life. Okay, like I'm also going to play in a mango garden where all other kids are playing in a rainy season. I also started jumping with them. I also started laughing like the kids. Final regression, going back to earlier phase of life, simply to reduce the tension of present life. The projective identification, okay, leave it. Okay, displacement. Okay, displacement from here. See, like the points which I'm expecting from there only, they are making questions. Okay. Fine. Displacement means what? Shifting emotion about one person to another person, from one person to another person. Displacement. Father slapped elder brother slapped younger brother slapped younger sister. Displacement, shifting of emotion from one person to another person. एक का गुस्सा दूसरे पे उतारना. Displacement. Intellectualization, excess use of knowledge to avoid the painful emotion. One general physician who got diagnosed by pancreatic cancer, now he is discussing a lot with the pathologist. Yeah, pancreatic cancer actually because of alcoholism, because of gallstone and all. Okay, no, yeah, he is discussing a lot simply to avoid the painful, like emotions. Isolation of affect, removing the feelings associated with a stressful life event. A female who got diagnosed by breast cancer, suddenly she is coming to her home and she is saying to her mom that, Mom, I got diagnosed by breast cancer. No problem at all. Next week, I'm going to be operated. Okay, fine. I'm going to sleep. Chalo, bye-bye. She is isolating her emotion. Repression. A daughter who was sexually abused by her father, unconsciously, what is happening here? Unconsciously, she will forget it, so that if she is able to recall it, if she is going to retain it for the longer time, right? She will always be having anxiety and all, right? Unconsciously, she will forget it. After that, she will think, no, I think that was a nightmare. Nothing happened. Rationalization, offering rational explanation to justify own unacceptable behavior. I don't want to drink. I drink because of my wife only. Every time she's just shouting. I don't want to drink just because of her. Rationalization. Reaction formation, forming reaction exactly into opposite. A man Means a senior doctor, like a beautiful intern, came to the department, and senior resident, he started seeing her. Fine. So like other colleagues, okay, they understood that. They understood that he liked her. He liked her. Fine. So like other people like no. So other people, right now. So they asked other people. They asked, "Hey, you like Rima? Huh? You like her? Huh? No, I hate her." If he accepts the truth, he will be embarrassed, right now. So that will be embarrassing situation for him. So he will form reaction exactly into opposite. No, I hate her. Reaction formation, undoing. Last night, a husband and a wife, they fought, and next day, husband is presenting a gift. Okay, sorry, darling. Undoing. Aim inhibition. One MBBS aspirant, like he tried for 5 years, and finally he took BHMS or BMS, so that at least there should be the name of doctor before his name, right? Altruism means what? Satisfying internal need by helping others. A drunk man who lost his son while driving, he started a campaign against the drunk driving. Okay, no? So now he started a campaign because he was having so much regret because of my drinking habit only. I lost my son. After that, he started organizing seminars and workshops so that he can educate people. Okay, don't drive and drink. This is what? Altruism. Anticipation. You are planning in advance. A senior doctor, 45-year-old senior doctor who is working in hospital, suddenly he is getting a phone call from his wife. Wife is saying that I have seen your old mails. Okay, your sexual chat with Samira. Please come back. After that, what he will do? Just before reaching home, 5 minutes before, he will take nitroglycerin here, sublingually, anticipating a biggest fight, right? Right? Fine. So this is what? Anticipation. Planning in advance to deal with an uncomfortable event, right? Humor means what? Using comedy to deal with unpleasant feeling and situation. This is very common among medicos also, no? Fine. So 2 medicos joked and laughed at themselves after getting humiliated by the examiner in Viva. Okay, sublimation means what? See what is happening here. This is the expression of unacceptable feeling in a socially acceptable manner. See what is happening here. Like a man is there, a middle-aged man is there. Okay, no? He wants to have sexual intercourse with so many women, but this is unacceptable by society. So what he has started doing, that he has started making nude paintings of females. Sublimation. Please understand that all defense mechanisms are under the unconscious domain of ego, except one: suppression. FMG aspirants, for last 5 months you are studying, you are so much stressed, so much exhausted. So like voluntarily you are saying that I'm going to stop it. I'm not going to study now. I'm not going to study. Today I will not study. Okay, today I will not study. Voluntarily you are closing your books simply to release your tension. Suppression. Okay, last point here, psychosexual stages of development. एक बार ये टॉपिक को सब लोग देख लेना एक बार. What is happening here, na? See, excess of anything is bad. If you use defense mechanisms a lot, no, so this can develop. Okay, this can result into development of some psychiatric illness in future. See, if you are using reaction formation again and again, or isolation of affect, it can result into OCD in future. If you are using displacement again and again, maybe phobia in future. Okay, no, so like sometimes they are asking question. Okay, see, this part is important here. See, Sigmund Freud, he gave 5 stages of psychosexual development. Okay, one is oral stage, anal stage, phallic, latent, and genital. Okay, fine. So what he gave that, he said that, see, not only adults are enjoying sex, not only adults are having sexual pleasure. See, even a child of 1 year also he is having, okay, like he is getting pleasure by sex. How? Okay, but they are having different methods of sexual gratification. Oral stage, 0 to 1, 5 years. Child will derive pleasure in chewing and cutting and biting. Anal stage 1.5 to 3 years. The child will get sense of achievement by getting toilet trained, right? See, but what is happening here? See, from 1.5 to 3 years, this is fine. 1.5 to 3 years, that is fine. 1.5 years, this is fine, right? Okay, fine. 1.5 to 3 years, fine. But even if a child is 7-year-old and he is enjoying it, so this is called a what? This is called as fixation happened at anal stage. At any stage of fixation, this can result into what? Agar anal stage पे हुआ तो उसको OCD develop होगा future में. Phallic stage, phallic stage, okay, 3 to 5 years. See what is happening here. See, in this age group, phallic stage, what is happening in this age group? Okay, see what is happening in the phallic stage here. From the 3 to 5 years, 3 to 5 years, here site of pleasure is genital area, and organ of interest for both sexes will be penis. A male child will be attracted for his mom. Okay, so male child, a boy is sexually attracted towards the mom. This is called as 𝗵𝗵 complex. 𝗵𝗵 complex. If female child is attracted towards the father, 𝗓 complex. 𝗓 complex. Remember this part that 𝗵𝗵 complex and 𝗓 complex at which stage? Like it is seen? It is seen at phallic stage. Phallic stage. Phallic stage. बस इतना याद रख लो. This is more than enough. Okay. Okay, fine. See here, organic mental disorder में क्या होता है यहाँ पे? See, please understand that delirium and dementia we have to differentiate. Delirium and dementia. How to differentiate delirium and dementia? Please understand that. Please understand these 2 points here. How to differentiate delirium and dementia? See, delirium means what? Disorientation to time, place, and person. Basically, I'm talking about there will be what? Clouding of consciousness. Okay, now there will be clouding of consciousness. There will be acute, sudden and acute presentation. Okay, sometimes there can be delusion and hallucination. Okay, fine. Chalo, theek hai, samajh gaya bhai. But what about dementia? There is no acute, no sudden, okay, no sudden presentation. It will be what? There will be the gradual progression. No clouding of consciousness here. No clouding of consciousness. Please understand that delirium and dementia. Delirium में क्या होगा? वहां पे clouding of consciousness है. Dementia में no clouding of consciousness. Delirium, acute onset, sudden onset of symptoms. Dementia, it will take so much time, mostly in elderly. Delirium, elderly also, and long-term hospital admission, or maybe after big surgeries, right? Okay, fine. Now the question is that delusion and hallucinations are seen in this delirium also, Then how to differentiate it from schizophrenia? Please understand that in schizophrenia, delusion and hallucination will be there for the longer and longer time, right? No, longer time. But in delirium and dementia, it will be only for the brief time. बस इतना याद रख लो काफी. See, how to differentiate delirium and dementia? This is the question they are asking. How to differentiate delirium and schizophrenia? This is the question. How to differentiate delirium and dementia? Okay, delirium, acute and sudden onset, means a patient was admitted in burns department for the last 9 days. He was able to recognize doctor and nurse, but suddenly he's saying, oh my God, where I am now? Hey, who are you people? He's not recognizing doctor. This is what? Delirium. Delirium. Dementia, loss of memory, loss of the learned action and all, right? That is dementia. Okay, itna yaad rakh lo, kafi hai. Please remember that. Okay, we are using what? MMSE to assess what? Organic mental disorder. Total number of points will be up to 30. Up to 30. Less than 24 means what? Like there is organic mental disorder, there is impairment in the cognition. Okay. Okay, remember just some points of the neurologic part. There are the two types of dementia. One is called the subcortical and one is called the cortical dementia. Please understand that whenever there will be involvement of the cerebral cortex, so what kind of function? Okay, so what kind of dysfunction will be there? So there will be functional problem like there will be amnesia, lack of memory, apraxia, lack of what? Okay, learned behavior. Aphasia. Aphasia means what? Aphasia means patient is not able to speak. Okay, lack of wordings. Agnosia, patient does not recognize the face, recognize the perception. Find acalculia, lack of mathematical calculation. Okay, so कौन सा example याद रखो? Alzheimer's. But subcortical organ agar wo ho jaye isme like okay brainstem and cerebellum, so mostly motor function problem. Like if there will be like this kind of what, this kind of situation will be there. Find so like in the Parkinson's, Huntington chorea, right? Okay. Okay, now pediatric psychiatry here. देखो pediatric psychiatry में most important topic क्या है? Autism. Most important topic is autism. And next is what? ADHD. ADHD. Autism ka yaad rakho. See here. Autism ka you are going to remember this one. Okay, na? Autism means what? Okay. Dekho. Autism ka yaad rakho. Please understand that. See, whenever there will be problem in what? Impairment in social interaction, impairment of language, restrictive behavior. Bas itna remember. Okay, see these many points you are going to remember. See, like there will be mental retardation also. There will be mental retardation. Okay, mental retardation in autism. See what kind of question they are asking that a 5-year-old child with history of birth asphyxia does not communicate well. Problem in the communication. Slow mental growth. He does not mix with people. Limited interest. Autistic disorder. Now, ADHD means what? Attention deficit hyperactive disorder. If a child is very much, like hyperactive, inattentive, he is disturbing other kids every time he is, so because of this, what is happening here? He is not able to pay attention in classroom. So what is happening here? He is having lack of attention. Lack of attention means what? CNS is not stimulated, right? CNS is not stimulated. So you have to give what? So overall, the drug of choice will be what? Okay, drug of choice will be CNS stimulant. CNS stimulant, right? Like methylphenidate. But CNS stimulant like methylphenidate, what is happening here? And modafinil also. But the drug of choice for ADHD is methylphenidate only. Okay, now. So what is happening here? CNS stimulant, this is having what? Addictive effect. It should be avoided if there is a family history of drug abuse. If there is family history of drug abuse, do not give CNS stimulant. Or if child is having seizure. So like in this condition, see what is happening here? In this condition, you have to give non-stimulant. Non-stimulant like atomoxetine. Answer is D. Okay, fine. See here, ECT के बारे में याद रखो. Some extra points related to ECT. ECT का मतलब क्या होता है? Electroconvulsive therapy. So please understand that ECT earlier this was started. Okay, earlier ECT was started only for schizophrenia. Only for schizophrenia, right? Only for schizophrenia. But now ECT is having best effect in depression. The question they're asking that in which type of depression you are going to use ECT, electroconvulsive therapy. Okay, no? See in which condition? So you are going to use like whenever there will be depression. Okay. Associated with suicidal tendency, if depression is associated with stupor, or if depression is associated with psychotic symptoms, right now, and refractory to other treatments. If patient is not responding to other medication for depression, in these conditions, yes, ECT will be having the best management. Okay, now you tell me, ECT can be given to a pregnant female? Yes, it can be given. It can. Please understand that. Okay. See, first of all, we have to save the mother. Okay, no, because, okay, like suppose if a pregnant female is there and if she is having suicidal tendency, yes, ECT can be given. ECT can be given. Yes, ECT should be given. Okay. So what is the most common side effect of ECT? Okay, memory disturbances, memory problem, retrograde amnesia. Okay, see here, operant conditioning here. Operant conditioning means what? See here, see when I talk about reinforcement. What is the meaning of reinforcement? Increasing the frequency of activity. Anesthesia used. Okay, fine. चलो ठीक है. ECT के बारे में कर लो यार. देखो ECT के बारे में earlier we were not using any anesthesia, so that was called as the direct ECT. So because of that, there used to be dislocation of teeth, there used to be fracture of bone, but now we are giving what? But now we are giving anesthesia. So this is called a what? Indirect ECT. Methotrexate is the anesthesia of choice, right? Chalo, fine. Okay, so the question is that after how much time we are going to see that a patient is having chronic schizophrenia? More than 2 years. Okay, fine. Operant conditioning means what? Okay, see, one is called the positive reinforcement. See, what does it mean? See, with our behavior, with our activity, we can increase the behavior, we can decrease the behavior. Okay, we can increase the frequency, decrease the frequency of work. Okay, positive reinforcement. Suppose if I'm asking a child, you study for 2 hours, I will give you 2 chocolates. Okay, the child will be studying for, okay, maybe you ask a child, you study for 1 hour, I will give you 1 chocolate. After the child will study for 2 hours, he will be asking 2 chocolates. So the behavior is increased by reward. Okay. A child is going to clean his room more time to avoid scolding by her mother. Here also frequency increased, but because of the negative factor. This is called as negative reinforcement. Reinforcement means always the frequency will be increased. Punishment. A child will stop using foul language after getting slapped. Behavior is decreased. One hardworking intern who was not appreciated by senior, she stopped working. Here also behavior is decreased. It is called as extinction. This is not so much important. Okay, they are not asking from here. This is also not so much important. Rorschach's test and all. देखो ये Rorschach's test याद रख लो. Rorschach's test. Sometimes they can ask you a Rorschach's test. Okay, sometimes they can ask you a Rorschach's test. Okay, Rorschach's test means what? Rorschach's test, what is happening here? You are going to show some pictures to Hannah. Okay, this is the this type of 9 to 10 pictures you are going to show to the patient, and after that you are asking, what do you see here? This is called as Rorschach's test. Maybe they can ask thematic apperception test. Okay, thematic apperception test. Okay, what does it mean? Thematic apperception test. Okay, thematic apperception test means this picture you are showing to the patient, and you are asking, what do you see here? So every person will be having different. Okay, one can say, like she is a witch and she is a princess. One can say like she is the grandmom of this lady. So kuch bhi hoga. This is called the thematic apperception. Basically, you are asking the patient to make stories. That's it. Maslow hierarchy of needs. See why I'm teaching you, because this was the question in AIMS. You can anticipate maybe. See what is happening here. first of all, everyone is supposed to, like, first of all, to achieve physiological needs like roti, kapda, makan, like breathing, food and water, sex. If a person is able to achieve, okay, these physiological needs, after that only he will be looking for safety, okay, security of family and all. And when he will be able to achieve safety, then only he will be taking care of love and belonging. He will be maintaining friendship. After that only he will be taking care of esteem, and then finally he will become what? Leader. So first of all, physiological, after that safety, after that love, after that esteem, after that self-esteem. This is Maslow's hierarchy of needs. Okay, see, last topic here, this is substance abuse. Okay, substance abuse mein, like, only some points I will teach you, only some points. Okay, no, only some points I want to teach you. Substance abuse mein. Okay, देखो, substance abuse में जो important part है, what kind of question they are asking, that part I'm going to teach you. That's it. Okay, from where they are asking question, that part only I will be teaching you. Okay, chalo, one thing. Only 15 minutes more. Okay, 15 minutes more. See, the most important topic is alcoholism. Alcoholism is the most important topic. Alcoholism. Okay, first of all, like, if they are asking that most common substance of abuse in India right now, most common substance of abuse in India, substance use India में सबसे ज़्यादा कौन सा है? Alcohol. As per 2019 de-addiction center research. But if they are asking most common illicit drug, illicit matlab what? Illegal drug. This is what? Cannabis. Okay, remember this part. ठीक है, चलो, fine. Okay, see here, यहाँ पे एक important point है, you have to remember this part. Okay, please understand this part here. See, every day I'm using only one peg of alcohol. Only one peg of alcohol. I do not have any physical problem. I do not have any family problem. I do not have any legal problem. But now I'm taking, every day I'm taking up to 3 pegs. Fine. No? Now what is happening here? Like, whenever after drinking, I'm making noise in my community. So I'm having legal problem now. I'm having legal problem. I'm having family problem. I'm having problem in my professional life. Okay. See, when I do not have any problem, yeah, it is called as what? Substance use. Okay, now when I'm having problem, this is called as substance abuse or harmful use. Okay, fine. But what is happening here? Earlier, I used to get kicked only after 4 pegs, but now I have to take 6 pegs. I have to take 6 pegs only, right? 6 pegs. Fine now? So now I'm having 6 pegs. I have to take 6 pegs. Okay, then only I'm getting kicked. It is called as what? Tolerance, right? Okay, fine. After that, what is happening here? See, every day I used to drink at 9:30 in the evening time. Okay, I got late in my hospital, and now it's 9:45. Now I'm having a strong desire to have it again. Have it. Okay. After that, what is happening here? See, suppose, okay, next day, what is happening here? Okay, next day, see, one day I wanted to stop it. After that, I started having so many withdrawal symptoms. Okay, fine. After that, what is happening here? See, now I'm having some problems. Okay, now I'm having some problems. Okay, now when I'm visiting my doctor, the doctor told me, okay, you should not take it. Okay, no, because your liver is almost damaged. So in spite of alarm, in spite of warning, in spite of harmful effect, I'm using it. Okay, fine. I do not have any alternative of pleasure. Okay, no, I do not have any alternative of pleasure. Means like they're saying okay, you can use some other substance, but stop alcohol. I'm not stopping it. Okay, no, I do not have control on using it. Okay, no, equal to or more than the 2 out of 6. If a person is having, it means what? He is dependent. It is called as a dependency over this substance. Dependence. Okay, no, dependency. A person was using 6 packs of alcohol every day for last 15 years. Now is getting kicked only after 1 pack. This is called a what? Yeah, this is called as reverse tolerance. This is called as a reverse tolerance, right? Oh, reverse tolerance. Okay, this is called as reverse tolerance. So this can happen how? Okay, because of the super sensitivity of the receptors, or maybe because of the multiple organ failure. All right. Okay, see this apparatus. This is okay. This is the breath analyzer, and this is going to check okay, blood alcohol concentration. Blood alcohol concentration. Okay, please understand here that okay, very important point which I want to teach you, that is called the Maylen-By effect. Okay, Maylen-By effect. Okay, from here you are going to get the question. Maylen-By effect. Okay, now Maylen-By effect. Okay, Maylen-By effect. Please understand this part here. See what is happening here. You are drunk and you are driving. Okay. See what happened. Okay, when police stopped you, at that time, the blood alcohol concentration was 45 milligram per deciliter. In India, how much is the driving limit? Only 30 milligram per deciliter. At that time, he should not make any challan. Okay, at that time, he should not make any challan. He should ask you, please wait at the roadside. After half an hour, again, he's going to check. But now when he's going to check, now blood alcohol concentration level is only 30 milligram per deciliter. Only 30 milligram per deciliter. Now he should not make a challan. He should not make any challan. He should leave you. Why? Because increasing level of blood alcohol concentration level is having higher behavioral changes than the decreasing level of blood alcohol concentration. This is called as Maylen-By effect. Maylen-By effect. This is called as Maylen-By effect. Okay. Chalo, fine. Okay, now next point here, what I want to teach you. Okay, next very, very important point, please understand. Okay, see now what is happening here. Now if a person wants to, okay, now if a person wants to, suppose if a person, he wants to stop it. Okay, no? Okay. So how we are going to manage the case? Please understand that if there will be blood alcohol concentration level in India, the driving limit is 30. More than 80, there will be incoordination. More than 200, there will be what? Alcoholic blackouts, anterograde amnesia. More than 300, the patient can die. Okay, fine. So now you tell me one thing. Suppose if a person who wants to stop having alcohol now, he wants to stop the consumption of alcohol. Okay, fine. So what will be the symptoms? From here, you are going to get the question. See what is happening. A first symptom that will occur, that is called as what? First symptom that will be tremor. First symptom, this will be the tremors only, right? This is the most common and classical symptom. Please remember this point, that how to remember this part, how you are going to, more than 6 hours. More than 6 hours, just after 6 hours, okay, just after 6 hours of cessation of alcohol, means जब से उसने शराब पीना छोड़ा उसके 6 घंटे के बाद पहला साइन आएगा, ठीक है ना? फाइन. सो फर्स्ट सिम्टम विल अकर आफ्टर 6. ये याद रख लो, बहुत ही इंपॉर्टेंट है. ओके, see here, the first symptom will occur after 6 hours, more than 6 hours. So first will be what? There will be tremor more than the 12 hours. Okay, there will be what? Alcoholic hallucinosis. Alcoholic hallucinosis. Alcoholic hallucinosis. More than the 12 hours. Alcoholic hallucinosis. More than 24 hours. Seizure. Seizure. More than 48 hours. Delirium tremens. See, this rule you are not going to forget. This is what? Okay, this is 6, 12, 24, 48. Okay, 6, 24, 6, 12, 24, 48. Repeatedly asked question. Last time also there was a question that if a person who is having just after stopping the alcohol, he is having what? Alcoholic hallucinosis. Hallucinosis. How many hours back he stopped it? Find out more than the 12 hours. Okay? Symptoms as per the duration. You have to remember. Okay. अभी हो तो 5 मिनट और 10 मिनट और मैक्सिमम. लास्ट टॉपिक है, फिर 10 मिनट बात करता हूँ. 10 मिनट. Okay, please understand that. See this part here. See, repeatedly asked question. Suppose if there is, okay, just after 6 hours, 6 hours after cessation of alcohol, first symptom क्या होगा? There will be tremor. More than the 12 hour, alcoholic hallucinosis. More than 24 hour, seizure, seizure, seizure. More than 48 hours, there will be what? DT. DT, delirium tremens. Okay, remember. After that, frequently asked question: which vitamin deficiency is seen in alcoholic people? Which vitamin deficiency? Please remember, this is what? Vitamin B1. Vitamin B1, which is called as the thiamine. Vitamin B1, which is called as the thiamine. Okay, no, thiamine. Okay. So now what is happening is, suppose if a patient is there for the management, if a patient is there for the treatment, if a patient is there for the treatment, okay, fine. So देखो एक और चीज समझ लो यहाँ पे. See, like whenever there will be vitamin B1 deficiency, there will be development of 2 important disease. One is called the 𝗲𝗏𝗔 encephalopathy. 𝗲𝗏𝗔 encephalopathy. And second, there will be what? Okay, 𝗲𝗏𝗔 encephalopathy. Second is what? Korsakoff syndrome. Korsakoff disease. Okay, 𝗲𝗏𝗔 encephalopathy and the Korsakoff disease. Okay, remember what you are going to see in 𝗲𝗏𝗔 encephalopathy. You have to remember GOA, global confusion, matlab mental confusion, ophthalmoplegia, and ataxia. So they are asking that in 𝗲𝗏𝗔 encephalopathy, which vitamin deficiency is seen? That will be due to what? Okay, that will be due to deficiency of vitamin B1. And what about Korsakoff syndrome? Vitamin B1. Remember this part. Okay. How you are going to treat the case of alcoholism? Okay? Okay, fine. See, first of all, okay, what is my intention? How I'm going to help my patient? I will be detoxifying it. I will be doing what? Detoxification. I will be doing what? Detoxification. Okay, detoxification. How to detoxify it? How to detoxify it? Okay, with the help of benzodiazepine, we will be giving what? Chlordiazepoxide. Chlordiazepoxide. Okay, chlordiazepoxide. Why this is the, okay, because this is having long duration of act. Okay, half-life is half day to full day. Okay, fine. Along with this, we have to give thiamine injection. Thiamine injection. How much? 250 milligram. So we have to give chlordiazepoxide. Along with that, we have to give thiamine. Okay, minimum for how many days? Okay, for 7 to 14 days. For 7 to 14 days. after that chalo theek hai, we have detoxified his body, है ना, we have detoxified his body. Okay, fine. But how to maintain it? We have to maintain it with the help of, okay, deterrent agent. See, whenever there will be metabolization of alcohol, no, alcohol will be metabolized into, बताओ किस में आएंगे? Acetaldehyde. Acetaldehyde. Okay, this will be converted into acetic acid. Okay, this will be converted into CO2 and water. CO2 and water. So there is one enzyme, dehydrogenase enzyme. Okay, this enzyme is very, very important to convert acetic acid. Otherwise, okay, see, like if there will be blockage of this enzyme, then there will be, okay, like suppose even after stopping, after quitting, after detoxification, if a person is going to consume alcohol again, there will be metabolization and this will be converted into acetaldehyde. And after that, if we are going to block this enzyme, then there will not be further conversion. Fine. So acetaldehyde is what? This is an itching agent. This is an itching agent. This is an itching agent. Because it is going to what? This is going to stimulate histamine receptor. After that, patient will be having rashes over the body. He will be having headache. He will be having nausea and vomiting. He will be having low BP. He will be having dizziness. So after that, he will not try to take alcohol again. This is called a what? Disulfiram-like reaction. Deterrent agent. Deterrent agent. But if a patient is there who is of high profile agent, okay, no? High profile above. He's saying that, sir, if you give me deterrent agent, no, after that, like actually I'm the manager of 7-star hotel. I have to drink sometimes, like in front of my clients. Like if I do not drink, I will lose my proposal. I will lose my, I can lose my client. So give me some drug where I can use it. But after that, I should not have the feeling of having alcohol again and again. So then you are going to give what? Anti-craving agents. Even after that, he can have alcohol, but he will not be having the desire to take it again, like naltrexone, acamprosate, and topiramate and all. Okay? Overall, in substance abuse, most important is the alcoholism. Alcoholism के लिए that is more than enough to understand. Heroin के बारे में क्या देखो? Heroin के बारे में flu-like symptoms. Remember, flu-like symptoms, है ना? Flu-like syndrome, like rhinorrhea and all, है ना? Flu-like syndrome is that will be seen in the withdrawal symptoms of heroin. Heroin is what? Opioid. Okay, no? See here, street names are smack and brown sugar. Okay. See, what about this one? Cannabis. So basically, bhang, hashish, and all. What is happening here? Here, what kind of situation you are going to see? You are going to see a depersonalization and synesthesia. Sometimes what is happening in a person who will be abusing this bhang, no, like at that time, what is happening here? There will be sometime he will be having so much anxiousness. There will be fear. That is called what? Bad trip. Sometimes there can be what? Psychotic symptoms, like in bhang abuse, hemp insanity. Okay, there is something called as flashback phenomena. This will be seen in bhang, ganja, hashish, as well as LSD. What is the meaning of flashback phenomena? Please understand this part here. Flashback phenomena mein kya hota hai? See, this is not flashback phenomena like, like PTSD and all. Ki tumko kuch yaad aa raha pehle ka, no. What is happening is, suppose if you are fat, suppose if there is more fatty deposition in your body. So, okay, there will be deposit of this drug in your fat, and even after 7 days of abusing the bhang, okay, you are in operation theater. Suddenly, what is happening here? There will be discharge of this substance in your bloodstream, and again you will be having same feeling that you are having the bhang. So there you will be having what? There you will be having pleasure. Fine. This is called a what? Flashback phenomena. It is seen in cannabis as well as LSD, both. Running amok. Running amok means what? Okay, suppose if a person who is developing rage, what is happening here? He will be running on the road and he can kill, he can hurt someone. So during running amok, what does it mean? Running amok is, okay, this is considered to be a mental condition. If he commits any crime during running amok, he will not be punishable. This is more than enough. Okay, see, substance abuse में बस इतना काफी है, more than enough है समझने के लिए, ठीक है? Okay, exam के लिए this is more than enough. Okay, sometimes they are asking that, okay, cigarette cessation के लिए कौन-कौन से ड्रग है ना, cigarette smoking से बचने के लिए, right? Cigarette के लिए one is the bupropion and varenicline and clonidine and nortriptyline. चलो फाइन, ठीक है. साइकेट्री हम जो ओवर किया से now it is 6:46. Psychiatry is over, but forensic we have to complete. If you want, I can continue now. नहीं तो microbiology or pharma will be complete in 4-5 hours. After that, I can complete your forensic also. So like if you want, I can continue. Forensic I will teach you for 4 hours. Or maybe next time. Okay, चलो ठीक है. अभी कुछ देर के लिए पहले break ले लो. I will decide and I will talk to office people now. अगर कुछ time extra मिलता है या तो मैं कल कर दूंगा या फिर day after tomorrow. या with pharma I can do. ठीक है ना? With pharma I will do. Okay, fine. Do one thing now. Okay, do one thing. First of all, you take up to 10 minutes break. ठीक है? You take up to 10 minutes break, and I will be discussing here. Okay, then I will inform you in that group. Okay, so you take 10 minutes break now. Yeah, pharma revision by Dr. Salman only. Okay, you take 10 minutes break now. I will inform you soon. Are we going to continue or not? Okay, fine. We are going to start forensic medicine. Dekho, forensic medicine I will take up to 8:30. ठीक है, 8:30, and after the remaining part, okay, for 2-3 hours. Okay, tomorrow after pharma I will take. Okay, na? After pharma I will take. Okay. Okay, chalo part. So some parts we take here. Okay, forensic medicine. Okay. Okay, first of all, so general aspect. Okay, see, related to the transplantation of human organ. Okay, related to the what? Human Transplantation Organ Act. Okay. See, what is the question here? So please understand what is happening here. Whenever a person will be calling, okay, see, whenever like a doctor has to harvest the organ, whenever a doctor has to harvest the organ, fine now. So before that, a doctor is supposed to declare that person is brain dead. Person is brain dead. Fine now. So which doctor should not be allowed to go there to pronounce someone as brain dead? Okay, please understand that. Okay, see, ideally, like it should be announced by, ideally it should be done by whom? Ideally, it should be like it should be done by neurosurgeon or neurophysician. Ideally, okay, no, ideally, but yeah, but okay, see, anyone can do it. Like, okay, the main physician, right? The main physician or the registered medical practitioner who is in charge of the hospital. But the doctor who belongs to organ transplantation department, no, he should not go there. He should not there. Okay, no, why? Why he should not be there? Because see, he will be having some kind of interest, right? No, he will be having some kind of interest, right? He will be having some kind of, because, okay, like suppose if there is a patient who is waiting for, like there's a patient who is waiting for like renal transplantation or maybe any kind of. So what is happening is that doctor, he can go there and one thing, like he can be thinking that like even that person is not brain dead, he can declare him so that he can get one organ. So he will be having some interest right now. So any doctor who belongs to organ transplantation department should not be allowed to go there. Okay. Okay, fine. So how we can, the death declaration we are going to understand. First of all, please understand that. So just after the death of a person, okay, what is happening here? When there will be 100% stoppage of circulation, okay, whenever there will be a stoppage of heart, okay, stoppage of brain and a stoppage of the respiration. So when heart, lungs and brain, when they stopped to work, okay, when they stop to work, this is called as somatic death, systemic death. After that, okay, now, so what is happening when the brain function stopped to work means there is what? All reflexes of brain stem is gone, okay, are gone, fine now. So now it will be considered as that. See what is happening here. Please understand what is the meaning of the somatic death. Somatic death means what? Like whenever there will be 100% stoppage of brain, heart and lungs, but like at that time aerobic processes are gone, but anaerobic process will still be working. So what is happening here, even if there will be mechanical support, okay, muscles will still be responding. If you are going to give what? Okay, myotics and mydriatics, okay, pupils will respond. Fine. But what is happening is, so what are the clinical criteria to diagnose brain death? From here you can get one question. Okay, na? Chalo, fine. So first of all, a person should be in coma. He should be in coma. Okay, na? So how much is the GCS scale to diagnose that person is in coma? Okay, less than 8, right? See, out of 15, okay, Glasgow coma scale in between 3 to 8. Okay, 3 to 8. So okay, we can say that patient is in coma. Okay, now what are the brainstem reflexes which are absent? Okay, no? Okay, fine. See, first is the pupillary reflex. What is the meaning of pupillary reflex? See, if you project the light in eyes, okay, so there will be the constriction of pupil. Fine, that is called the pupillary reflex. Okay, fine. Oculovestibular reflex. Oculovestibular reflex. What does it mean? Oculovestibular reflex. Oculovestibular reflex means what? See what is happening here. Like suppose if you are going to hold someone and you are going to turn the face like this, he will be looking at you. This is called the doll's eyes. Okay, fine. corneal reflex. Okay, what is the meaning of this one? If we are going to touch the cornea, white part, okay, with any foreign body, okay, there will be blinking of eye. Fine, this is called the blinking reflex. Pharyngeal reflex. Pharyngeal reflex means what? If you are going to touch the upper part, okay, the upper part of hard palate, upper posterior part, there will be contraction of the neck muscle. That is called the pharyngeal reflex. What about this one? Tracheal reflex. See, with the help of intubation, whenever you are going to intubate, okay, and if you are able to elicit or stimulate cough receptor, a patient will be, okay, like he will be coughing, right? Okay, fine. So all these are what? All these are the brainstem reflexes. All these are brainstem reflexes. Okay, ये बताओ picture number 1 कौन सा? ये बताओ कौन सा picture number 1, picture number 2, picture number 3, picture number 4. Picture number 1 is what? Means you touch cornea part. You touch the cornea part, right now, with any foreign body object. Fine. And after that, there will be blinking of eye. So picture number 1 क्या है बताओ? Corneal reflex. Okay, what about picture number 2? If you are going to project with the torch light, right now, see, there is the constriction of pupil. Fine. This is called a what? This is called the pupillary reflex. If you are going to touch the upper part of hard palate, this is called a what? After that, there will be contraction of nape. Okay, fine. This is called a what? This is called a pharyngeal reflex. About picture number 4, oculovestibular reflex, right? You did not get the PDF? एंडी भाई वो फॉरेंसिक का पीडीएफ उसमें पोस्ट करिए ना ग्रुप में. Okay, we got, most of the students are writing, they have received it, right? Okay. Okay, fine. So these are the brainstem reflexes. After that, signs of brainstem, okay, destruction. Whenever there will be destruction of the brainstem, no, there will be what? Apnea. Okay, pulse rate invariant and unresponsive to atropine. When do you give atropine? When do you give atropine? Okay, whenever there will be bradycardia, whenever heart rate will be very, very less, at that time, if you give atropine, heart rate will be increased. So even if you give the injection of atropine, there is no increase in heart rate. Fine, no? Okay, fine. So all these things will be there. Then you can say, okay, then you are going to declare a person as what? Brain dead. Okay, fine. All these tests are supposed to be repeated, okay, at the interval of 6 hours. Okay, at the interval of 6 hours. Okay, chalo, fine. So first of all, whenever there will be a stoppage of heart, brain, and circulation, heart, brain, and lungs, it is called a what? Somatic death, right? It is called as somatic death. After a few minutes to a few hours, each and every cell of the body will be dying, right now. So that is called a what? That is called the molecular death. Molecular death. Okay, that is called the molecular death. So what is happening during somatic death? Okay, pupils will respond to meiotics and mydriatics, but during the molecular death, each and every cells of the body are already died. Fine, are already dead. So this period is called as what? This period is called as supravital period. Supravital period is very much important for what? Organ transplantation. Organ transplantation. Okay. Okay, fine. Chalo. So what is happening here? Please understand that. See how many tests I have taught you here. All these tests you are supposed to repeat at the interval of 6 hours. Please understand that why we have to do all these things, because one thing, okay, see, just after the coma, just after the brainstem reflexes, we should not be hurrying in declaring a person as dead, because sometimes there can be a reversible situation also, reversible coma also, like in hypothermia, like in hypothermia, we have to exclude all these things, okay. Okay, whenever there will be poisoning because of alcohol, because of the muscle relaxant, because of the depressants and all. So we have to rule out all reversible causes also. Fine? Okay. Okay, fine. So whenever there will be molecular death means what? Each and every cell of the body is already gone, is already dead. Fine now? Okay, fine. Okay, fine. Now the question is that at the time of the molecular death, muscles do not respond to stimuli. Okay, pupils do not respond to any drug. So what are the early signs of molecular death? Okay, liver mortis, discoloration of dead body, algar mortis, cooling of dead body, rigor mortis, rigor mortis. Okay, rigor mortis is what? Stiffness of dead body, stiffness of dead body. Okay, what are the late signs? See, late sign means what? There will be decomposition of dead body. See, okay, what is happening as self-breakdown. Okay, by the enzymes only, without bacteria is called as autolysis. With bacteria, decomposition. Okay, fine. Now, please understand there is something very important that is called as suspended animation. Please, okay, you have to revise this topic. Suspended animation means what? See what is happening, and this is called a what? Apparent death. Apparent death. A person appears to be dead, but he is not dead. Okay, what is happening here? Like at that time, all signs of life. Okay, now means what is happening here? All signs of life are not present. But what is happening there? Oxygen dissolved in the body tissue, body fluids, okay, that will be used for the resuscitation. So suspended animation, most commonly it is seen in which condition? Newborn. See, like this can, okay, this can even be seen, okay, this can even be seen where? Like in yoga practitioners and yoga practitioner during surgeries, like, you know, like during anesthesia, during, you know, like, okay, whenever we are going to operate in the thoracic cavity, right? At that time also, even in electrocution, drowning, right? No, fine. So this is very, very important topic which you are going to, okay, which you are going to answer. Okay, can you answer me this question? Signs of life are reduced to very minimum that it cannot be detected by routine clinical methods. In this situation, a person appears to be dead. Yes, this is called the suspended animation, right? Suspended animation. So see, this is the mnemonic, okay, suspended animation in new HDTV. This is there in the book right now. Okay, please remember this part that, okay, but please understand that what kind of question they're asking, that the most common type is seen, okay, most commonly it is seen in newborn. Most commonly it is seen in newborn. Okay, now some question they are asking related to autopsy. Please understand this part here. Autopsy se question पूछे जाते हैं. Okay, see here. See, which of the following is against the rule of conducting a medical legal autopsy? See, body must be identified by the police constable who accompanies it. Yes. See, it should be conducted only when there is a written order from the police or magistrate. Yes. No unauthorized person should be present at the autopsy. Yes, very true. See, this can be performed in like in a private room. Please understand that medical legal autopsy should always be performed in the mortuary house, in the government hospital. Okay. Okay, fine. So please understand that there are different types of autopsies. One is called the medical legal autopsy. Second is called the clinical autopsy. So what kind of question they will ask you here? Please understand that in which conditions we perform medical legal autopsy. In which condition we perform medical legal autopsy? Please understand that whenever there will be suspicious death or unnatural death, like road traffic accident, murder, poisoning, rape, or whatever. So please understand that in this case, in medical legal case, okay, police authorization is mandatory. But are you going to take the consent from relative? No need. Consent from relative is not required. Okay, but what about clinical autopsy? Clinical autopsy, whenever there will be natural death, hospital death. What is happening here? See, like their doctor wants to check why he died, why he died. So in natural death, in hospital death, where the cause of death is uncertain, right now, in this condition, consent from legal guardian is mandatory. Mandatory. Okay, this is more than enough to understand. Okay. Okay, fine. See, in medical legal autopsy, which of the following is incorrect? See, I'm talking about medical legal autopsy. See, this is medical legal autopsy, no? So here now, okay, now you don't need to take the consent from, okay, relatives, right? Okay, fine. Okay, so what kind of incision we give, like in autopsy? Okay, see, please understand that, see, most common type of incision is eye-shaped. Most common type of incision is what? Eye-shaped. Eye-shaped incision from the chin to pubis, eye-shaped. Okay, rapid form. Okay, fine. Suppose if I'm going to give incision from acromion to substernal notch like this, or this is called as Y-shaped, and from neck like this, this is called the modified Y-shaped. Modified Y-shaped. This is called the modified Y-shaped incision. So they are asking this kind of question, that in which condition we do modified Y-shaped incision? Modified Y-shaped incision. In which condition? Whenever there will be hanging case and strangulation case, we have to do the modified Y-shaped incision. Okay, fine. See, now what is happening? Suppose if I'm going to give incision like this, this is called the T-shaped or buckle handle shape. Okay, bucket handle shape. Okay, now what is happening here, especially in the police case, if there will be custodial death, see, in all types of post-mortem examination, we have to give incision over anterior part of the body, anterior part. But in the custodial death, okay, posterior part, acromion to gluteal part, like the X-shaped incision. This is in the custodial death. Custodial death. Okay. Okay, now what are the types of the methods of the autopsy? There are 4 methods. What is happening here? Whenever we are going to give the incision, and after that we are going to remove organs one by one. Okay, now all individuals one by one. Okay, now means what is happening here? I'm removing spleen separately, gallbladder separately, heart separately, lungs separately. Okay, na? So organ one by one. See, in this condition, what is happening? If I'm going to keep all the organs back, no, anatomical relations are not preserved. Okay, so like in Virchow's technique, organs are removed by one by one, one by one. This is called the Virchow's technique. Virchow's technique. Okay, fine. 𝗏𝗡𝗏𝗏's technique. What is happening here? Removing organs all together, en masse, en masse. En masse. So this is a rapid technique. So what is happening here? When I'm removing all organs together, then anatomical relations will be preserved. This is called as 𝗏𝗡𝗏's technique. 𝗏𝗡𝗏's technique. 𝗏𝗡𝗏's technique. Ghon's technique. I'm removing organ block by block. Cervical organs separately. Okay, thoracic organs separately. Abdominal organs separately. Genital organs separately. Block by block. Ghon's technique. Ghon's technique. I'm doing in situ dissection. I'm doing in situ dissection. Whenever I have to do fetal brain dissection, or in some condition where I'm having somewhat some risk of what? Infectious disease like HIV or hepatitis, or if there will be a risk of radiation hazard, then there I'm not going to take all the organs out. I'm going to do what? In situ dissection, which is called as 𝗏𝗏𝗏𝗏 technique. 𝗏𝗏𝗏𝗏𝗏 technique. Okay, fine. Okay, see what is happening. And now if you want to embalm a dead body, that is called a what? Artificial preservation of dead body. That is called a what? Okay, thanatopraxia. So basically you are going to use embalming fluid. They are asking that what are the constituents of embalming fluid? Please remember this part. What is happening here? We have to keep a preservative. We have to keep a preservative. So which preservative? Like formaldehyde. We are also using methanol to hold it. Okay. I want to preserve the moisturization. Moisture I want to preserve. I will be using glycerin. I want to preserve it from what? I want to keep it safe from infection. So germicide, phenol. I want to maintain the pH. Okay. Buffer, sodium bicarbonate and sodium borate. Anticoagulant, sodium citrate and oxalate. Okay, a dye, I will add one dye to preserve the natural color, eosin. I will add a perfume also, that is wintergreen. But all these materials I'm adding where? In a vehicle, so that it can be transported across the body. That is called a vehicle. Up to 10 liters of water. What kind of question they're asking? Please understand that. If a patient had jaundice, see, if a patient had jaundice, after that, if you are going to embalm the dead body, what will be the color of body? Color of body will be green color. Green color. This was the question. Are we using methanol or ethanol? We are using methanol. We are not using ethanol. Remember this one. Okay, fine. So what they are asking, that related to embalming, what is the best method of injection? Okay, discontinuous injection and drainage. And it should always be done in high pressure and low flow. And please understand that, ye batao, autopsy should be done before embalming or after embalming? It should always be done before embalming. It should always, autopsy, but the post-mortem examination, it should always be done before embalming. If you do embalming, no, you will lose all evidences. Okay, this will be crime. Okay, so first chapter is over. Okay, next we are going to learn about postmortem changes. ठीक है ना, postmortem changes. देखो जहां से क्वेश्चन आ रहा बस वही पॉइंट्स पढ़ा रहा हूं आपको, ठीक है ना. Postmortem changes. Okay, postmortem changes कब आएंगे? Whenever, see, after molecular death, है ना, just after that death. What is happening here? Please understand that. See, what will be the early signs? Early signs में क्या क्या आएंगे बताओ. जैसे early signs related to cellular death, right? Okay. Always, first of all, there will be loss of voluntary movements, means there will be primary relaxation of muscles. Okay, fine. There will be loss of elasticity. There will be eye changes. See, algar mortis means what? Algae, cold. Liver mortis, discoloration. Rigor mortis means what? Stiffening. Rigidity. So they are asking that. See, if I am asking you what is the earliest sign after death, okay, that will be eye change or loss of voluntary movement. Earliest sign will be loss of voluntary movement. But let's understand all points which we see in eyes. What are the changes? What are the changes we are going to see in eyes? See, there will be loss of the pupillary reflex. Ye sare reflex to ye ho jate, fine na? After that, whenever you are going to see, the cornea will become hazy and opaque. Please understand that after their death, what will happen? Okay, see, intraocular tension will be decreased. Hana? Okay, what is happening is, see, normal intraocular tension is how much? Okay, this is 10 to 20 millimeter of mercury. Just after death, this will be only 12. After 3 hours of death, okay, this will be only 3. This will be 0 after 4 to 8 hours after death. What kind of question they're asking that? What is the earliest sign? What is the earliest eye sign after death? Earliest eye sign after death is what? There will be a fragmentation of retinal blood vessels. Earliest eye sign. I'm not saying earliest sign after death. Earliest eye sign after death. This is called as Kevorkian sign. Okay, no? See, this can be seen only by the ophthalmoscope. Kevorkian sign, right? Okay, fine. See here, ये बताओ किसको देख करके क्या लग रहा है? What are the other names of this sign? What are the other names of this sign? Don't you feel this looks like railway trucking, railway trucking, right? Railway trucking, right? Railway trucking, cattle trucking. Okay, fine. But overall, what they are asking that, okay, what is the best medium in eye to measure time since death? Okay, that is actually vitreous changes. Vitreous changes. What exactly you want to check in vitreous humor? Especially the potassium. Especially potassium. This is the most useful component. What is happening here? Okay, what is happening here? Rate of potassium will keep on increasing. Will keep on increasing per hour. Okay, no? Fine. So even after 4 to 5 days, this will keep on increasing. So 0.7, 0.17 to 0.24. This is the rate of increment in the potassium per hour every day. Okay, see this picture. This can be your image-based question. This is called, see here. Okay, just after death, if eyes are open, what is happening here? There will be the drying and desiccation here, right now. Because of this, you can see up to 2 triangles here, right? You can see up to 2 triangles, right? These 2 triangles, this is called a what? This is known as the 𝗏𝗏 sclerotica. This is known as 𝗏𝗏 sclerotica. This sign, see, remember this sign. This sign you are not going to forget. This is the earliest eye. This is called the 𝗬𝗏𝗀𝗁 sign. 𝗬𝗏𝗀 sign. Fragmentation in the retinal blood vessels. Okay. Fine. Now we are going to learn about algar mortis. Algar mortis kabhi bhuloge. Algae means what? Algae you might have seen around the ponds. There will be green deposition. Wo jaise hai na, if you touch it, this will be cold. So cooling of dead body, no? Cooling of dead body, right? Cooling of dead body is called as algar mortis. Algar mortis. So why? Okay, because just after death, what is happening here? Just after death, yeah, there will be shutdown of what? Temperature regulating system. Okay, because of that, there will be loss of temperature. But there are, see, ideally there will be loss of temperature, so body will be cooled after death. Okay, na? Fine. But there are some situations where what is happening, after death, there will be gain of temperature. This is called as what? Caloricity, right? See, ideally there will be loss of temperature, but what is happening in some situations, there will be gain of temperature. This is called the postmortem caloricity. Postmortem caloricity, not lividity. In which condition you are going to see postmortem caloricity? Whenever heat mechanism center mein dekho, agar maan lo ki if there will be the pontine hemorrhage, right? Pontine hemorrhage, sunstroke, or if there will be the strychnine poisoning, or if there will be the tetanus, right? Strychnine poisoning, nux vomica, strychnine poisoning, or if there will be sepsis, septicemia, like meningitis, pneumonia, and also please remember that. So please remember that, see, like in some situation, there will be gain of temperature. That is called as postmortem caloricity. Repeatedly asked question. So how we are going to check that temperature? Please understand that overall ideal site, actually best site is subhepatic part. Best site is subhepatic. But most commonly, frequently, okay, this instrument we are inserting into the anal canal, rectum, that is most common site. Okay, this is called, say this instrument is called as what? This is called as chemical thermometer, or you can say a thanatometer, or you can say electronic thermocouple. How much is this size? Size is almost equal to esophagus, around 25 centimeter. Okay, fine. So what is happening here? Most commonly, we are inserting this instrument into the anal canal. But in which condition we cannot use? In a case of sodomy. In a case of sodomy, we cannot use it. Okay, no? In a case of sodomy, we cannot use it, right? Okay, fine. So now the question is that, okay, how much? Okay, where? Rate of fall of temperature. See the postmortem caloricity, which I have taught you, that is important point. Okay, now rate of fall of temperature from the dead body is highest in which condition? Where? Please understand that highest will be in water, then air, then soil. Okay, water में जैसा ना तो क्या निमोनिक क्या बन गया? Was 4:2:1. 4:2:1. Rate of falling of temperature is maximum in water, then in air, and lowest in. Dr. Nagarjuna, see, I'm not teaching you rate of decomposition where the ratio is 1:2:8, right? This is a rate of fall of temperature, right? Rate of fall of temperature. Don't get confused. This is a rate of fall of temperature. This is not 𝗏𝗃's dictum. This is not rate of decomposition. I hope this is clear to all of you. Hana? Chalo. Okay, postmortem caloricity, very, very important. Postmortem caloricity. Please remember this one. And okay, whenever there will be disturbed heat regulation, like in sunstroke or the pontine hemorrhage, heat production because of the muscle conversion, like the strychnine poisoning or the tetanus, septicemia mein jahan pe bhi hoga, right? Now we are going to learn about liver mortis. Liver mortis means what? Staining. Postmortem staining, postmortem lividity, or you can say what? Discoloration. So after death of a person, what is happening here? See, the blood circulation will be stopped. Right? Blood circulation will be stopped. Right now, blood circulation will be stopped. So there will be what? There will be a stagnant blood vessel. There will be a stagnant of blood circulation in the blood vessels, and after that, what is happening here? Due to gravitational force, okay, blood will come into the smaller blood vessel like venules and the capillaries, and because of that, over the superficial skin you can see some discoloration. So what is the normal color after death? Normal color after death kaun sa hai? Okay, that will be either blue color or the purple color, right? Purple color. Okay, see here. And see here, you can see here. See, like this is actually what? See, like this part, what I'm showing you here, no? And ye sara kya? See, like all these part of what? Lividity, right? No? But here there was some compression. Right? Because of that, there is no discoloration. This is called what? Postmortem lividity, staining, sugillation and all. Sugillation is also the synonyms. Okay, fine. Now, please understand that they're asking that. See, sometimes they will be asking you, suppose if you are receiving a dead body, and you can see that discoloration is over the neck, over the back part. Patient was lying in supine position or prone position. Over the dependent part of the body, there will be discoloration. है ना? तो अगर पीछे में back side, तो it means what? Patient was in supine position. If you see discoloration over face and the chest and anterior part of thigh, then patient was in supine position or prone position. Patient was in prone position. No, most important question what they're asking that, what will be the color of staining? What will be the color of postmortem changes in hanging? Dependent part kaun sa hai yahan pe? Dependent part, hands and legs. This is called a what? Glove and stocking pattern. This is your question. Glove and stocking. In which condition you do not see lividity? If there will be drowning in running water, because there will be the continuous up and down of the body. Fine. Yes, now very, very important topic from where every time you are getting question. What is happening here? See, like in different poisoning, what about the discoloration? See, the discoloration is all related to hemoglobin only, right now. See, then normally because of the deoxyhemoglobin, there will be bluish color or purple color. But what about carbon monoxide and cyanide poisoning? Please understand that. Repeatedly asked question. This table you are not going to forget. I'm telling you, this table is very, very important. Okay, Dr. Sayan Shah, lividity is same thing only, no? Staining only, right? Okay, now you have to remember this part here. See, CO poisoning mein kya hoga? CO poisoning mein what is happening here? Like see, oxygen and hemoglobin. CO is going to take hemoglobin away, and after that there will be decreased oxygen carrying capacity. Oxygen is available, but it is not being used. So because of availability of oxygen, okay, like there will be, what will be the discoloration? Cherry red color in CO poisoning. Cyanide poisoning, there will be what? There will be a blockage of cytochrome oxidase enzyme. Oxygen is available, but the tissues are not able to use it. That's why, because of the presence of oxygen, this will be bright red color. Bright red color. Okay. Hypothermia, there will be the pink color, bright pink. What about potassium chloride? What about aniline and nitrate? There will be a formation of the methemoglobin, right now. So there will be chocolate brown. Aniline, deep blue. Hydrogen sulfide, H2S will mix with hemoglobin, right now. So there will be what? Hydroxysulfide hemoglobin, right now. So there will be green color, bluish green color. Opium poisoning, black color. Septic abortion, there will be bronze color. See, this table is very, very important, repeatedly asked question. Okay, see here, which type of hypoxia is seen in CO poisoning, which type of hypoxia is seen in cyanide poisoning. See, I have explained you all this part before also. Okay, just to revise, what is the answer? CO poisoning mein anemic hypoxia hota, right? I already have explained you before. Cyanide mein histotoxic hypoxia, right? Histotoxic hypoxia. Please understand that lividity will be absent. Lividity will be absent in the fast flowing water, or if there will be what? Severe hemorrhage. Okay, see here, and please understand that. See the part which is in the direct contact with the floor. There you are going to see, like there you will, so there you will be seeing there is no discoloration, right? So that is called what? Pressure pallor. What about this one? Before death, if he was wearing a belt or anything, any bands, okay, like in that part there will be no discoloration. This is called what? 𝗵𝗿cies. Now next is called a rigor mortis. Rigor mortis is very, very important related to your exam. Please understand that rigor mortis. See, rigor mortis mein kya hai? See, there will be a stiffening of dead body. Why there is a stiffening of dead body? Please understand that first of all, just after their death, there will be the primary relaxation of body. There will be primary relaxation of dead body, right? Okay. See, first of all, there will be first of all, there will be primary relaxation of dead body. First of all, see, like at this time there is, what? 100% ATP. At this time there is 100% ATP, and what is happening here? Actin and myosin, these two muscle protein are separated. Fine. So there is relaxation. After some times, there will be a fall off. Okay, there will be a destruction of ATP for sure. Fine. When ATP level is falling 85% to 30%. Now, when ATP is falling at that time, actin and myosin, this will make a component. This will come together, and because of this, there will be what? There will be rigidity. This is called as rigor mortis. But after some time, there will be 100% depletion of ATP. There will be what? After that, there will be dissolution of, after that, there will be dissolution of all the muscle proteins. Fine, no? So then again, there will be secondary relaxation. So this is the normal rule of rigor mortis. Okay, first of all, there will be primary relaxation, then there will be rigor mortis, then there will be secondary relaxation. Each and every part of the body is getting involved. Okay, no? Fine. There is a rule that is called as the Nisten's rule. There is, first of all, we are going to understand rule of 12. What does it mean? Rule of 12. What does it mean? See, it takes approximately 12 hours to appear. It takes approximately 12 hours to persist, and 12 hours to disappear. Fine. Okay. See here, some other names of the rigor mortis is cadaveric rigidity, postmortem rigor and all stiffening. All right. So now the question is that, okay, how there will be the involvement of muscles? How there will be involvement of muscles? Please understand that repeatedly asked question. In a rigor mortis, there will be involvement of both voluntarily as well as involuntary muscle. Voluntary में है ना? तो please first of all always understand that. First, always there will be involvement of heart muscle. Heart muscle. Involuntary. After that, if they are asking that, which muscle is having which external muscle is having the earliest involvement in rigor mortis? Answer is eyelid, eye muscle, eyelid. ठीक है ना? Okay. Okay, now there is something which is called the Niston's rule. See, first of all, there will be involvement in eye muscle. Eye में होगा, ठीक है? तो उसके बाद से remember, after that there will be involvement of the jaw muscle, या फिर मतलब neck में रख लो जैसे ना, उसके बाद से neck याद रखो, neck, ठीक है ना? Okay, fine. After that, after the thorax, then upper limb, and then abdomen, and then lower limb, and then hands. Hands will be last. Hands will be last. So what is happening is कि rigor mortis जैसे appear होता है, in this same way there will be disappearance also. Please understand that, है ना? कुछ ज़्यादा याद करने की ज़रूरत नहीं. First of all, you remember that, okay, rigor mortis, है ना? Rigor mortis, always remember कि first muscle to be involved in rigor mortis is eye, eyelid, external, but internally heart. All right. After that, last, hands and feet. Hands and feet. Copy. This is more than enough. Okay. Fine. Rule of 12. देखो, rule of 12 का क्या है कि see, this takes approximately up to 12 hours to appear. Approximately 12 hours to persist, approximately 12 hours to disappear, but it takes approximately 6 to 12 hours to complete the rigor mortis. Okay, chalo, fine. 6 to 12 hours, 6 to 12 hours. Okay, now next very, very important point from where they are asking the question. One is called as what? Cadaveric spasm. Okay, no, spasm. Okay, see here, like there are some situations which simulate like a rigor mortis. One is called as cadaveric spasm. Okay, second is called as heat stiffening. What is the meaning of heat stiffening? Okay, whenever like there will be burns because of the temperature more than 65 degrees centigrade. More than 65 degrees centigrade. So what is happening here? Like in this case, what will be the attitude of patient? Attitude of dead body will be like the pugilistic attitude. Pugilistic attitude. Okay, fine. This is also called the defensive attitude. Okay, defensive attitude. Okay, defense. This is also called the boxing attitude. है ना? Boxing attitude. Boxing attitude. Okay, na defense attitude. This is also called a pugilistic attitude. So why it is happening? Due to muscle protein coagulation. Muscle protein coagulation. Okay, fine. So whenever a dead body will be thrown in ice or maybe in Antarctica like place, fine, there will be cold stiffening. Whenever there will be solidification of fat and gas stiffening, gas. After death, okay, there will be so many bacteria in our gut, fine, no? And after that, they are going to release so much of the gases, right? So much of the gases like hydrogen sulfide, methane, and all, fine. Because of that, there will be stiffening. See, out of these four, most important point which we are going to learn, that is called as cadaveric spasm. Cadaveric spasm. Okay, na? Cadaveric spasm. Remember this part here. See what is happening here. See this part. Picture number 1 and picture number 2. Picture number 1 and picture number 2. Okay, just before the death, if a person was going to kill himself, if the person was going to kill himself, see what is happening here? Only a particular group of muscles. Only a particular group of muscle is involved. What is happening here? Just after the death, what is happening here? Just before the death, if the person was struggling with something, he tried to kill himself. When he pulled the trigger, suddenly after that, there is 100% spasm of only the group of muscle, only the hand muscle. So is there any primary relaxation? No primary relaxation. Without primary relaxation, there is sudden contraction of only the voluntary muscles. This is called as cadaveric spasm. Cadaveric spasm. Even in a case of the drowning, you can see that yes, before death, he was struggling to hold something. He could hold only some plants. This is called as cadaveric spasm. Cadaveric spasm. Easy to understand? Okay, it is called a what? So what is happening in just after death? So this will give you what? Ante-mortem sign. There is no primary relaxation phase, only a group of voluntary muscle. How to differentiate cadaveric spasm from rigor mortis? In rigor mortis, first of all, there will be primary relaxation, then there will be secondary relaxation. Here, directly spasm. Rigor mortis, voluntary muscle, involuntary muscles, all are involving. In cadaveric spasm, only the work which was at the extreme of work, strenuous work, right? Only voluntary muscles, only a group of muscles. Rigor mortis, entire body is involved. Cadaveric spasm, only the voluntary muscles which were at the work. That's it. It is called a what? Instantaneous rigor. Instantaneous rigor. See, it cannot be produced artificially. Okay, now we are going to learn about late signs in postmortem changes. Please understand that. See, basically we are going to learn about putrefaction or decomposition. See, if there will be warmth, moisture and airflow, all these three are there, so then there will be putrefaction. If there will be warmth and moisture, absence of airflow, temperature is warm and there is moisture. Okay, no airflow, there will be formation of what? Adipocere formation. Adipocere formation. Warmth is there, airflow is there. No moisture. Okay, good part. But what is happening? Because of the airflow, there will be what? Evaporation of body fluids, mummification, drying of dead body, Okay, so autolysis means what? Autolysis means no bacteria involvement, self breakdown by lysosomal enzymes, right? Decomposition means what? Because of the bacterial involvement. Fine. They are asking that which bacteria is most commonly responsible for this? Clostridium welchi. Which enzyme? Lecithinase enzyme. Now the question what they're asking that, okay, see, whenever you are going to see the decomposition or the putrefaction changes, take a putrefaction changes, where you are going to see the first external sign of decomposition, you are going to see over right iliac fossa, There will be greenish discoloration over right iliac fossa. First external appearance of putrefaction over right iliac fossa, greenish discoloration, but internally there will be what? Aortic intima discoloration. Why green color? Because of H2S production by bacteria. Why right iliac fossa? Because cecum is superficially lying. Okay, see here, see whenever there will be, hydrogen sulfide is going to mixed with blood, and whenever there will be what? Sulfahemoglobinemia. So there will be greenish discoloration of blood around the blood vessels. See these pictures. This is called as what? Marbling. Marbling, something like marble appearance. No, marble appearance. Okay, so time of appearance is 36 to 48 hours. Marbling. This can be your image based questions. Okay, fine. Now the question is okay, which is the first organ to get involved in putrefaction, in decomposition? Always remember, first is larynx. Larynx. And the trachea, earliest organ to be involved. After that, please remember the sequence. See, rigor mortis में तो ऊपर से जैसे आया वैसे नीचे से चला गया, तो rigor mortis was easy to remember. But here you have to remember the sequence of organs involvement here. Sister Lucy Beautiful Heart. Okay, this mnemonic I have got from a senior faculty. Okay, Sister Lucy Beautiful Heart, like a stomach, intestine, and spleen. Okay, like a stomach, intestine, and spleen. Then liver and lungs. Beautiful heart, brain and heart. Brain and heart. Okay, now brain and heart. After that, kidney. In male, last internal organ. Okay, now last actually like visceral organ. In male, it is prostate. In female, it is uterus. Please understand that, like in general, last organ to putrefy, that is what? That is actually bones. Okay, now please understand, yeah, here you should not be able to confuse. Oh, this is called a what? 𝗏𝗃's dictum. What is the meaning of 𝗏𝗃's dictum? See, like when a body is kept on floor, on earth, or means like in air or in water or inside the earth, or if it is buried, fine, no? Please understand that a body decomposes in air 2 times faster as in water and 8 times faster as in earth. Okay, now so you can say that, see, basically I'm going to compare it to 1 week of putrefaction of air will be equal to 2 weeks in water, will be equal to 8 weeks in soil. So remember this one, AWE, air, water, earth, all. Air, water, earth. Was किसका mnemonic था? Was water, air, and soil. Rate of fall of temperature. Oh, air, water, and earth. Air, water, and earth. Right now, so this is 𝗏𝗃's dictum. 𝗏𝗃's dictum. Okay. Now see here some points related to adipocere and mummification. See this picture. See what is happening here. There is no airflow, but there is a warmth. Warmth and moisture. Warmth and moisture. Because of this situation is like this. This is called a what? Saponification or adipocere formation. Adipocere formation. So do you think this will be smelling or not? Yes, this will be smelling bad, like ammonia. Like ammonia or rancid butter. Ammonical smell or sweatish smell or rancid butter smell. Okay, this will take approximately 3 weeks to 6 months. Okay, fine. But what about mummification? What is happening here? Dry, hot climate, airflow is present there. Okay, so what is happening here? There will be what? Evaporation of body fluids. So there will be loss of body weight. 70% body weight will be lost. Okay, what is happening here? Will there be any smell? No smell, odorless, odorless. This will take approximately 1 year to complete. This is called a what? Mummification, mummification, mummification. Okay, fine. So 2 chapters are over. Now we are going to start with asphyxia. Okay, no? Sir, putrefaction, decomposition, है ना? Putrefaction. तो डिकम्पोजिशन अर्लीस्ट इन द लैरिंक्स एंड द ट्रैकिया, नो, वो उसका था साइन था कि ग्रीनिश डिस्कलरेशन, दैट वाज द फर्स्ट एक्सटर्नल साइन विल बी ओवर राइट इलियक फॉसा. इंटरनल साइन ऑफ पुट्रिफैक्शन विल बी डिस्कलरेशन इन द aortic intima. Right now, fine. Chalo, fine. Now we are going to start the 3rd chapter, asphyxia death. Okay, no, asphyxia death. No need of that much. Different timings for different organs in the transplantation. See, if you are mostly they are not going to see how much I am teaching you. This is good for revision. Okay, no, see, I'm teaching you only the most important topics. I'm teaching you only the most important topics from where you will get the question. Okay. See, I will be teaching you up to 8:30. Okay, 8:30. Okay, 8:30 or 8:45. Now we are going to learn about asphyxia death. Asphyxial death means what? Asphyxia, obstruction of respiratory tract, means lack of oxygen supply. Okay, no? Lack of oxygen supply. So either what is happening here, so what we are going to learn, please understand this part here, that see, like if there will be neck compression with suspension of body is suspended in air. Okay, no? So like there will be hanging, for sure, hanging. Okay, either hanging, judicial hanging, or a lynching. What is the meaning of lynching? Means when a person will be hanged by a mob. When a person will be hanged by a mob. Okay, no? By a mob. Okay, what is happening here? Like suppose if there will be neck compression and body is not suspended in air. Okay, no? Fine. Okay, so now I can say this will be what? Strangulation. 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 Someone else is standing at your back, he's going to strangulate you by a ligature material, by a rope. Or if he's going to suffocate you. Okay, suppose if you're going to constrict your neck with his hand, that is called the manual strangulation. Manual strangulation. That is known as the manual strangulation. All these parts we are going to complete like one by one. Okay, no? But if there is no neck compression, no hanging, no body suspension, then it will be called as what? Suffocation. Suffocation I will teach you separately, when your nose will be blocked, your mouth will be blocked. Fine. Okay, we are going to understand one by one. So first of all, hanging part. Hanging part. Please understand that first of all, okay, based on the position of knot. Okay, based on the position of knot. See, if knot is placed at the nape of the neck centrally, है ना? Okay, ligature का जो knot है, if exactly at the occiput, this is called the typical hanging. This is called the typical hanging. Okay, this is called as typical hanging. Okay, now this is only typical hanging. Apart from occiput, anywhere else, like angle of mandible and submental position, this is called as atypical hanging. Atypical hanging. Please understand that when I ask you in India, judicial hanging, knot will be placed where? Knot will be placed at angle of jaw. Angle of jaw. Okay. And what is the meaning of the complete hanging and partial hanging? Complete hanging and partial hanging. If body is 100% suspended in air, none of the parts of body is going to touch the ground or any part of surrounding. 100% in air, it is called as complete hanging. All these, any part of the body is going to touch the ground, it is called the partial hanging. Partial hanging. Okay, no? Partial hanging. Fine. Now the question what they are asking, that what kind of question they are asking, that see, in case of complete hanging, what will be the force of constriction? Weight of body. And what about partial hanging? Force of the constriction will be what? Weight of head. Old question. Okay, see here, ये बताओ A and B. Which one is the partial hanging? A is complete hanging, B is partial hanging, right? A is complete, B is partial. Very good, very good. Okay, now what will be the, okay, what are the post-mortem changes? Please understand that whenever there will be hanging, whenever there will be compression over the neck, please understand that, okay, whenever there will be compression over neck, there will be signs of the congestion over face. Okay, red spots will, petechial hemorrhages will be there, tardive spots will be there. Okay, over eyelid, over conjunctiva. Red jo dikh raha na, red jo dikh raha, this one. Okay, now this is what? But this red part is what? This red part is tardive spots. Important point is what? See what is happening here, like there will be surest sign of antemortem hanging, that is called as a dribbling of saliva. Dribbling of saliva, this is surest sign of hanging. Surest sign of hanging is dribbling of saliva. Dribbling of saliva. See why there will be dribbling of saliva, because just before the death, just after compression, what is happening here? Okay, in hanging, okay, the neck, okay, there will be compression over salivary glands, over mandibular glands. Because of that, there will be irritation over salivary glands, and there will be excessive salivation. So dribbling of saliva, this is what? Surest sign of antemortem hanging. Next is called as 𝗵𝗵𝗶𝗃. 𝗵𝗵𝗶𝗃 means what? See what is happening here? Whenever there will be compression of cervical sympathetic chain, now what is happening here? Because of that, same side eye of knotting, ipsilateral side, I will be open only. This is called as 𝗵𝗵𝗶𝗃. 𝗵𝗵𝗶𝗃. 𝗵𝗵𝗶𝗃 is also what? Antemortem sign. Dribbling of saliva, surest sign of antemortem hanging. What about ligature mark? Ligature mark, if there will be complete hanging, right now, agar complete hanging means what? See, like what is happening here? Therefore, see, like suppose if a person is going to be hanged like this, right now, see here, remember this part here. So like if a person will be hanged like this, see, now you tell me this is suprathyroid, infrathyroid, this is suprathyroid, this is oblique only, right? And this is going up like this, this is oblique. And you know one thing, here you can see some ligature mark, but what about at back side? Here it is incomplete. Here it is what? Incomplete only, right? Here it is incomplete, means around across the neck, 100% neck there will not be. At 100% neck there will not be the ligature mark, right? So remember IOS. Incomplete ligature mark, oblique ligature mark, suprathyroid ligature mark. Suprathyroid ligature mark. देखो ये समझ में आ रहा है यहाँ पे? See here, this is suprathyroid. First of all, this is what? Suprathyroid. This is what? Oblique. है ना? And see, this part is remained. This is what? Incomplete. So see, ligature mark of hanging and strangulation, you are not going to forget. Okay, no? Ligature mark of hanging and strangulation, you are not going to forget. Very good. See, now let's talk about judicial hanging. है ना? Judicial hanging, we are going to learn. Judicial hanging means what? है ना? जो कि यहाँ पे judiciary के according, what is happening here? So this will be what? This will be actually atypical type, and knot will be placed at angle of jaw. And what is happening here? There will be jerky movement over cervical bone. Okay, cervical bone. Which vertebra? C2 vertebra. So in a case of hanging, there will be a fracture of vertebra, right? This is called a what? Hangman's fracture. Hangman's fracture, right? Okay, hangman's fracture. Okay, please understand that if there will be suicidal hanging, if there will be homicidal hanging. Homicidal means someone else is going to ligate and after that he is going to hang. Whenever there will be suicidal hanging, no, see, ligature mark will be incompleted only. Okay, incomplete ligature mark. But if someone else is going to ligate around, ligature around entire neck, it will be there. Okay, see, this will be oblique, but what is happening? Ligature mark around entire neck, it will be there. Fine. So that is homicidal hanging. Now we are going to learn about a strangulation. A strangulation means what? Body is not suspended in air. Body is not suspended in air. Someone else is going to constrict your neck with the help of a ligature material like a rope or belt or with his hand. Okay, so a strangulation can be ligature. This can be manual. Manual bole to throttling, right? Throttling. One by one, we are going to understand. This is called as what? Manual strangulation. Manual strangulation. Okay, fine. Please understand that. So how we are going to understand it? See, if there will be ligature strangulation, now someone else is standing behind me. He is going to constrict my neck like this. Okay, ऐसे करेगा कोई भी, right? No, ऐसे. Fine. So how to differentiate? So now you tell me. So now, okay, see here, hanging will be, ये बताओ कहाँ पे होगा? This is suprathyroid, infrathyroid. This is infrathyroid. ठीक है? This is oblique or this is transverse. Okay, na पूरा horizontal जा रहा, right? Transverse only, right? Okay, transverse in, okay na? And this will be, see here, now this will be incomplete or complete? Fully complete, fully complete. Infrathyroid, transverse and complete. You remember here what? ITC. Infrathyroid matlab below thyroid, right? Below thyroid, below thyroid, below thyroid, right? And this will be 100% encircling it. Okay, encircling it. In this way you can differentiate hanging and strangulation. देखो देख के समझ में आ रहा है? See here, hanging में this will be going what? Hanging में this will be going like this, no? Oblique but incomplete. Okay, strangulation में full complete, right? 100% complete, right? Complete, right? Complete. Infrathyroid, infrathyroid. Easy to understand? Easy to understand. Last time there was the question how to differentiate complete hanging and partial. देखो, see, now you are able to differentiate hanging and strangulation on the basis of ligature mark, right? है ना, सब कर लोगे आप, right ना? Okay, fine. See, last time there was a question related to how to differentiate. How to differentiate if there will be complete hanging, or if there will be partial hanging. See here, like this will be like in the complete hanging. What is happening here? C2 vertebra, Dr. Nagarjun. C2 vertebra, C2 hangman's fracture, C2 vertebra, hangman's fracture, C2. Okay. अच्छा, okay, what about the, okay, what, how to differentiate partial and complete? तो यहाँ पे तो है IOS, suprathyroid, oblique and infrathyroid. What about partial? Partial में क्या होगा ना कि this part will come, है ना, partial में head will go like this, no? So this part will come down, this part will come down, this part will come down. So this will become what? Here it will become what? Infrathyroid. Here it will become infrathyroid, and oblique की जगह पे this will become, line will become horizontal. Fine. Okay, बस इतना काफी है. See, in this way, like in this way, you can solve all the questions. Okay, now you see the picture and you answer me 1, 2 and 3. देखो ये बताओ. Okay, one more important one. Chalo, wait for one time. See, dekho here. See, whenever there will be manual strangulation, so what will be the signs over here? No, what will be? Means someone else is going to clamp like, someone else is going to constrict like this. So there will be bruises for sure. है ना? यहाँ पे there will be abrasions over the neck. है ना? There will be signs of a struggle there. Abrasions will be there. Okay, there will be 6 penny bruises will be there. No, 6 penny bruises. 6 penny bruises will be there, right? Okay, so means all struggling signs you are going to see over the neck. That is called the manual strangulation. Now you solve this question. Picture number 1 क्या था बताओ? Yes, very easy to understand. Picture number 1 is a strangulation, manual strangulation. Fine. Picture number 2 is hanging. Picture number 3 is what? Picture number 3 is ligature strangulation, right? Ligature strangulation. Picture number 3, right? Chalo, very good. Okay, now please understand that. Please understand that. See here. Suppose if someone is standing at your back and someone is going to throw a rope, because someone is going to throw a rope from the behind and going to constrict your neck. This is called as, this is known as the garroting, है ना? Okay, there is one subdivision of garroting or type of garroting around the neck. Around the neck, iron collar will be applied. Iron collar will be applied, and then there will be constriction. This is called a what? This is called as a Spanish windlass. This is called as Spanish windlass. This is called a Spanish windlass, which is a type of garroting. What about if 2 sticks are placed around your neck, and then there will be compression of neck. Okay, so sticks में है ना, जो bamboo याद रखो, बांस को, this is called as what? बांसडोला. बांसडोला. This is called as बांसडोला. Around the elbow, if someone is going to compress the neck, this is called as what? Mugging. Mugging. This is called as mugging. Okay, fine. Okay, now please understand that. Very good, very good, very good. So strangulation and hanging, I hope this is clear to all of you. IOS, incomplete oblique and 𝗧𝗲𝗹𝗶𝗯𝗃 thyroid. And yes, both sides, like it will be symmetrical only, symmetrical. Okay, now fine. This will be below thyroid, ITC, remember, ITC, infrathyroid, transverse or horizontal, or this will be complete and continuous. Okay, see, sometimes they will ask you this kind of question that, see, like, okay, see, hyoid bone fracture is like this, hyoid bone fracture is like this. So whenever someone is going to do like this, wo to andar ki taraf dabayega na. So whenever there will be manual compression, there will be what? Adduction fracture of bone like this, adduction fracture of bone like this. This is in the manual strangulation, but hanging mein, this will go outward, abduction fracture. This will go outside. So this is what? Hanging. This is what? Manual strangulation, right? This is the throttling. Okay, fine. See what is happening here now. We are going to learn about suffocation deaths. Very, very important. Suppose if I'm making a picture of a person. Okay, this is a face. समझ जाओ बस, है ना? See, if someone is going to block your external respiratory passage like nose and mouth, okay, no? This is called as what? Smothering. Okay, but if internal respiratory passages are being blocked, if it is accidental, it is called as choking. But if intentionally someone is going to push a paper bag or a cloth, roll of cloth inside your mouth, and he's going to block your respiratory passage, that is called a what? Gagging. And that is called as gagging. See, okay, no, that is called a what? Gagging. Very good, very good. So smothering means what? Whenever there will be blockage of nose and mouth. So what I'm saying that in a case of a smothering, abrasion and laceration will be over face or over neck. Face, over face, around the lips, around the nose, over the chin. Over the face, around the lips and all. Find a smothering may. But whenever there will be manual strangulation, their signs of a struggle will be over the face, over the neck. Over neck only, right? Over neck. Very good, very good. Okay, fine. And what about the barking method? Barking method abhi bataunga abhi. Chalo, usse pehle this one. See, asphyxia due to any accident. Asphyxia, what is happening here? Okay, whenever there will be building collapse, fine, no? Any building collapse, road traffic accident, fine, a road traffic accident, collapse of wall, railway accident. What is happening here? So when a very, very heavy object is over the, like a very, very heavy object, which is over the thoracic cavity of a person, over the chest of a person, after that he is not able to breathe in and out. Mechanical obstruction by a heavy object in any accident. This is called a what? Asphyxia due to trauma. Fine, no? Okay, fine. So what is happening here? There will be around this part, there will be what? There will be bluish discoloration. There will be ecchymosis. Okay, mask of ecchymosis, which is called as mask ecchymotic. Please understand that what is the method of the barking here? Okay, but two friends are there. There are the two friends who invited one person whom they want to kill. Fine. And after that, okay, that invited person is being offered He's being offered alcohol. He drank. After that, one friend is sitting on the chest and he's blocking his nose and mouth, and one person is pulling his leg and roaming around the room. Okay, so this is called the Burking method. This is a combination of a smothering, and romantic asphyxia. This is called the Burking method. Okay, fine. See, if a person who is sitting in a cafe, if a person who is sitting in a restaurant, who is enjoying food, he's also having alcohol, and suddenly there will be accidental choking by food, bolus of food obstructing what? Larynx. And because of that, what is happening? There is sudden reflex cardiac arrest. Okay, because of the stimulation of the laryngeal nerve endings right now. And see, like he will be falling on the ground. And after that, he will be having all the symptoms like heart attack. So what is happening here? This is called a what? Café coronary. Just after having food, just after obstruction of the lungs by a bolus of food, okay, suddenly he collapses. Suddenly he is turning into blue while eating. This mimics like what? This mimics like heart attack. This is called a café coronary syndrome. Overlying. Suppose if a mother who is sleeping with her neonate baby, and while sleeping, if there will be compression of, okay, no? See, if there will be compression. Okay, so while sleeping, if compression by mother to a baby at that time, that is what? Overlying or compression suffocation. Okay, now you tell me here, the picture number one mein ye batao. See here. Picture number 1 and picture number 2. Here, picture number 1 क्या है? बताना जरा. Picture number 1. Yes, picture number 1 is what? Very good. Picture number 1 is manual strangulation. That is the throttling. Picture number 2 is smothering. Yes, over the face, around the lips, around the nose. Picture number 2 is smothering. हाँ, जैसे तकिया से भी जो करते हैं ना, smothering, right? Even with pillow. Okay, now the last topic which we are going to learn here, that is called the drowning. Pani mein dubna. See what is happening here. Okay, there are the two types of drowning. One is called the typical drowning. Another is called a what? Atypical drowning. See, the typical drowning means what? When water will enter into the lungs, and after that, this is going to replace the air. Okay, no? Fine. So, and after that, this will come back also. What is happening is, so when water will enter into the lungs, okay, then only what is happening here? Okay, you can see that there will be some discharge of the fluid from the mouth. Okay, there will be frothing. So this is called the wet drowning. When water enters into the lung, that is called a what? Wet drowning. That is called as wet drowning. Okay, fine. That is called the wet drowning. So this will be seen, in the freshwater drowning and the saltwater drowning. Okay, fine. So what is happening? How to differentiate freshwater drowning and saltwater drowning? This is the question. Freshwater and saltwater drowning. See what is happening here. So how you are going to check? You are going to compare. You are going to measure the amount of sodium chloride. Okay, no? Fine. Salt water mein, what is happening? Even in our blood circulation, in heart chamber, for sure, there will be some chloride, right now? Fine. So if a dead body is recovered from water, we don't know whether it is recovered from fresh water or salt water. So if we are going to compare the salt content in our blood circulation or chloride content, okay, what is happening here? See, always this is the normal physics, normal chemistry, that okay, a flow of material from the higher concentration to the lower concentration, right? And SI hota, right? Okay, fine. So if in our blood circulation or in our left ventricle, if the chloride content is lesser than the normal, so it means what? Body is recovered from fresh water. If there is more content is there, then this will be what? Salt water. I hope this is clear to all of you. Atypical drowning, what is happening here? Water did not enter into the lungs. Water did not enter into the lungs. But what is happening here? After that, patient is dying. What is happening here? So that is called the dry drowning. 4 types of atypical drowning are there. We are going to understand one by one. Okay, see here. First is the dry drowning. See what is happening here. Okay, water does not enter into the lungs. Okay, water does not enter into the lungs. Yeah, chloride testing is called as ये अच्छा चलो ठीक है. See here, what I have taught you here, this is the chloride testing, right now, chloride testing. This is called what is the name of this test? Okay, this test is called the Gsell's test, right? Gsell's test. Gsell's test. Diatoms is 100% different. That I will teach you very shortly. Okay, fine. So there are 4 types of atypical drowning. 4 types of atypical drowning. One is called the dry drowning. What is happening here? Water does not enter into the lungs. What is happening here? Okay, whenever there will be sudden inrush of water into nasopharynx and larynx. Now, whenever there will be sudden inrush of water into nasopharynx. After that, there is sudden laryngeal spasm, and after that, water is not able to enter into the lungs. This is called a dry drowning. But look, laryngeal spasm is there, and after that, patient will die for sure, right? Now, laryngeal spasm. Immersion syndrome or hydrocution. See what is happening here. If a person, suppose if a person, like if there will be drowning in cold water, what is happening here? There is what? Okay, stimulation of nerve index. There will be what? Sudden cardiac reflex. There will be vagal inhibition of heart, and patient will die. This is called a what? Immersion syndrome, hydrocution, submersion inhibition, or you want to say like this will be vagal inhibition. Submersion of unconscious. Okay, before drowning, if a person was unconscious, like maybe because of hypertension, maybe because of epilepsy, maybe because of heart attack, or maybe if he or she was drunk, after that if he's getting drowned, this is called as what? Submersion of unconscious, right? Okay, next part is called the near drowning. Secondary drowning syndrome means what is happening here. First of all, a person had the drowning, okay, no, means like he was drowned, and after that he was saved. एक बार पानी में डूब करके वो बच गया. But after that, he is having multiple complications because of the drowning. After that, he is dying. After that, okay, due to complication of submersion, he is dying at a later stage. That is called as near drowning. Okay, see, postmortem appearances kya kya drowning. Please understand that. Repeatedly asked question, washerwoman's hand, cutis and serina, goose-like skin. This one. Okay, this is like a washerwoman's hand. See, this type of question was, a similar question was asked in recent NEET PG. See here, goose-like skin, piloerection here. Okay, no? Fine. All these are seen in the drowning. Even suppose after drowning, if you see a person that he is holding some grass weeds in his hand, that is called a what? Cadaveric spasm. Okay, next is called a what? Diatoms test. See, this is very, very small, microcellular, 60 micron is ka size. This is what? Algae, unicellular algae. These are what? Unicellular algae. So if a person is going to drink the water during the drowning, at that time, what will happen? Okay, like say this can enter into systemic circulation, and this will be, okay, these are going to be deposited in the systemic circulation. Even after decomposition of the dead body, if you are going to do the examination of dead body, if you are able to find out diatoms. So the question they're asking that, which one is the best specimen from where you can do the inquiry of diatoms? Okay, best bone, you have to do bone marrow aspiration right now. So femur bone is best. Okay, now, so if you are able to find out diatoms, then 100% yes, patient was, or the dead body was 100% drowned. Atoms test 100% specific to drowning. Gettler's test, drowning. Okay, now washerwoman's hand, cutis and serine, drowning. See if you can solve this question. This is more than enough to understand everything. Can you solve this question? A person was found dead in bushes with tied arms and legs. This was the old question only, MCI question, FMG August. She was dead in bushes with tied arms and legs. So this was the case of homicidal for sure. Someone else killed him. On postmortem exam, his face was deeply congested, cyanosis and all. Okay, na? Okay, Sanjay. So these are signs of what? Asphyxia. Asphyxia. Okay. Abrasions and nail marks were marked on chin, face, and nostrils. Lips were lacerated. Hypostasis was fixed on back, and rigor mortis was seen all over the body. Rigor mortis was seen all over the body. It will be completed. It will be completed within 6 to 12 hours, right? Hypostasis was fixed 6 to 12 hours. So duration of death is within 24 hours from postmortem examination, right? Find out the wrong statement. See, is it throttling or a smothering? Yes, this is a case of a smothering, and this is not a case of the throttling. Okay, this is not a case of the throttling. Fine, easy to understand. So here the wrong statement will be B only. The wrong statement will be B. है ना? देखो यहाँ पे जब भी अगर मैनुअल स्ट्रैंगुलेशन होगा, सिचुएशन विल बी लाइक दिस, राइट? सिचुएशन विल बी लाइक दिस. Okay, fine. So we can stop here now. We completed 3 chapters today. So tomorrow. No, tomorrow, no, actually so many students are there. So like they want to stop. So tomorrow after pharmacology, Dr. Salman will finish in 4 or 5 hours only, hardly 4 hours. So like he's going to start. He's going to start in morning only. So after pharma, I will start forensic tomorrow. Like I need more 3 to 4 hours. Okay, to finish it tomorrow. So after pharma, you will be having 1 hour lunch break. Then we can start online only. Okay. Okay, then see you tomorrow. Okay, see you tomorrow. Okay, thank you so much. See you tomorrow. All right. Dr. Pradhuman, वो सब क्वेश्चन नहीं आता, क्लासिकल एंड ऑल. ओके, या डायटम्स नहीं, डायटम्स जहां पे किसी में भी आ सकता है वो. ओके, ओके देन चलो, सी यू टुमारो. बाय बाय.